Welcome, and thank you for tuning in to a special live stream of our Fighting Back series, including 5 incredible panels that were originally broadcast earlier this year. My name is Andrew Schaefer, and I am the Director of Development and Communications at the GLBT Historical Society. Today is World AIDS Day, a time when communities across the globe remember those we have lost and take renewed action to address the ongoing AIDS epidemic. The archives of the GLBT Historical Society hold the memories of countless lives lost, as well as heroic stories of those who have fought for better medical treatments, visibility, and justice. We believe that our history is our greatest asset in fighting for a better future, and our Fighting Back series is one of the many ways we draw on the past to take action in the present. Today is also Giving Tuesday, a global day of generosity. As a community based institution, we rely heavily on the support of our chosen family to preserve and share decades of irreplaceable history held in our archives. Every contribution made today to the GLBT Historical Society will be matched, dollar for dollar, allowing your donations to go twice as far. You can make your contribution by visiting glbthistory.org/donate or by texting GLBT to 243725. Your donation helps us meet our mission to collect, preserve, exhibit, and make accessible to the public materials and knowledge to support and promote understanding of LGBTQ history, culture, and arts in all their diversity. With your support, we can preserve and share our irreplaceable historic materials, from locks of a long deceased lover's hair, to outlandish costumes, to personal diaries, photos, videos, and oral histories to document decades of LGBTQ life. Before we begin today's program, I want to share just a few highlights from our collection. We hold over 200 boxes that document decades of activism and community building by Phyllis Lyon and Del Martin. They co-founded the first lesbian rights organization in the US, the Daughters of Bilitis, and helped to found multiple other organizations, including the Council on Religion and the Homosexual, Citizens Alert, the Alice B. Toklas Lesbian and Gay Democratic Club, and the Bay Area Feminists Against Censorship. They were also the first same-sex legally married couple in San Francisco. We hold thousands of documents, photos, costumes, and flyers that document Jose Saria's truly unbelievable life. He was the first known openly LGBTQ candidate for public office in the US, founder of the imperial court system, self-proclaimed Empress of San Francisco, a military veteran, drag performer, and the founder of multiple LGBTQ advocacy and support groups. We have also been entrusted with decades of diaries from Lou Sullivan that chronicle his life, including rich emotional and sexual details from his teen years all the way to his death. A gay and trans historian and community organizer, he was the founder of FTM International and a founding member of the GLBT Historical Society. One of my favorite things from his collection is about 400 pieces of correspondence we have that show how he connected with people from around the world long before email or Facebook or even Zoom meetings. You can learn about all of these collections by visiting glbthistory.org/archives or visit glbthistory.org/online resources for primary source sets and additional resources. We don't just hold on to these archives, we make them active. And every year we invite historians, artists, activists, and more to explore our archives and create exhibitions of LGBTQ history, including AIDS treatment activism, a Bay Area story, which shows how people with AIDS and their allies fought back against a slow and uncaring medical and political establishment to advocate for life-saving care and treatment that they needed. Reigning Queens, a collection of snapshots taken by photographer Roz Joseph of drag performers in the 1970s. The exhibition includes photos of queens from the imperial courts, founded by Jose Sarria. Outspoken, which tells the story of Angela Davis's activism and impact through the lens of artwork, posters, and political flyers that she inspired. You can learn more at glbthistory.org/exhibitions. Finally, I want to invite you to join us and to help us make history. As a reminder, every contribution you make today will be matched dollar for dollar, allowing your donations to go twice as far. You can make your contribution by visiting glbthistory.org/donate or by texting GLBT to 243725. One other way you can get involved is to follow us on social media for more stories from our archives, updates about upcoming events, and so much more. Without any further ado, we're ready to start our program. Here to introduce the first panel is Vint Chrysostomo.
Hello, my name is Vince Chrysostomo, and I have been working in HIV since 1985, and I've been living with HIV for over 30 years. When Sammy, Eric, Harry, and I sat down to be the panel for fighting back, confronting the stigma of disease, we were 6 weeks into the COVID-19 mandated shelter in place, and it was about a month before the world was rocked by what many describe as the public execution of George Floyd, an African-American man, by a white police officer. I guess only time will tell what the repercussions are of having the highest elected official of this country referring to COVID-19 as the Chinese virus. And I guess history will be the judge of whether the events of 2020 propelled us forward as a country or set us back. What I do know is that since the start of the HIV epidemic, about just over 700,000 people have died of HIV-related causes. In 2020, CDC projects that COVID will claim either close to 300,000 or even surpass 300,000 people. But anyway, when we came together to bring our intergenerational voices and our perspectives, we were hoping it would make a difference. So I hope tonight, or whenever you watch this, that you'll find it informative. And I also hope that it doesn't take another pandemic for us to get these systemic issues right. So anyway, enjoy.
I would love to welcome everybody tonight and introduce Terry Beswick, our moderator.
Hey, thank you so much. I hope you had a good time taking a few days off.
I did.
From your bedroom.
Staycation.
Oh yeah, okay. From interacting with us. So yeah, it's so important for us to self-care, even though we're like supposedly, all sheltering in place and working at home and, taking care of ourselves. And with respect to work, I think it's important too, because, it's so challenging and it can, I took a nap just before this, which is why I was running a little bit late to meet you guys beforehand. I was like feeling zoomed. I was zoomed. So anyway, I'm here. I'm happy to be here, and I'm so delighted with to have our panel here tonight. I know most of you pretty well, or we've had you on panels before at the museum, and so in this panel we started shortly after the inauguration of Trump. This panel series discussions. And we really thought that it was important for us in this time of political crisis that we were like looking at the daunting prospect of 4 years of Trump as president and thinking, there's so much work that needs to be done to just protect our basic rights, and what can we do to try to inform contemporary social justice movements in the context of our queer history and our work to get those rights, and continue the path of social justice. And so those have been really invigorating discussions. And I know that Sammy, we had you on one panel, and I think maybe Harry, and I can't remember what they were exactly. But anyway, tonight we're brought together by an epidemic that has reached around the world, has really disrupted the very fabric of our lives and our economy, and struck down so many people. I think we just hit 1 million people infected that we know about, or 1 million cases in the United States, and over 50,000 deaths. And and I can remember these demarcation points in the AIDS epidemic. When we started reaching those kinds of numbers, and it kind of took longer, and our sense of time and of pressure, and also the way that this epidemic is touching a lot of different kinds of communities and people feels very different. And yet there are a lot of similarities sort of in the ways that we feel about these epidemics, I think, in the way that we respond to it. So this particular series that we're doing, looking at COVID in the from the perspective of HIV and AIDS, is I think, very timely. And so I'm hoping that tonight we can dig a little bit into, or deeply even, into an aspect of COVID that is, I think, really critical to discuss. And so, I think from the beginning, when we started seeing reports of the COVID outbreak in China, and we started seeing the travel restrictions coming out of the US and other countries, and we began to see physical attacks and personal attacks and online attacks against Asians in particular, Chinese people and Chinese Americans, and more broadly Asian Americans, with from people that were just acting out of fear or exposing levels of racism that were already there. And then we began to see that COVID was touching older people, or attacking older people in particular. And then you see examples of racism, and then African Americans, and then just people that are perceived to be possibly COVID positive, and people that are homeless. And so we're kind of seeing a lot of the same kind of phenomena with COVID that we saw with AIDS in different ways. So we're here tonight to talk about that. I'm really excited to have this great panel. So I just want to briefly introduce everybody, and then we're going to go around and talk a little bit about your work and then dig into the topic. So to begin with, I want to introduce Harry Bro. I know because he volunteers and is a docent at the GLBT Historical Society Museum. But he has also volunteered for many years as an emotional support counselor during the AIDS crisis. And I think Lee is going to be posting everybody's complete bios on the chat panel. So I'm not going to read through everybody's bio to try to keep as much time as possible. But Harry is now a long-term survivor, and continues to speak out and defend the less fortunate and disenfranchised by volunteering in various advocacy and social works, such as Elizabeth Taylor Network 50 Plus and the HIV advocacy networks at the San Francisco AIDS Foundation, Castro Ambassadors, and as I mentioned, the Historical Society Museum. Vince I've known for many years. Vince is a queer Chamorro man who has been living with HIV.
Chamorro.
Thank you. Has been living with HIV for over 30 years. He's currently the program director of the Elizabeth Taylor 50 Plus network. And he's been active in the LGBTQ community for over 35 years. He served as a community grand marshal of San Francisco Pride last year. And so we're really pleased to have Vincent here as well. I've served with Vincent on a number of panels in the past. Eric Watt is new to me. Hi, Eric. You're in LA, right? You're in LA, yeah. Eric is a writer and a community historian. He's the author of The Making of a Gay Asian Community, an oral history of pre-AIDS Los Angeles, and is working on Sex Positive, a follow-up history about AIDS activism in the Asian and Pacific Islander communities. His new novel, Swim, about drug addiction and family caregiving, was published last year by the Permanent Press. And I think we're doing a reading with you about Swim this month, aren't we? Yes.
In May, late May.
Late May, great. I'm excited about that. Sammy Blaza Wills is an enthusiastic organizer with a vivid love for justice and strategy. I'm so excited to have you back. She's growing up in a hustling class Philippine family, immigrant family in Las Vegas. Sami was shaped by the cultural resilience, joy, trauma of their community. Joy goes by they and them. Actually, sorry about that. Currently, Sami is the executive director of APIENC, a grassroots organization building power for transgender and queer Asian and Pacific Islander people in the Bay Area. In their role, they support hundreds of community members to organize for rights, build intergenerational connections, and heal for trans justice. So thank you very much. I'm so glad to have all of you here. And I just want to go around maybe in the same order and just ask you guys to talk a little bit about your work and what you hope to get into talking about tonight.
Okay, well, that means me. I prepared a little 5-minute reading that I'm going to read about, I hope will cover the points that Terry put out in his thing about the guidelines of the topics he wanted to talk about. And I'm going to switch to my Word document and just take it off and reading it. As a little bit of introduction, I moved to San Francisco in around 70. So I went through all the 70s of all the breakthrough pride, gay events and activities. And then continued on in the 80s when everything turned upside down. So I have a little history that I like to pull from and will hopefully give a view of how I feel about all of this in this reading that I'm about to begin. As I think of the AIDS years, and I know it's not over yet, I can still taste the stigma. Stigma toward homosexuals was a prime reason the original response to AIDS was so completely bankrupt. The abandonment left scars that have yet to heal. Today, though difficult and tragic, it doesn't affect me the same as watching friends and acquaintances during those early years as they walked around courageously fighting to retain their dignity while losing their health. It doesn't compare easily, if at all. There is, however, one small way in which the response today could be considered worse. In the prior time, we were allowed to visit and support personally those who were ill. We could hug someone for comfort and consolation from the devastation. Someone we knew could hold our hand on our deathbed. Today, those interactions are denied us and left to the caring hands of healthcare workers. Today, we must be content to connect with pixels of light on an electronic screen during those direst of moments. With AIDS, there was much fear and confusion as the news began slowly to unfold, but there was no one to ask and nothing to reference. Certainly, there were no daily briefings from the administration. Our leaders were either scrambling to find answers or scrambling to ignore us. Stigma became prominent and palpable towards a vulnerable but identifiable group. During the years following, when the virus spread to so many other groups, the stigma had already become well entrenched and pervasive. It continues into the present. Who has it? How does it pass? What could be done to protect oneself? Those questions permeated the conversations about AIDS and arise again now regarding coronavirus. There was no internet then and little media coverage. Testing took years to develop due to a lack of urgency, as the virus was only affected gay men, and that gave it a built-in stigma, homophobia, one of the oldest and most pernicious phobias on the planet. Many in mainstream society considered us deserving of our fate, and in some cases, glad to see it happen. That stigma later expanded to include many persons, many who contracted HIV innocently. All were seeking, like today, a way to survive an attack of the immune system. Coronavirus has triggered a similar instinct to survive, a similar fear, a similar stigmatization. Finding someone or some group to blame became the base response for many then as now. Being able to meet the challenge with reason, understanding, and compassion many seek an escape of any sort. One nurse friend of mine put it this way: some frontline people have succumbed to, and I quote, some frontline people have succumbed to the illness. Some have run from the risk of becoming ill. Some have looked at it from a distance, and some have faced it head on. All of these responses are going to threaten the very core of any group of workers. Some groups will crumble, some will adjust, some will rise to the top. The same kind of fear that negatively labeled people so many years ago is threatening to do it again, unquote. Hope summons the strength in a few to mount the appropriate response. In the 1980s, some nurses in San Francisco General created Ward 5B and found this strength and drove on, afraid, but not deterred. They set an example and created procedures that changed the world, making today's battle more manageable. In that way, maybe this pandemic is like AIDS. individuals mobilizing their best efforts despite their fears. It's different, though, in that those affected aren't the others, and the transmission isn't through behaviors that can spark prejudice. This virus sees no one as special or deserving of being passed over. It knows no geographic boundaries, no racial demarcations, no financial privilege, no religious belief, no age or sexual preference or practice. It sees only vulnerable and often frightened human beings. And yet many in our society have carved out an other where none exists, creating damaging stigma. Stigma focused on the Asian American populations, focused on the older members of society deserving our protection and homage, focused on the African American community already suffering from health inequities, focused most perniciously on certain healthcare workers. Invoking stigma against these or any others hurts us all. We all have the same stake in this game, yet many prefer to focus on the otherness and act odiously. We find a dedicated group of health workers of all types and talents, giving the hope needed to assuage the fear, combat the stigma, and bring us to sensible actions, ignoring the who, why, and where it came from. Healthcare is our right, but stigma has created so many obstacles to that right. My dictionary defines stigma as a mark of disgrace associated with a particular circumstance, quality, or person. To me, AIDS is not a mark of disgrace, though many who are fearful still perceive it so and inspire stigma. To me, coronavirus is not a mark of disgrace, though many who are fearful still perceive it so and inspire stigma. May those of us who can fight back and continue to speak out against stigma now and forever. Thank you.
Wow, Harry. I guess we can just wrap up now. No, I'm kidding. That was good. Sammy, you want to go next?
Oh, I was just saying bye. Harry really dropped the mic, you know. But I'm happy to go next if that's all right. Hi everyone. Good evening. My name once again is Samia Blaza-Wills, and I use they them pronouns. I'm the current executive director over at APINC, and at APINC, the core of our work is about building power for trans and queer Asian and Pacific Islander folks. And I was sharing with people briefly as we were preparing for this call that for me, coming into this work as a young person, I came in as an intern originally in the organization. I was very fortunate to meet people like some of the folks here who are my fellow panelists who have been doing work in social justice communities, in movements, fighting stigma, fighting for rights, fighting for connection and relationship. The people who have been doing that for many, many years. And I think for myself, being able to be in touch with my histories, with my living histories, has been a powerful lesson for how I want to move social justice work forward. And for us at APINC, this moment is a trying and challenging time, right? At the intersection of LGBTQ and Asian and Pacific Islander, our folks are experiencing the historical trauma of this moment come up. They're experiencing the anti-Asian harassment, all of the things that are happening, whether locally or to their parents or people in their homelands, to the very real reality that many young folks and trans folks, the inequalities exacerbated, the inequalities have only been exacerbated in this moment. You know, we have folks living in unaffirming homes. We have people without access to healthcare being denied access to healthcare. And so in this moment, and in all moments of crisis, APINC has really turned back to our histories to understand how to move forward. And the thing that I hope to talk more about as we talk more about stigma is also talking about connection. I think we've really learned from the HIV and AIDS crisis that in moments of hardship, turning towards each other is the way that we're going to get through this. Asking for and offering help, those are the things that are going to help us survive, going to help us thrive, going to help us create the things necessary to get through this moment. And so we found multiple ways to do that at APINC, and I look forward to talking more with you all tonight about that, because I think staying connected and being in relationship is one of the most important things we can do for now and well into the future as we continue fighting for a more just and equitable world.
Unmute myself. Thanks, Sammy. Vince.
I was going to ask Eric to go next.
Okay.
Eric, you want to go? I like to listen to everybody.
Do you want me to go first, Vince?
It's fine.
Sure. My name's Eric Watt again. My pronouns are he, him, and his. And I'm working on what I'm called community memoir of AIDS activism in the Asian and Pacific Islander API communities, specifically in Los Angeles. I actually came to this country when I was 12 in 1982. And that was sort of my sexual coming of age too, right? So that, and then when my political coming of age is sort of around college in the early 90s. So AIDS has always been in the background, both of those coming of age, and it's going to inform how I think. So it's been really a pleasure to be able to collect these stories of AIDS activists in the community and sort of reflect how, as I was telling folks before the call, how it has really lit the fire under me and be reminded of that. And I think this conversation is going to reinforce a lot of that too, because I do think there are a lot of, even though it's bleak as the situation has been, I do think there are a lot of good things that might come out of this. I also want to just say that like a pandemic is not just a medical issue, right? It's a public health issue, which means that it is something that we all have to chip in to solve. And that's why there's so much emphasis on testing, either in the HIV/AIDS epidemic or also in COVID-19 as well, in different ways, right? And growing up like in the shadow of AIDS, it was been thrown into me that I need to get tested every 6 months. And I still do, right? Maybe not right now, I can't go right now, but this is something that became so secondhand nature to us. And you can tell that like people in COVID-19, people would say that like, well, just assume that you are carrying COVID-19 or the person that you interact with will carry COVID-19, so that you will behave in a safe way, right? And that's kind of advice that I was getting as a young person, young gay man, about having sex during those years of the AIDS epidemic. It's always wear a condom because assume the other person have it. Because you can tell by looking at someone whether or not they are infected, in fact. So stigma, to me, it's important because it's one of the major deterrents to discourage people from getting tested. And you'll see in a lot of HIV prevention during that time, it's really about trying to get people tested. But in the API communities, because there's such a conflation of gayness and HIV, the stigma, it's not just about reducing AIDS stigma, but it's also reducing stigma of gay people, LGBTQ people. But specifically gay men, right? A lot of messages are really geared towards gay men at the time. So if you can think about like someone who is in the immigrant community, who is monolingual, who's limited English efficient, if this guy who might be having sex with men, who might not identify even as gay, he is not going to go to a mainstream AIDS service organization to get help. So because that organization probably didn't have the cultural or linguistic skill to help him. And he can't really go to an organization in his own immigrant community because for the fear of being found out, right? So stigma comes with that exposure. So that's why I think a lot of prevention work about reducing stigma during the AIDS crisis actually benefited people like me who were coming of age, who were not HIV positive, right? And that's one of the lessons that I drew from this activism, that you always fight for the most marginalized because that's how you lift all boats. I also think that there's a lot of creativity, a lot of innovation that happens with AIDS prevention in the 80s. partly because we have seen nothing like it before. So people had to be creative. There's no blueprint. So I also think there are a lot of innovation now, right, in how people are helping each other in the communities and the mutual aid that's happening, the use of technology. So I'm also very encouraged by what has been brought out. I think in some way this has brought out some of the best thinking, in our community too. So I'm also very looking forward to talking about those positive things that are coming out of this pandemic.
Thank you, Eric. That leaves you, Vince.
Thanks. I was going to use the excuse that I've been collecting my thoughts, but who knows how who knows how collected they're going to be. If any of my members of 50 plus are out there, thank you for coming. Some of you have been texting me, asking me for the password, but I'm not in that meeting. So please text Dusty. So, I was 24, 25 living in New York when the AIDS epidemic hit. And my first taste of it was I'd left Japan and I moved back to San Francisco, and the Castro was a ghost town. It was not the town I recognized. I went to New York for a visit and ended up staying for 6 years. And I remembered having a job at a bar, and the people that I would hang out with on the weekends, they were not showing up. And I found out one in particular was sick and that he was at St. Vincent's Hospital. And so I went to go visit them, and I couldn't find them because there weren't enough hospital beds. And everybody was in the hallway on gurneys, and there were so many people that you could not figure out who was who and what their names were. But I never realized what an impact that had on me until this current day, that to have that image of people without proper medical care, without proper identification of who they were, where they were, just standing on the halls until this thing came up. And it's been traumatizing, and I also remembered that that was a lot to go through in your 20s, and how you could go through that and not think it would affect you. Because for some reason, when you talk about normal, the only thing I have to compare it to is my life. And I don't know what normal is, I was talking to some of my colleagues, and I had to run my office in Bangkok at a time when the country broke into civil war. To me, that was normal. So, COVID, this thing, people are doing this. It's just something else that I had to do. And I just never realized how traumatizing that was, and how much trauma I've lived throughout my adult life. And so this time has really given me a chance to think. And I'm really grateful to APINC, the organization that Sammy runs, because I feel like they've given me this opportunity to kind of revisit that 24, 25-year-old and kind of send some compassion, like seeing these young people being who they are, being told to just be who you are, and we've got your back, we'll support you, is so novel to me. I mean, my experience with the API community initially was they criticize you a lot. There's a lot of stuff about keeping face and, maintaining that. And it was always kind of scary to me. But anyway, in the 90s, when HIV did hit the API community, I was very, very angry. And I think I was hard to be around people because I was so angry. I would be with people and I never know this was the last time I was going to see them, and but at one point I realized I had to swallow that anger because people just couldn't handle it. And I think what's starting to happen now is I'm getting in touch with that anger. And, that people aren't just out and just, well, I guess you can't go out in the streets because of social distancing, but that when we heard how this is disproportionately affecting Black people, how many times do we have to hear that before we go out there and say, hey, every time the person in office called this a Chinese virus, that nobody said anything, it's we don't get a chance to right a lot of the things that are wrong. I feel like I have a chance to kind of right some of the things. I know what I did the first time around, and I'm not going to make that mistake the second time around. And so, I no longer apologize when I speak my truth. And I think people are going to be uncomfortable with that. But I always find, and I don't want to keep going on because I don't want to sound like I'm preaching, but I do find that I have to go back to my API community when I need to be grounded. Like that's where, like my identity as a long-term survivor, as an elder, that's the perspective where I draw the most strength from, and I can go out and serve the other folks. Because I define community very broadly now, but I find that I really need to, and it really just hurts me when I hear about this, these acts of violence that are increasing, that nobody's saying anything. And so I just hope that I don't know what I'm going to do with this anger, quite honestly, because sometimes I'm so angry I can't even watch the news anymore. But I do think we need to do something. I mean, it's just inexcusable. And I think the people, like, I understand the people that are running the coronavirus task force, they have to be careful because the president's the president and he has a lot of power. But I'm like, I'm sorry. The rest of humanity, the rest of the country depends on what comes out of this. And the fact that you're thinking about your career and your position when you don't really say anything, I just question that. I think, that this fear that we have, yes, I understand this is a pandemic. I understand people are dying, but that fear keeps us in check. And that makes me really, really angry. I'll stop there.
I'm so glad Vince didn't have anything to say.
Yeah, we're definitely going to circle back to a lot of the themes that came up from each of you. We heard some really great stuff. And how to begin? I think let's begin at the beginning. When I try to break it down, like what is stigma and how has stigma functioned in relationship to the HIV/AIDS epidemics, and now with the COVID epidemic, I think about the sort of the trajectory of the history. And when I first became aware of stigma in relationship to HIV and AIDS, it was around the people who were perceived to be most likely to be HIV positive or have AIDS. And later, stigma became, for me, more a function of who had HIV. And at least in my life, that became sort of like the point of discussion, is how people with AIDS, people with HIV, were stigmatized by virtue of the fact that they were positive. And so some people would be in the closet about their status. And then there was the whole empowerment movement, which was really galvanized by people who boldly came out and said, I am a person with HIV. In San Francisco, Bobby Campbell was a famous example. But going back to the beginning, so can you any of you like talk about those early years, and with respect to HIV and AIDS, and the groups that were perceived to be likely to be HIV positive, and how stigma sort of manifested in our society back then, in terms of the response to those individuals or groups, or how those individuals and groups reacted to that kind of stigmatization. Do you have any thoughts on that, Vince?
Well, sometimes I think stigma is a word that people hide behind, because if you talk to people like in the streets, a lot of them don't know what the word stigma means because they don't use that in their day-to-day language. But you tell me, people are getting killed. People aren't getting services. They didn't allow this person to go into this place, which he had every right to go into. I mean, so I think sometimes you just have to unpack it for people. I think one of the questions you asked us earlier is like, how do organizations, fight or do the stigma? I think sometimes some of them actually perpetuate it. Like, and I'm going to use this as an example, like right now, like a lot of times people who serve older people, for their, for some things they use like these people who are doing the splits, doing yoga, superhuman people at 90 or 100. But then when they need money, they trot out the most tragic story that that they can find, and then they'll give us money for that. And I just think there needs to be a balance with that. With HIV, I mean, it was, there was an excuse to really for people to have the excuse to express their hatred for gay people or people who were different. I mean, if I worked with sex workers, I worked with folks who are trans, I work with people who use drugs, and it's people that most of society considered to be marginalized. It's like, let's just talk about the people. Let's not hide behind the stigma. Let's talk about the people and what's happening to them, because this is what's happening. And I think death is very scary, and it's often used as a way to kind of silence people. But at the same time, sometimes life is scary, living, because if you have lived through this, and like Harry and I who lived through this and seen what this has done, you don't ever want to wish that on anybody else. And so I think, you have a responsibility to step up. I'll be quiet.
Yeah, I mean,
I feel very strongly about some of these things. In fact, I didn't know how strong I felt about it until I started talking about it.
yeah.
But I think that as a country, we really need to find our moral fiber. We really need to say, this is not right. We really need to rethink, as a person of color, I'm called a minority. But the truth of the matter is that people of color are the global majority. They make up more, and so we need to start changing those conversations, because there's been a way that we've been told how we need to participate to be accepted. But I think that we need to change that. It's like, no, we don't need to be accepted. We're going to do our thing. And if you want to come along, fine. And I talked that about to the majority,
Yeah. Yeah, I think it's, I do recall in the early days with HIV and AIDS that my growing sense of horror when I realized, how HIV was impacting gay people, in particular, gay men in particular, and specifically how it was transmitted sexually. And this is in the relatively early days of the gay rights movement. It was, early 1980s. And so already on top of layers of cultural homophobia that was there, you had this sort of excuse for people to express their homophobia. Anybody else want to sort of on this topic, Eric?
Yeah, I was going to say that the stigma, because there's this conflation of gay men and HIV and AIDS, there's this assumption that if you were gay, you either have AIDS or you're going to get it eventually. So I think, this is why the stigma reduction, it's more than just HIV at the time. But it was kind of crazy, right? Because the whole idea of, when you watch one of those contagion movie and people get in a spacesuit when they get into a room with someone with virus, I mean, that came from HIV, like universal precautions, right? The fact that they actually have debates whether or not you can give CPR lessons. Like, what if someone kisses the mannequin, try to practice on the mannequin, and that person have HIV? Is that going to transfer to me? Like, these are conversations that medical professionals have had. So there are a lot of really brave people who were doing the right thing, but I think there were a lot of people who were who didn't know what the right thing was. So there was definitely a lot of stigma. The thing I would say too about that period, what I come to find too, is just the way people came together, how the community fought back, the stuff, the resistance, the fighting to be seen when there was so much denial, so much what is it? Reagan didn't talk about AIDS until 1985, right? This funding didn't happen. Ryan Care, when was Ryan White Care Act was passed in early 90s, I believe, under George Bush, the first one. So there was a lot of erasure, but at the same time, there was also a lot of stories about people taking care of each other, the kind of mutual aid that you see in response to COVID-19 as well. And I think that really humanized a community that has been so stigmatized, right? Like the LGBT community. Like, I'm not talking about just gay men, just sort of the kind of participation of lesbians and bisexual and transgender folks who are in the movement. It just kind of showed the world a face of LGBT community that they have not been exposed to. So that I think changed a lot of mind about what this community was, right? And I always went back to that because I felt like this is important for us to learn how to fight back.
Yeah, Sammy, I think I saw you holding a thought.
Yeah, well, I really appreciate what Vince and Eric have already shared about stigma. I think that Vince is right? Like, people aren't going around being like, I'm gonna have stigma now, but the way that it is enacted shows up on so many different levels, right? And I think for me, what I've acknowledged and noticed is that stigma is mostly about fear. I think a lot of things, like a lot of harmful and negative things that people do generally are about fear. But what stigma essentially does, in my experience, is that it creates the fear of the other. It's an otherizing tool in society. And that otherizing then prohibits those people from accessing services, being integrated into institutions, being cared for, being in relationship with. I think stigma really diminishes relationships and divides people. And if it, was the HIV and AIDS crisis or the current pandemic, this is a time in which people mostly need connection and care. But by essentially otherizing people, those folks are silenced. Value is placed on certain things, right? Like, value is placed on the healthy, like the fit, the people who could show up in a certain way, people who have ability in a certain way. And I think when that stigma hits, it embeds itself into the fabric of the different institutions that are supposed to be ideally serving everyone, right? And so we see how things that took hold during the HIV and AIDS movement, some of the negative things, are still persistent today, right? Like, folks are still fighting the ban to be able to donate blood, which is ridiculous, like, so many years later, and there's a lot of blood needed, and that's still a fight that's happening. And from that, I'm also thinking about, if stigma can take hold and root itself so institutionally, how can the powerful things that we create in moments of crisis also take hold and root institutionally? So if we are fighting in this moment anti-Asian harassment and racism and prejudice and ignorance about Asian people, what is the transformation that we can create that will take us beyond this moment? Because this is not something that we can let embed in any institutions more so than it already has, right? Like, as Vince was talking about, the fact that so many Black folks have been denied access to medical care, just in the Bay Area and the city of Richmond, all of the recorded cases of COVID that have resulted in death are all Black folks in Richmond, California, right here in the Bay Area. That is unimaginable and unacceptable. And so I think as people, as organizers, as people part of a just society, trying to create a just society, we have to imagine what are the cultural, structural changes that we need to demand in this moment that will take root much more than any stigma or fear will.
Yeah, that's really great, and I hope we can, during the course of this, really begin to imagine the ways that COVID-19, how we're going to move through to the other side, and what kind of society we hope to create around that. And I think, like with AIDS, COVID is definitely sort of exposing, not just, we talked about the racism and the homophobia, not just exposing those kinds of isms, but the structural inequities that are there, that are contributing to people being exposed to the virus, and then people not getting proper care, and as a result, a greater incidence of death. And we definitely saw that with HIV and AIDS also. And Eric, you reminded me of something I was thinking about earlier today, which is the Ryan White CARE Act, and which is a phenomenal piece of legislation, which was championed by Nancy Pelosi and others, that really got early intervention care into the hands of people with HIV and AIDS, and really dealt with HIV care in a very kind of comprehensive way that was really life-changing for so many people. And yet, it occurs to me that it's named after a beautiful young man who's from the Midwest, white, who contracted HIV as a result of a blood transfusion or blood products because he was a hemophiliac. And it's interesting that we had to, and he did some phenomenal work and totally deserving of having this act be named after him. His mother has gone on to do some wonderful advocacy work. And so I don't mean to diminish that by any means, but it's interesting to know, it wasn't somebody like Pedro Zamora, who was a young person with AIDS who, I believe contracted HIV sexually and was Puerto Rican. It wasn't somebody like that. So we had to put forward this person who was the face of HIV and AIDS in a different way. And it wasn't, it wasn't a gay person. It wasn't a person of color or somebody. It certainly wasn't an IV drug user. And so I think about all the groups that were stigmatized in the early years of AIDS and still are today. And I think about gay and bisexual men, certainly. And there were a lot of bisexual men who were just kind of like on the fence about their sexuality. And women, they were not getting opportunities, romantic opportunities with women because they were, bisexual. And so they really kind of like moved more to the gay side, for example. And then there were Haitians, of course, and you had Haitians in the very early days, and a lot of Haitian Americans were here experiencing discrimination as a result of the stigma. Moving on, let's talk a little bit. Harry, did you have any thoughts that you wanted to throw in here about the early days?
Yeah, I mean, well, the stigma was strong. I remember the first time I knew about AIDS basically was probably around 1983, and they didn't really have a name for it yet, probably at that moment. But I do remember that I came home, and again, before cell phones, so on the answer machine was a friend of mine calling and saying, what you want to know is that this person, and he named him, died in San Francisco General today of this unknown gay disease. And that prompted me into action. I have always felt that part of the huge problem of it all is that we're able to readily find an other, as I mentioned in that thing I wrote. There's always an other. They're other kinds. They're not like me. I mean, and when you start at that, then any anger and any fear that gets connected, I fear will come out as stigma. It'll show up some kind of way where you are going to discriminate against that other. And we have yet to find a way. I mean, America was built up, and as a kid in school, I learned, it was a melting pot of all these different races and colors and creeds and everything else. And yet it's kind of been hijacked to be a particular kind of way that has historically, it seems, always found a way to carve out an other of some kind of way. And we've never actually been able to accomplish feeling that we're all one nation, we're all Americans that all need to be participating to make it work, and how we can support each other in that. We seem to always take the easier route, which of course is to deny and deflect and stigmatize different groups.
So let's talk about how stigmatized groups who had this stigma put on us through the HIV and AIDS crisis, and even if you want to talk about like with COVID, in the short history that we have with COVID, how did those groups turn it around? How did they fight back against the stigma?
For me, it's if you fight against something, it gives it energy and it gives it power, but yet you have to stand up and confront it also. So it's kind of a double-edged sword there. If you push too hard, you're going to create a wall. And if you don't push enough, it's going to run over you. So there's a balance that has to be struck where we have to somehow be able to come back to reason and be able to talk with each other in ways that's not happening, particularly as represented through our political structure. And everything right now seems to be heavily, I was listening to a webinar this afternoon, and they were talking about how the rural areas outside of the smaller cities, when the government funding comes down, for instance, is dispersed by the counties. And the counties often will then take that money and funnel it to the businesses like the hospitals and the, the official, quote unquote, healthcare entities. So that the smaller groups, what if they were churches, they'd be called faith-based, but they're not. They're community-based is what it's called. And those groups aren't eligible for these funds that come through, because you have to have the criteria of being a major like hospital. And all of the criteria currently, and probably for hundreds of years, is set up by a ruling class that, right now it would be considered the Congress and the government and the people running it. And it seems like the grassroots issues that we confront about trying to disperse the stigma and trying to make people equal and trying to reach all the Americans, even the ones that live out in the country, this is overwritten by a hierarchy that we can't seem to dissemble, to take apart.
Yeah. So, but as individuals, what did individuals do to try to counteract the stigma with relationship to HIV and AIDS? And you talk about it, I think that's very right, and it reminds me of my early days as a queer boy. How do you deal with the harassment and teasing in school, or do you fight or do you hide? And I think Eric, did you have something on this? Yeah.
I'm still percolating.
Okay, I'm thinking about coming out. I mean,
Right.
I'm just thinking about coming out specifically. That's what we did, and we talked about that earlier. But with respect to HIV and AIDS, what we had is people just coming out as being a gay person with HIV or AIDS, and as we did with our sexuality or gender, to come out and be proud of it. And later, I think we even got to a point with HIV and AIDS to be grateful for the disease, at least in our lives, the changes that it exacted, or the kinds of perspectives that it brought for us as individuals. Vince, I see.
Well, it just reminded, like, one of my first experiences in the API community when I first started doing this work, because in New York, when I was volunteering and doing stuff, it was more of the mainstream and all over the place. But I remember our community didn't know a lot of people. There weren't a lot of people who were out, who were positive, and people were scared, because of what we're talking about, the stigma. And so the staff, it was Asian AIDS Project, which would become API Wellness Center. And the community would say, well, we don't know anybody who's HIV positive because, whatever. And they go, well, Vince Chrysostomo, you know him? He's HIV positive. You can't say that. I'm like, oh, shit. It's like, I was like, what about confidentiality? It's like I was constantly being outed. And I realized, though, that, that was, maybe that's what my role was, to use that story, to use that, because suddenly you knew somebody and it became personal. And so my thing, if you focus on the stigma, we don't get any place, but if you focus on the people, I think Sammy talked about connection earlier, the connections that we have. I think one of the things that did happen, and Ryan White actually did this as well, when I think somebody said this in the chat, is at one point they tried to divide people with HIV, but those who were the poor victims and those who deserved it. And one of the things that I saw us do in the 80s and 90s is come together and say, no, it doesn't matter how you got it. It's a disease and it's preventable. And so we came together. Unfortunately, as Harry said, the country keeps finding ways to divide us. But I think if we focus on those connections, we can cultivate that. And we just make it personal. I also know that people would, often take issue with some of the things I said, but I said, you know what, this is my story. It's not up for debate. Because, you know, and so I've learned, that's how I've learned to do my work. But I do think that if you keep it personal, and then the more people that you can, you know, that you can cultivate and touch with that, the more people are going to say, you know what, this is not just their problem, this is our problem. You know, a few years ago when, a couple years ago when North Korea was talking about bombing Guam, and people kind of made it a joke, and I had to tell somebody in the meeting, it's like, you know, that's my home. It's like the fact that you're standing there and just thinking, like, that's my home, that's where I'm from. And so you can't say, but this, if you know me and you know my work and you value my work, then you can't say that you're not personally impacted by this. And so, you know, so I just find a way to, whatever condition I happen to be inflicted on me, to use it to make my point. No, I'm teasing. I also think that humor sometimes, because when you talk about stigma, it's really icky and just kind of yucky.
Yeah.
But I know that for my culture in the Chamorros, we often say things that are inappropriate, but you know what? We get the message across, and we kind of create those openings where we're able to talk, and it makes it a little bit more personal.
I think
So,
hit
so
on
this is
something that I didn't bring up about me, but when I was, first off, I wasn't able to come out when LGBT was okay. I came out way before that happened. And one of the things that happened was during the AIDS thing, I remember having lunch with a friend, and at the table next to us was a female couple that was office people, and they were having lunch too. So my friend Sandra goes off, you know, and they get in a conversation with these two women, and the two women, you know, ask what she does, and Sandra's an executive placement person and all that stuff. Then they turned to me and they said, well, what do you do? And I said, well, I'm not doing anything right now because I'm recovering from AIDS. And their jaws dropped to the table. But it pointed out something to me that I didn't kind of realize I was doing, but it was just who I was, I guess. And that was that I've never kind of been in the closet about what was going on. I told people all the time that I have AIDS. Yes, I am a person with AIDS. I can't speak that language, et cetera, et cetera. And I think that's been kind of a personal crusade, and also a very positive thing in my life to have presented some kind of impact to what's going on, is by basically being willing to be out there in that way.
So how does this apply to COVID? And that's I think that's the question that comes up, because I guess the difference is, you know, when you have HIV and AIDS, you can be out in public about that, and to be positive means that you have the virus and you potentially could develop AIDS without proper treatment. And to be tested for COVID is a different kind of a thing, you know. To have COVID-19, or the virus that causes COVID-19, is for it's got a shorter incubation period. There's a period of infectivity and potential for illness and death, and then hopefully you become antibody positive and immune to infection and not able to infect others. So it's really a different disease in that sense. And so if somebody's COVID positive, I haven't seen anybody become the COVID positive poster boy yet, you know, like Bobby Campbell did with HIV and AIDS. So how can we combat the stigma in a way that's affirming of the identities of people who were stigmatized by as being possibly COVID positive? You have any thoughts on that, Sammy?
Yeah, I think that it's hard in this moment, right? Because the scale of COVID is like truly unprecedented, at least in my experience, right? Like the pace at which it is transmitted, the rate at which it's become a extremely global pandemic, you know, a pandemic that's hurting many, many people. And as folks were talking, I was kind of thinking about what are the things from that feel still relevant in this moment that I see parallels to. And I think there's two things. The first of which is that it is extremely powerful when people are vocal about their experiences, right? Whether that was during HIV and AIDS, when people could be vocal and say, this is how I'm being treated, this is how I'm being mistreated. That same thing applies now, right? We see how people are being denied access to testing, or we see how people have really, really minimal access. They're in rural areas. They have to drive 2 hours to get denied. You know, they can't get any responses. How, you know, undocumented folks and immigrants aren't getting a stimulus check and they can't go out and get jobs. How trans people are being, you know, they're already having struggles with housing. Now they're being denied access to all of the housing programs that are happening across the nation. When people are vocal about their experiences, it creates a culture in which no one can say that that did not happen, right? Like the collective amnesia can only go so far if people are vocal about what they're experiencing and adamant about the things that are happening that are true to them on a societal level. The more that people can be vocal about, here's my experience with COVID, here are the symptoms, here's what's hard, but also the systemic elements, the stronger the push will be to respond. I think the second thing that I think about that feels like a parallel in this moment is the strength in connections. And I come back to this time and time again, but I continue to, in this moment, be inspired by the ways that during HIV and AIDS, people checked in on each other. You know, like people did not leave folks to die. They sat by them until the end and beyond the end. And I think that that is extremely important in this moment, even if it's gonna look different, right? We can't go to each other's houses and visit each other, but we can call each other. Maybe people don't have internet in their house. We can find a way to get internet to them. Maybe people need food resources. We can deliver them food, right? Like, what are the different ways that we can continue to care for one another with the understanding that by doing these different acts of care and support, we're ensuring that there are multiple avenues for people to feel connected and healthy and strong, even as there's this big, big push and big, big weight that people are having to carry. And that's like no small feat. I don't want to minimize. It takes a lifetime of work to be able to be comfortable asking for help. But I think it's a muscle that needs to be worked in this moment, because there's no way to get through a global pandemic alone. Like, the individualism of this country manifest through capitalism is not going to cut it if we need each other, if we need to rely on each other. And that's like a hard thing that's going to need to just be worked through now.
Yeah, Eric.
I was just going to add that I think some of the panelists have also addressed this. The stigma is not really the disease. Like, we don't really need people to talk about, you know, having COVID-19. That's not the stories that we might need at this point, right? The stigma, it's really about the perception, people's perception of who has the disease. So rather than calling it stigma, let's just call it for what it is. It's racism. So it's really about how you fight racism, to me, you know. So I'm not gonna, you know, fault anyone from hiding from having the disease, because there are ramifications of being exposed or having that kind of exposure. But I think the lesson that I at least draw from HIV/AIDS and that experience is how people kind of not afraid to have difficult conversations, and, you know, to call things out, right? You know, and then be confrontational about it and to put it on the table. So that it becomes part of the conversation. It just refuse to be marginalized, to have these conversations marginalized. So that's kind of what I think it's also happening, right? You know, you do have these assimilationist strands sometimes in movements, you know, to kind of Andrew Yang telling people, like, just be more American, right? You know, but I think for the most part, like in this day and age, that argument got so much flack. And it's just stopped working, you know, with people in our community. It's like, it's not the way to address this problem, right? So I think, I really think that we need to name this correctly so that we can talk about it.
As racism. Yes. Yeah, I agree. Although I do see the point that, you know, I think with COVID-19, it doesn't have some of the sexual stigma that certainly that we saw, or the drug-related stigma that we saw with HIV and AIDS so much. And now we have social media, so everyone is like posting about, when they have a family member or they themselves are COVID positive, or that they're going to take the test, and they do a little video of them taking the test. I had a friend took the test yesterday through a drive-through thing, and he had his camera sitting in his lap, looking at him while the thing was going down into his nasal passages. And I thought, oh well, that was visceral, to watch that. And then I thought, there's a lot of people that are going to be like afraid of actually going in and getting the test, or even think that to get the test is going to potentially expose them. There's a lot of people that don't understand, what the test is and what it's about. So I think it is important that people are talking about it.
Right.
We have celebrities that are talking about it too, and that's important. It took years to get to that point, with HIV and AIDS.
Right. Can I add really quick? I think there's a point during this lockdown, at least in Los Angeles, since I can't go anywhere else, where it was a stigma to be wearing a mask outside, right? People see you as like, you probably have the disease. You're inviting a lot of harassment by wearing a mask. And there was a point during this lockdown when that changed, where if you're not wearing a mask outside, then you are being stigmatized. Like, people call you out, like, what are you doing? Why aren't you wearing a mask? Why aren't you staying at home? So I think I kind of want to understand how that happens, how that stigma changed, right? Because I think a lot has to do with leadership, like people in talking about like what is the most responsible thing, thinking more communally, right? Especially in California, where you do have people who rely on science to make decisions, so very clear about what to do and what not to do. That didn't happen with HIV/AIDS, at least not in the early years, right? There's so much misinformation,
right?
So I think if you want to talk about stigma that way, I think there are different ways that we can talk about how institutional response can alleviate some of those things.
Right. And some of this is about, when we have celebrities who, whether they're, they're Asian or they're not Asian, to like talk about their experiences with COVID testing or being COVID positive. I think it sort of like normalizes it in a certain sense. But still, we have specific incidents that are happening here in the United States, attacks against individuals who are Asian or Asian American, Asian Pacific Islander, that are about perceptions of COVID. And we're seeing reports on that. Can anybody like talk about what kind of reports are you seeing in the people that you know or in the media? Specifically, because I think we're kind of like talking about this as an abstraction at this point, and I think we kind of what are people hearing and seeing?
One of the things that has come to our attention at APINC through the Stop AAP I Hate, that's an organization that's been working to do reporting on anti-Asian harassment and incidences and different things like that. And just in 2 weeks, they received 1,600 submissions of anti-Asian harassment, just in 2 weeks. Wow. And this, it's across the nation, things ranging from, people getting spit on, people getting threatened. Many of us have maybe seen the reports of folks across the country who have been stabbed or poisoned, like physically poisoned because they are Asian, to now in San Jose, just this past weekend, a lot of Asian businesses have gotten their windows broken and have, with all these signs put on with anti-Asian sentiment related to the virus. And I think that in this moment, we're seeing the ways that Asian folks, particularly East Asian folks, Chinese American folks, have always been a kind of conditional other, right? And Asian American organizing, I talk a lot, and I know a lot of other people talk about the myth of the model minority. The model minority being this idea that Asian folks are this kind of like model of what it means to be a person of color in this country, this was a phrasing specifically leveraged to demean and undermine Black folks in this country, especially. But that myth of being a model minority has always been predicated on what's helpful to the dominant power structure. And I think in this moment, the myth of being a model minority, the myth of being safe as an Asian person is coming out as obviously untrue. You know, like Asian people are subject to this extreme xenophobia and are only conditionally safe. Many folks who are also being deeply impacted by the anti-Asian harassment in this moment live at the intersections of other issues and identities, right? We're seeing that women are being targeted more than men, older folks, people who are seen as immigrants, people who are gender nonconforming are being targeted at higher rates. And I think that all of those existing lines, divisions, and marginalizations are coming up clearly in this moment. And it's so deeply unfortunate that, like someone was saying previously, the leadership of this country has not only been silent, but has like allowed for this to happen, has perpetuated this on a federal level so that it becomes reinforced and okay on every single local level that's happening.
That's a really great analysis. I always love hearing you, Sammy. You've always got such wonderful insight, and I'm looking forward to seeing some writing from you on this subject, actually. So, you know, we've got, we have a healthy discussion going on the side here on the chat with some resources getting posted in the chat box and people making comments that I think are very much in line with the things that that we're hearing from the panelists. I can go back and look to see if there are any specific questions, but if people do have questions, please use the Q&A function. We only have about 17 minutes left in this forum, and I do want to give everyone a chance to make any kind of closing kind of remarks as we wrap up. But if there are questions, some people may be using the chat function instead of following directions and using the Q&A function, but it doesn't really matter. So let's see. I want to direct it towards the present and the future even more than we have so far. You know, and I think we've talked about how COVID and how AIDS sort of like exposed some of the cultural inequities, the social inequities that were already pre-existing in our society. And in some ways, how the response to the disease is, certainly with AIDS, helped to address some of those inequities, at least on a temporary basis with some people. And we could get into talking about that in a lot more depth, but I'm wondering, what have you guys thought about with respect to COVID and how COVID could, I mean, you know, people talk about with AIDS, how there's this question, sort of that theoretical exercise, that thought experiment of, if we had not had AIDS, you know, what would have been the trajectory of the gay rights movement? And some people will argue that, you know, well, a lot of people wouldn't have died, and we would have, you know, and continued the path of civil rights around gay LGBTQ rights. And then others say, well, actually, AIDS helped us to really get organized and to get focused and raise a lot of money, and really, although we lost people, really focus our efforts, and it really propelled us even further and made people understand and empathize with gay people more when they came to learn about how AIDS was affecting us and how we were responding to it. So looking at that history, what about COVID? And specifically, what about COVID and racism and what we're experiencing now, in particular with Asian Pacific Islanders and with African Americans? Do you see COVID as furthering the discussion in a helpful way? And if so, how? Or is it going to be furthering and deepening the racism that we already have in our culture?
Well, I suppose we could ask people, how many epidemics or pandemics does it take before people learn? you know, because, you know, what's it going to take? And I think, you know, I mean, I think Eric kind of alluded to this earlier. I think it's important to be hopeful at times like this, because if you just think everything is a disaster and it's not going to change, but I mean, what it does do is it kind of gives you a sense of what kind of world you want to live in, what kind of leadership is needed. You know, we talked about some of the anti-Asian stuff. We didn't talk about the kids in schools who are getting beat up and bullied, and what kind of trauma that's going to have, because they're going to grow up to be adults, you know, and what kind of help is ready for them. And I just think that, you know, it's important to be helpful, and I don't know what it's going to take. I mean, I just think we have an opportunity right now to kind of figure that out. Voting current leadership out of office might be a way to start. Coming together, like we've kind of said, but then having, just having I think having a vision that we could work toward, that people can buy into, that doesn't seem so, because I think one of the things that came out of the HIV epidemic for me was that all the uncertainty that lasted years and years and years, but the one thing I know now is that we came out of it. And at one point we will come out of this. And what is the world that we want to step out into?
That's the question. I think we have a good sense maybe on this panel, but you know, when we do have a president who's, you know, calling it the Chinese virus, and I don't know if he's still doing that, but just the fact that he has done that and not even apologized or tried to correct it. I mean, he just should not be speaking at all about anything in relationship to this or any matter at all. But and yet he's there, and I think there is a power of the presidency, and that trickles down to the schoolyard. You know, and you know, when you talk about kids, I think, you know, and I think about you know, my own experience as a young queer kid, and you think about a young Asian American kid that may be hearing that kind of bullying now, and I think that's what you're alluding to, Vince. But I maybe not. I don't know. Eric,
no, I was gonna say I wasn't clear. Let me try again. No, I'm teasing.
Okay.
I have a quick comment on that.
Yeah.
When we're a capitalistic society, and obviously, you know, corporations have a huge influence in this country, and every corporation has a CEO, and it's that CEO, or in your case, Terry, an executive director of an organization, and it's their attitude and their ideas and their vision that filters down and focuses and guides the organization. And if you look at the presidency as kind of a CEO of this country, that attitude and that way of dealing with the world is going to filter down throughout the entire country. And I agree. I hope we get a replacement of that CEO. And also, I feel that kind of my final comment is that the way to make the difference is to, we're kind of like in a standard shift car. We have the clutch in right now. You know, when we pull that clutch out and let it out slowly and we re-engage those gears, what is this country going to go for, and what is it going to remember, and what is it going to, you know, which gear is it going to be in? And I think the best and only way that we can affect it individually is to be active individually. We have to, you know, I sign up for committees that I will never be a part of other than to listen to what they have to say so that I can keep informed. You know, I sign up for much more than I could ever do so that I can hear all these different things. You know, for instance, I mean, being on a panel, you know, here's the white kid, right? You know, 3 Asians that are giving me things that I know because I live with Vince and hear it and work with it, but viewpoints and information that is much deeper than anything I normally encounter. So
yes.
By being here, I'm educating myself and I'm learning how to adjust the adjustments that need to be made.
That's why we invited you, is to educate you, Harry. So no, I appreciate that.
Three
And
fabulous Asian people, and get that old white guy too.
yeah, and you know, I mean, and I will say, I in my job, I learn a lot, you know, from so many different things, and AIDS certainly taught me a lot about different parts of our culture that I may not have thought about prior to that work. You know, last week we did a panel on healthcare, you know, healthcare workers with COVID, from the perspective of people who had worked in AIDS, and it was very interesting. But one of the questions that I asked rhetorically towards the end was, so is COVID going to bring us universal health care? Sorry about that. My roommate's
I think your dog thinks it will.
Yeah, my roommates are getting a delivery. So let me just throw this rhetorical question at you, Eric, Sammy, in particular. Is COVID going to bring the end of racism?
That's a lot to put on one virus. COVID-19 virus.
How many viruses is it going to take? I think that's the take-home line from this whole thing. How many epidemics is it going to take? Vincent said. Yeah. So what about that? I mean, we don't think it's going to bring the end of racism. But what,
no, I don't think it was going to bring the end of racism. I do think that, like, you know how people talk about evolution, like you kind of go steady, and then all of a sudden you make this jump. I think we are at this inflection point where a lot of these things that we didn't think was possible 2 months ago might become more feasible in the advocacy arena. And one of those things I think might be healthcare access. Like, how do you prepare for the next virus, right? I mean, that's what leaders should start thinking about. Like, how do we make sure that your communities have what it takes to weather another crisis like this, because it won't be the last. No one believes that this is going to be the last lockdown that we'll ever have in our lifetime. You know, so how do we prepare for this? Like, even the argument that how do we pay for it? Like, I think those arguments, would it work again? I don't know. You know, it's like like the economy was pretty much shut down because of this. Like, at least like 80, I want to put, the majority of the economy was pretty much shut down because of this. But yet we're still able to, you know, there's enough money in the world, so we should stop asking how we pay for it. So there are all these things that I felt like, I'm not in the advocacy world, but I felt like a lot of these arguments that we use to sort of turn back progress or stop progress might not be as strong as they used to be. That's my hope, right? So I think there's an opportunity, maybe not to eradicate racism completely, but at least begin to raise all these disparities that we're now seeing, that COVID-19 is really making it visible.
Yeah, I agree with that. I think that, well, I guess I'll come back to one of the things that grounds me in movement work, in addition to all our histories as a community, is this idea that world transition is inevitable, right? Like, things are always transitioning. Climate is changing things. Things always happen. So transition is inevitable, but justice is not. And justice takes work, right? We are learning, like Eric said, that so many things are possible in this moment that people have always said are not possible. Like, there's no way we could cancel rent. There's no way that we could have healthcare for all these people. There's no way we can house all the folks that are currently homeless. And yet it's happening, right? There's no way we could release more people from jails. It's all of these things are happening, and things are fine, like relatively fine. And so I'm thinking about, what can we learn from this moment, and how can we codify these wins? If these are things that are actually improving society, how can we codify those into actually just being the new norm that we're trying to make? There are things that seemed for me previously just unimaginable as a win, or felt like it was going to take decades to try to manifest, that seemingly overnight are just happening now, because they are absolutely necessary to protect people. And everyone is on board with protecting people, or at least a lot of people, more people than before, are thinking about universal protections for folks who are marginalized, sick, and have needs in this society. And so I am really, really interested in moving forward to look at the wins that previously looked unattainable, and understanding how we can codify those as real to continue supporting the fullness of who people and societies and locales are.
Yeah.
That's really great, and I'm going to use that as kind of a segue to just do one last quick go around. And I apologize to everyone who has, if you had a question that we didn't get to, but I sort of felt like we did touch on everything. And I see that everybody that put a comment in the thread there, everyone could see that. That's watching and participating. And so, so I'm glad that we've had this parallel conversation kind of happening. But I wanted to, just in the few minutes that we have left, kind of like go around and only just less than a minute each. But if you could like say, what is needed now? And some of you have said some of this already, but just to put a point on it, do we have enough media attention? Do we have enough leadership? Where should that leadership attention come from? What should those media stories be about, perhaps, that can help to counter the stigma that is inhibiting the appropriate response to this disease and hurting people in their daily lives? Can we go around and start with Vince and just a few final thoughts?
I was going to defer to everybody else first.
Oh, sorry, I forgot. You like to go last. Okay.
Yeah, go ahead. I'm still percolating. I'm calming down because I have to go cook dinner after this.
Oh, okay. Well, next, Harry.
Oh,
just briefly.
What to do?
Just briefly.
I don't know that I can say any more than just follow your heart, get out there and do it, and find what makes you tingle inside, I guess, to know what's right and wrong, and follow your heart to support the things that are right, and to depower the things that are wrong, and speak out. We must be heard. If we're not heard, silence equals death. It's not a new one.
Thank you, Harry, for your wisdom. Eric.
We didn't really talk about this, but I've been thinking about young people a lot. I felt like as I get older, I just feel like every year that goes by, we just leaving a shitty world to the young people. Like first the 2016 election, the climate change, and now this. But I also think that, they are very resilient. I work with a lot of youth serving organizations, and I think there's a lot of creativity that's happening there. And people are actually being galvanized to do things, just like I think AIDS galvanized my generation into activism. And so I felt like we need a lot of investment in youth development and just making sure that they become the leaders they're destined to be.
Great. And Eric, we've gotten several messages of love for your dog. And so your dog is basically stolen the show almost. Sammy, Vince, any quick final to-dos?
Actually, Sammy, why don't you go last after what Eric said? Because why don't you have the last word? I just want to say that, I'm actually shocked at how strong I feel about a lot of this stuff, but I realize I feel this way because it matters to me. Like, I do not want to see my community go through another, pandemic, to be hurt, to be vilified. And like what Sammy had said, we are seeing things, like, remember the lessons that you learned from this? Like, we're redefining who's essential. We know that healthcare is something that is definitely needed. We know that leadership needs to be changed. And don't forget that. I think with the AIDS epidemic, one thing that happened is it was such a painful thing that when it was done, when the meds came out, people just wanted to forget about it and push it away and then just get on with our lives. And now I know a lot of people in the 50 Plus network are reliving a lot of that trauma. And then, focus on resilience. It's important to cultivate, to know that we have that, but to cultivate optimism and hope. And then that way, hopefully the younger people that we leave the planet to will have a better world.
Great. Yeah, thanks. I really appreciate your passion. Sammy.
Yeah, just briefly, what I always come back to in trying to understand how to be resilient is the understanding that when the strength of our relationships is more powerful than the institutions that undermine us, we can start to build a new society, right? And so if we focus on our connections, if we ask for help, if we do the personal growth needed to transform ourselves, we can also transform our world into the just thing that it can be, but it's gonna take a lot of work and it's gonna take a lot of commitment and rigor. And now is the time to learn and figure out where you as a person can build the necessary connections where you want to commit and be rigorous with it. And if we are able to do that together in our neighborhoods, in our buildings, in our community centers, in our ethnic communities, in our identity-based communities, we're going to have a better world on the other side of this.
Great. I really appreciate your clarity, Sammy. All of you, I love you, and I wish you great health and happiness for your chosen and families of origin. And I just want to plug next.
Hello, my name is Nick Large, or Christy Yamikuchi, and I'm on the board of directors for the GLBT Historical Society. And in my day-to-day work, I work at a nonprofit called Home Base, where we support communities in their response to homelessness. Today, I am here to introduce you or reintroduce you to one of our panels on housing insecurity and public health. And this was from our Fighting Back series, Lessons from AIDS for COVID-19. So what we do in this panel is we bring together a bunch of experts within the area of homelessness, a bunch of people who are actively involved in COVID response, and we mix them in with a bunch of veteran AIDS activists. And we ask them, what kinds of lessons can we learn from each other? You know, in what ways are we using the infrastructure that we set up during the AIDS crisis, and how are we using it now in this response? And one thing that I always like talking about as a student of history and also as someone who's working within the realm of homelessness is I like talking about the connections between those two, like how groups like ACT UP went in and demanded that they be a part of the decision-making process and that their lived experience has value. And I think about that now as I do my work, and I think about that and how we can integrate that concept, especially into COVID response, because often we know that the people who are experiencing the issue are closest to the solution. So with that, I hope you enjoy this panel.
With that, I would like to pass it over to Terry, who will lead us in our conversation.
Great. Thank you so much, Lee, for doing all the work behind the scenes to make this series happen every week. My name is Terry Beswick, and I'm the Executive Director of the GLBT Historical Society. Thank you, everyone, for joining us here tonight, and especially our esteemed panelists. It's always great to see each of you, and really appreciate you giving us your time tonight to talk about these important issues. This series actually began in our museum in the Castro a few years ago after the inauguration of Donald Trump. And just in line with our mission of trying to make history relevant, we thought we would do a monthly series where we talk about a hot button contemporary issue and try to put it into a historical context. And make it intergenerational, and it was a pretty good series on a monthly basis. And then we closed the museum, of course, with shelter in place, and we took this online, and we decided for a few months at least to focus specifically on COVID. And you know, in the LGBTQ community, of course, we have so much experience dealing with epidemics and with HIV and AIDS in particular. And so we thought we would look at COVID through the lens of AIDS and think about how we can approach different issues that we're sort of struggling to define and deal with now, and use the experiences around AIDS to inform that struggle. So, so tonight we're going to dig into homelessness, and it's definitely a hot button contemporary issue. It has been for many years. And I'm really delighted to have this panel of experts to come together to share your experiences with us and your knowledge. So to begin with, I'm just going to go through, and bear with me as I read the biographies of each, very short biographies of each of our panelists before I open it up for questions. And I think we're probably going to start with just talking about homelessness, how we got to this place with our unhoused neighbors, in particular in the San Francisco Bay Area. So to begin with, Brett, hi, how are you? Brett Andrews serves as the Chief Executive Officer of San Francisco-based PRC. I'm a former client, so I'm really happy to have Brett on board here tonight. PRC is a nonprofit whose mission is to help people affected by HIV/AIDS, substance use and mental health issues, and help them realize their best selves by providing the support and services needed to reclaim their lives. He also is a member of the San Francisco HIV/AIDS Provider Network, the San Francisco Human Services Network, Mayor's CBO Task Force, the Mayor's Methamphetamine Task Force, our City Our Home Oversight Committee, and the San Francisco Economic Recovery Task Force. Put a plug in for arts and culture organizations, please, on the Economic Recovery Task Force. He serves on the boards of the National Working Positive Coalition and the California Association of Alcohol and Drug Program Executives. Jennifer Friedenbach, I'm so delighted to have you on the panel tonight. Jennifer is the Executive Director of the Coalition on Homelessness, San Francisco. She has worked for the coalition for 25 years and previously was Director of the Hunger and Homeless Action Coalition of San Mateo County. Ms. Friedenbach has a long history of community organizing and has worked on a range of poverty-related issues. During her tenure, she has achieved significant victories alongside homeless people, including successfully fighting for the creation of thousands of exits off the streets and halting of displacement of thousands more. Margaret Kuschel, MD, is a professor of medicine at the University of California, San Francisco, and director of the UCSF Center for Vulnerable Populations and UCSF Benioff Homelessness and Housing Initiative. Excuse me, she's a practicing general internist at Zuckerberg San Francisco General Hospital. Thank you, Dr. Kuschel, for being with us tonight. Nick Large is a member of our board of directors, actually, at the Historical Society. He's also a queer, mixed-race, Japanese-American activist, policy analyst, and drag queen in the Asian and Pacific Islander drag troupe, the Rice Rockets. As a policy analyst, Nick supports communities in their efforts to end homelessness through technical assistance, trainings, and designing tools and materials that aid communities in effectively utilizing funding and employing best practices. Nick's current project involves working with communities to examine disparities in homeless systems to further to examine disparities in homeless systems of care to further racial equity. Last but not least, Supervisor Raphael Mendelman represents District 8 on the San Francisco Board of Supervisors. Prior to his election, Supervisor Mendelman served as the Deputy City Attorney for the City of Oakland and is elected trustee on the City College of San Francisco Board of Trustees. As a Deputy City Attorney, Supervisor Mendelman practiced primarily in the areas of real estate, economic development, and affordable housing. I think you're on the Economic Recovery Task Force too, aren't you, Raphael? Yes. Plug.
Yeah.
Arts and culture organizations. Get that museum, anchor tenant for the Castro. Okay, so moving right along. Homelessness. So help me out here. Let's just sort of start a baseline in terms of talking about the intersection of homelessness and AIDS and homelessness and COVID. Let's just talk about homelessness. Can anybody sort of give me a little history of
you want me to start, Margot, and then?
Yeah, you start, Jenny.
Okay, so you know, San Francisco, I think it's important to remember homelessness in the context of mass homelessness in the United States. And so we're in an unfortunately, extended period of mass homelessness here in San Francisco, like we have been across the country. Previously, the last episode of mass homelessness was during the Great Depression. And this is basically something that's man-made. I mean, we ended up after the Great Depression addressing mass homelessness by seriously investing in housing. Can be seen as kind of two acts. And, you know, we had the Housing Act that basically gave a right for all Americans to have a right to safe and decent housing. And then we started backing away from that right with the onset of neoliberal policies, and got so severe, you know, starting in 1978, but then by the time 1983 hit, we had cut our federal housing by 78%. And lo and behold, our first shelter opened up here in San Francisco at Hospitality House in 1983. That's not to say there was never experiences of homelessness in between, but there wasn't mass homelessness. We suddenly saw the million men, women, and children that didn't have a safe and decent place to call home. They didn't decide, oh, wouldn't it be cool to live outside? There was policy decisions that were made. And then since then, we've made a series of, you know, bad policy decisions, or even worse, the decision not to act federally. And we have not rebuilt that investment in housing. all of this intersects, of course, with changes in our economy, shifts towards the service sector, a scaling back of our safety net really dramatically. It's all, of course, rooted in disparities that this country has seen, and this growing income inequality that touches on, of course, racism and a number of different issues that drive homelessness. And so that's sort of the short version. What we've seen lately up and down the West Coast is this rising of rents, and that because we haven't acted to make sure people have access to affordable housing, the rising of rents has directly led to even more people losing their housing and becoming homeless. And we see this in San Francisco, where there was much more opportunity for casual housing arrangements when I first started this work in San Francisco, whether that's living in garages, sharing a flat where every household has a room with the padlock on the outside of the room, whether you're sharing with family members, et cetera. As poor people have been displaced so dramatically outside of our city, and in my neighborhood, the Mission, we're talking about 4,000 members of the Latino community being displaced. Of course, African American community has been totally decimated with the Bayview going from 43% African American down to 13%. All of this basically means that for impoverished people, they don't have that network of support within their communities to be able to figure out housing arrangements. It's disappearing. So some of the folks end up being displaced outside of San Francisco. Of course, we're massively sending poor people out of San Francisco. But then for a portion of the population, they're ending up homeless. And so that's sort of an abridged version, but Margot, I'm sure you have stuff to add.
Yeah, that was an excellent overview. And I think just some key points just to reiterate and then maybe expand on. I think Jenny really made the point, this is about housing and this is not about individual vulnerabilities. I think that the general public looks to individual vulnerabilities, people with mental health disabilities or substance use disabilities, and points to that. And I like to say as a physician, neither of those disabilities scare me. Those are illnesses that we well know how to treat. It's very hard to treat them when people don't have housing, but this is all about the difference between our availability of affordable housing and people's income. That's really what this is about. I think the other thing that people that's easy to confuse is sort of the homeless system's response and why does it seem like it's not working. I think we can be proud in San Francisco that we were at the forefront of some of the major innovations in housing people with the most complex needs. And a lot of that actually came from advocacy from the HIV/AIDS community. And that is, this thing that was relatively novel back in the mid-1990s, what we call permanent supportive housing, that San Francisco was really on the forefront of using a harm reduction model, or what we call a housing first model, which is to provide subsidized housing with voluntary but associated supportive services. San Francisco was very much on the cutting edge of that. And often people will say, why doesn't San Francisco do what Salt Lake City did? And Salt Lake City literally took San Francisco's model and adapted it. But I think here's the thing, is that permanent supportive housing is extremely effective intervention for people who have high behavioral health needs. Used on a housing first basis, you start with the housing and then you wrap the services around. Super effective, it works, we know it works. But permanent supportive housing can't solve the underlying structural considerations that Jenny pointed out so well. Like in California right now, we have 23 units of housing that are available and affordable for every 100 extremely low income household. So no matter how many people we house with permanent supportive housing, if we don't fix that underlying problem, we're never going to fix it. And then whenever you have a scarcity, when you have a scarcity of something, it's marginalized communities that bear the brunt of it. And that's why we see such disproportionate you know, homelessness among the LGBTQ community. We see it among our Black and African American neighbors, you know, in a city that is down to less than 6% of the population is Black and 37% of the people experiencing homelessness are Black. And so those are, among others, those are two communities that have been disproportionately impacted from this scarcity. But it really starts from the federal government's disinvestment in affordable housing, and the fact that wages have not kept up with housing costs, and the fact that we have such a shortage of pensions and things. You know, one of the most important phenomena, at least in my mind, is the aging of the population, where now over half of single adults who are homeless are 50 and older. That is a totally new phenomenon. When we looked at this in 1990, 11% were in San Francisco, and now half are, and that has huge implications for health, for COVID, and for everything else. So lots more we can talk about, but I think that's the big overview.
That's great. Yeah, thank you both for introducing us to the topic, and you know, and I think it's important to sort of revisit those themes as we sort of broach the subject of COVID and of AIDS specifically. But you know, I've really been following this pretty closely online, especially, you know, since I'm stuck at home. But with respect to the homeless crisis in my neighborhood and around the city, I mean, I do tool around and take a look to see what's going on, and then follow people's comments online. And people seem to be really focused right now. It's really in their face, and it has been before, but people are really thinking about homelessness and talking about it, and sort of repeating some of those tropes and myths that that you referred to, Margot, and it makes me think about the early days of the HIV epidemic. And you know, HIV, I think, like COVID, exposed vulnerabilities and disenfranchised populations, and the problems of, you know, providing equitable access to services and healthcare and so on, and it really came to light, I think, in particular with homelessness, which was really at the crux of the most vulnerable populations around AIDS. So, can anyone talk about that? Just like how homelessness and HIV and AIDS affected each other, or how homelessness contributed to AIDS, or vice versa. Brett, would you have any thoughts on this? Or oh, we can't hear you.
I think your microphone's muted.
Can you all hear? Can you all hear? That's great.
Yes. Yay.
Then I need to turn that down.
Yeah.
I'm having audio issues, unfortunately, so forgive me. You know, Terry, I will just say this. I think there's an interplay, but as long as I have been in HIV work, as long, and it's been a shorter amount of time that I've been in homeless and housing work, I'm not sure there's enough of an answer that would be sufficient to the question. You know, what I have noticed certainly is that the high common denominator of the people most disproportionately impacted by HIV, by homelessness, by behavioral health issues, both mental health and substance use, all somehow over time end up being people of color. So I appreciate Margot's point of view when she made the distinction between what is a homeless, and Jennifer, you did it as well, homelessness and the homeless crisis that we have, and how, and the protocols and the systems and the strategies that we need to put in place for substance use and mental health and behavioral health issues. And that by lumping all of it together, somehow you think that, you know, you have a person and you can solve for that. I would dare say that the pre-existing condition that existed in the United States is that generally, at the end of the day, who bears the brunt of homelessness, HIV, mental health, and substance use are people of color, specifically African Americans. Now, how to solve for that? Very difficult, because we can't go back to 1619 when we got here. And so the next question is where can we start the story? I often say, where does this story start? in a way in which it can be impactful and meaningful, particularly to the direct recipients of it. And here in San Francisco, I feel like in many ways, if we choose to be, we can be the beta test. We can be the small society that tests what all we can do in order to address this particular issue, given that African Americans are such a small population. 2, San Francisco is actually a small city. 3, it on balance has more resources than most metropolitan cities. And 4, political ideologies are not as expansive and divergent as many others. And yet, as I walked through the Tenderloin a couple days ago, it was almost too difficult to do to see the disproportionate amount of African Americans represented in that area. And I thought to myself, well, my goodness, anthropologists and sociologists, this is right up their alley to say, what happened? Something happened, and something continues to happen. There is a qualifying or a continued qualifying event that has allowed this to develop and to grow. And so that's where I'm focusing a lot of my energy and time, is that the high common denominators of many of what we deal with as a social plight and a social challenge and issue of the day end up having to be the same population of people. And if you don't find ways of providing prevention and early intervention services on the front end of that, all you're going to do is get really good at taking care of brown people. So you will be the best caretakers of marginalized populations that ultimately happen to be brown. And that is around education and all of those early interventions that need to happen. So my long answer, Terry, to your short question is, we actually have to address the things that are outside of HIV and homelessness in order to at least make sure that we can truly address homelessness. Last thing I'd say, because if you did it for the African American community that represents 37.5% of the homeless population, you solved for the worst, in many ways got lessons learned so that you could solve for those less challenged around it. And it's just a collective will that we would need to have in order to do that.
Right. Yeah, we've got some real big thinkers here on this panel, obviously. And so we're going to be repeatedly stepping back and getting the long view, and then hopefully we can dig into to talk about today. And we often use the term homeless crisis, and that gets tossed around a lot, or AIDS crisis, or now, COVID crisis. And, I think of homelessness and the intersection with COVID in particular as being not just another continuation of the homeless crisis, but it's an epidemic, an infectious disease epidemic like AIDS on top of it. And so there's a lot of different factors that are sort of feeding in there. And Nick and Raphael, Raphael, I see you pregnant with thought. You want to say something?
Oh, I mean, I was, in many ways, I am more aware of kind of the ways in which HIV and homelessness, are sort of playing out in kind of contemporary sort of San Francisco public policy. And just, it's worth noting that this was, well, it's still going to be AIDS 2020, but, in a very different form than what we'd anticipated. But the sort of the talk of City Hall in some ways around HIV prior to and homelessness prior to COVID was the fact that, notwithstanding the significant progress that had been made around getting to zero in San Francisco, and this phenomenal statistic of having finally gotten under 200 new infections last year, that for the very groups that Brett was talking about, people of color, and homeless people, basically, that that progress was not being matched, and in fact, that it was abundantly evident that we were not going to get to zero, and in fact, we're moving away from zero in some of those populations. And that had people kind of stumped and was leading to, things like the pop-up effort at SF General and other kind of interventions to try to figure out, is there a way to slow and stop the spread of HIV among unhoused people? I think it's very clear that COVID has shown and is bringing into high relief all of the ways in which our safety net is not real for large chunks of the population. But I think, even before COVID, I think HIV was really similarly showing who had been left behind, who is being left behind, and who's not receiving the benefit of these phenomenal public health advances.
Right, great. And Nick, I would like to bring you in on this. I feel like we've been talking about the causes and the underlying causes, and I think to Brett's point, it goes back centuries, and it falls along racial lines. I kind of wanted to get to this at the end, but I sort of feel like we're there in a sense. And AIDS is the framework, but we're really talking about COVID and the COVID housing emergency, and sort of the far-reaching idea of how is this going to be an opportunity for us, do you think, of opening up and looking at the root causes of homelessness, and maybe COVID will be a leverage to try to come up with some lasting solutions?
Is that the question for me? The big question for me, here we go.
Yep.
Okay. So I'm going to try and tie in a few of the themes that we've been talking about, a few of the different things that people have referenced. So kind of in talking about solutions and in talking about kind of some of the root causes, right? I think one of the things Brett mentioned is very important, right? We need to have this racial equity lens. Like specifically here in San Francisco, we have one of the highest rates of disproportionality of people who are experiencing homelessness who are African-American and also who are LGBT. So like this is something that I keep track of, that I track across the country. And in San Francisco, I've never seen a higher rate of LGBT youth homelessness than I've seen in San Francisco. Like nowhere in the country has a higher rate that I've seen. In terms of African Americans experiencing homelessness per like 10,000, I think we're maybe 4th in the nation or something like that. Santa Cruz is 1, and then I think Marin is like number 3 or something like that. If you go across the Bay Area by zip code, you can have up to maybe a 12-year difference in life expectancy, right? So we have all of these wild disparities. And what we're seeing now with COVID is we're seeing them in very, very visible ways. I think in many ways, a lot of these disparities have existed, but now they're a lot more visible in a sense, right? Because now we see all of these tents that are socially distanced 6 feet apart from each other, and they're surrounded by circles or they're in parking spaces. So a lot of these issues now are becoming more visible, but in many ways have always been here, or have been here for a while, right? So if we're talking about where do we go from here and what are the hopes from here, and one of my hopes is that as all of these disparities, I feel like they're entering the public conversation in a way where I haven't seen them, at least in my lifetime, right? We're having conversations about disparity in health, along racial, ethnic lines, and that's making like mainstream news in ways that I haven't really feel like I've seen it before. So in a sense, like when we're talking about these root causes now and when we're looking at them, I think that's like a step that we need to take, that we've been needing to take for a while.
Right. So, and I know you're a policy analyst, and Margot, you're a researcher, and I'm thinking about, what does the research show? What is the experience? I kind of feel like, from my knowledge of the addressing homelessness, in particular around the AIDS crisis, but even outside of that, has been kind of patchwork. And I was familiar with some of the early efforts that were done on a community basis, and I'm thinking in particular of my friend Hank Wilson at the Ambassador Hotel, and just an amazing pilot project that he created there from scratch and no resources, of bringing together a really holistic effort to address homelessness and health issues in basically a jury-rigged hospice setting, really, at the time. And there were other efforts like Hopwa, which were like really important, but it was also kind of piecemeal, and seemed to be targeted and addressed, and you had to sort of meet the qualifications for the program. So I'm just thinking, you know, what has worked and what has not worked, and what are we doing now? I guess.
For homelessness, or yeah, I mean, I think you know, we actually know what works. We know what works. We just have never been able to get the public buy-in to do it for scale. And I think we've kind of perhaps failed in communicating it, and failed in messaging that, for instance, the fact that homelessness is increasing is not because permanent supportive housing doesn't work. And it actually sort of terrifies me with this administration that there's been a lot of leadership and talk of what we need to turn back on these housing first principles, when in fact we have about as solid as evidence for that as we have for anything that we do. We actually have actually the only place where we've been able to actually show that housing directly impacts health, and it's not that it doesn't impact health. It's been hard for us to show it, is that with HIV, we have really pretty convincing evidence that that if you take people from homelessness into housing, you see a direct result on viral load, and you therefore see a direct result on, you know, life expectancy, transmission of the disease. I mean, it's actually, in some ways, HIV has these clearly measurable outcomes that make it, in a weird way, easier to study. And so that is actually the only disease model where we actually have really convincing evidence that housing improves health. But, you know, I joke that, like, I spent a lot of years memorizing the Krebs cycle to spend, you know, most of my time working on housing. And that's because it became really clear to me that there's literally nothing we can do in healthcare that's as powerful as housing if you're talking about someone who's homeless, which is, you know, a very vulnerable, obviously, population. And so we know what works. We know that if people have significant behavioral disabilities, they need to be offered housing that's deeply subsidized so that they pay no more than 30% of their income on it. It needs to be done on this housing first basis, which literally means you do not need to treat your substance use disorder. You do not need to treat your mental health disorder before you get the housing. That cannot in fact be a precondition for the housing. You need to start with the housing. That was sort of the Ambassador Hotel's genius, right? You start with the housing, and when people are in housing, you wrap services around them. We kind of know that the answer is housing. And so I like to think about it very clearly, like, if we could actually suddenly come up with a housing that everyone could afford on 30% or less than their income, we could basically house nearly everybody. Some people will need a lot of services, some people will need a little services, and some people will need no services. You know what, I feel like housing crises, usually homeless crises, get blamed on mayors and board of supervisors, you know, city council members. It gets blamed on them. And actually, they have the least power actually to do anything about this. It's really—
Thank you, Margot.
and then the next people it gets blamed on are like governors and state senators and assembly members. They have a little more ability to do something than local government, but still not. And then we completely let our federal officials off the hook. And just to give some statistics that are just really obvious, like I you can look around at my room. My husband and I own this house, and that means that the federal government subsidizes my housing on a very large level. So I like to start my talks by saying I live in subsidized housing, and people kind of look at me and they're kind of like, huh? You know, any of those of us who own our housing live in deeply subsidized housing. But we don't subsidize renters' housing. And in fact, if you meet the criteria for rental assistance, which is extremely strict, so forget about the fact that a lot of people actually need rental assistance and don't meet the criteria. But even if you meet the criteria, only 1 in 4 households in the US get it. The list to even get on the waiting list for that in San Francisco opened up last year, a couple years ago, for like 3 months for the first time in a decade. You can't even get on the waiting list for that. If we changed that, you know, yes, we need to change some zoning laws. Yes, we need to produce some more housing. If we change that, homelessness would go away. If we gave people a living wage, right now, the housing wage in the Bay Area is about $45 an hour. And, you know, we're fighting for 15. Well, $15 an hour, we can't even get people to, or we barely can get people to, and that won't get you housing. You need $45 an hour to pay for housing in the Bay Area. It's like, it's not complicated. It's a complicated political calculus. And I think because I don't think, and this is just to say to what Brett is saying, like 1,000%, I don't think we can separate homelessness from the insidious effects of structural racism, right? Remember that housing is the main way that Americans have built wealth. Remember that until very recently, Black Americans were quite literally and legally, by the way, it was totally within the law, basically cut out of the housing market through redlining, through, racial covenants, through the inability to get housing through GI Bill, which is one of the reasons why Black Americans have like 1/63 the wealth of white Americans. We now have fair housing laws in the books. They're really poorly policed, or police is the wrong word, but you know what I mean? So that we know that Black families and Black households enforced, thank you. Black households pay more money for the same housing as white families do, and then you realize like our entire educational system is built around our housing system. So those old racial covenants like sort of tells you how good your educational access is, all of these things, the racism in the criminal justice system, the racism in the employment system. That's why we have such deeply disparate outcomes. And I think that to change that, we would need some really big changes, but we need to demand more of our federal elected officials and stop pillaring our local officials who have control of zoning, and they have control of some local laws, but really, unless we can change that 1 in 4 ratio, unless we can build some more ELI housing, I'm not sure that we're getting out of this mess. And so I think that it's partially realizing where the locus of control is, it's partially realizing what we need to do. But the question here is not how do we solve this? We know what to do. This is, an HIV and a vaccine for HIV or COVID is very hard. Right. Homelessness is not hard. It's a political problem.
Thank you. I mean, that's really important to keep that context in mind. And I'm so glad you kind of framed it as a political will question and placed the responsibility or blame, if you will, on a federal level. However, I think you're talking about systemic solutions for homelessness itself. And those systemic solutions are going to take time. And that's not something that we have right now, of course. And that's why, and I think on a local level, advocates and politicians, including everyone on this panel, have a role to try to come up with the shorter term solutions. And I understand it's like it's a flood. And the flood is going to keep coming until we have a systemic solution. But right now we have this pandemic. So, Jennifer, thoughts?
Yeah, I mean, I know we're going to do questions and answers at the end as well. But I think a lot of the questions that I'm seeing on the Q&A are around how can we make a difference? How can we, I mean, we're in this crises mode that's now, I realized, I went back and looked at the mayor's press conferences and, we're basically going back 10 weeks now as we're talking about how to address this. And when the city started procuring hotels, although it took until about 6 weeks in before the first person was housed off of the streets into a hotel. Which is really frustrating. And we still have thousands of hotels that are offered that the hotelers would be willing to allow folks to move into, but that remain empty. And today we have about 1,100 unhoused people in either hotels or RVs since COVID started. We still have about 1,000 people in shelter, and this is, I think, an area where, kind of going back to the racism thing, I mean, in a lot of ways, the reason that we don't get the response that we should get on this issue, in the same way that we get for the general population and sort of these, it's almost like there's, two kind of responses. And for poor people, it's a very different situation for them. For extremely poor people who, when the city announces everyone needs a shelter in place, and we all, most of us take that civic responsibility very seriously. For the unhoused community, they're unable to do it. And they're unable to keep themselves safe. They're really worried about their community. They're worried about their family members, and they don't have that opportunity to shelter in place the way that other people are. And now they actually don't have even a way to keep their phones charged. Cafes are closed, the libraries are closed. They have no way to keep up on the information around, we talk about the science with COVID. I mean, it's changing every day. I try to stay on top of it, but there's things are different. We're going to be immune. Now we're not immune once we have it. I mean, these things are, constantly in flux. And so, so this is really important information. So I think, for the unhoused community, it's been absolutely brutal, this COVID virus. And then, but the response in San Franciscans in terms of fighting back and what that means, and has been also phenomenal. People have been stepping up and not just organizing mutual aid for folks out on the streets, organizing food to make sure that people don't go hungry, organizing real material aid in terms of making, like tons of hand sanitizer, distributing thousands of tents. I mean, doing all these things in the meanwhile, and also fighting really hard for hotel rooms. And that has been the main push that folks have been doing. There's been protests that have been happening every couple of days, not throughout this entire time, but pretty close, and using a lot of creativity. The faith community has stepped up. The medical community has stepped up. The unhoused community has stepped up. Everyone coming together. There's been housing takeovers. There's been protests in a bunch of different creative ways. There's been tons of different banner drops. There's been all this artwork that's come forward around, getting the message out there around hospital, hotel rooms, not hospital beds. And I think, and so as a result, things have really have shifted in terms of the city policy. It's not where it needs to be. So they started with the idea that we're going to move everybody into these mega shelters. Really bad idea. We fought hard against it. Once we released pictures from inside one of the mega shelters through Street Sheet, our newspaper, within 12 hours, the city changed course and said they're not going to do that. And they dropped that idea, and then started moving towards the hotel rooms. Originally, there was really, they were pretty slow moving and kind of planning ahead. And a lot of that has shifted now. Today, we're still way far behind on getting the folks on the streets into hotel rooms. We've only gotten less than 200 in. So we got a long ways to go, but they did move a lot of folks that were vulnerable out of shelters. We would have preferred they closed the entire shelter and move the entire operations into hotels. And then that way you could better utilize the staffing and don't have that. And you can move other folks off the streets in there. We would like them to use, hire the unhoused community to a greater extent, hire resident advisors who are living in the hotels instead of having this really intensive, security on every floor and multiple staff on every floor. So there's a lot of stuff that needs to be done.
Yeah, but these are all really good reminders, that we do have agency on a local level to try to, just help our neighbor or to help come up with solutions. And I'm really struck with, in particular, the shifting public policy responses as we gain better knowledge, perhaps, of the disease, but also as the public health infrastructure consults with people like yourself on the ground who are the experts also in terms of dealing with homelessness and the appropriate responses. And I think there's really a parallel there with AIDS as well, that frequently the public health infrastructure and the government policymakers were advocating one thing, and then we would say on the ground, well, you actually have to think about people. How is this going to affect people? And let's let the people's voice be part of the public policy process. But I want to go to Brett, and he had his hand up a couple of times, and I apologize for taking a while to get to you.
Thanks. I'm turning my phone down now. I did want to say this, and this is where, as I sat here and listened to everyone, and it's quite inspiring. and it sparks thought, and I'm seeing all the really great poignant questions that are coming along the way. I'm thinking of a couple things, and I've been in nonprofit work for 30 years, been running organizations across the United States, and here's what I've come to learn about some things that seem to be historic and resistant in many ways. I have the fortune and the benefit of being in a position where I get to hear from the ground what people are interested in and are in need of. And for an example, I'm going to use out the African American community. And every time, I'm just going to be honest, every time I'm around a bunch of Black folks and I get them in my house and we're talking and we identify what we believe we need. And then I also have the good fortune of being in an organization where I get to sit around very smart, capable, erudite individuals who are well-studied and multiple degreed, and they say what they think should be offered. There is always more of a disconnect than I am comfortable with. And when I think of that, I think of the welfare system that wasn't designed by the end user or the beneficiary, or they would have held welfare to work long before welfare to work came on, and they would have child care services that would have allowed people to go and have training and go back to work. And I worry, even in the HIV community and the HIV response, in the CDC, yeah, Margot's right. Housing is a structural intervention. They've identified that as the CDC as a structural intervention. Do you know what they never identified as a structural intervention? Work and employment. So housing is always great. Housing and employed, which I have a feeling everyone on this panel and beyond and many listening who have both, really, that's what it's about. So it's about figuring out what the wraparound services is. And I'm nervous that we are going to recreate kind of a George Orwell's Animal Farm of, great, we'll do everything we can to get it, but have we done all that we can? Because if we didn't, we created a subsistence model where people are in a type of a welfare where there really aren't vehicles for them to get out. And that's what happened in the HIV community. We did an extraordinary job of providing lots of services for care and prevention. But what never got funded was vocational rehabilitation for the person who finally now has 15 to 20 years of their life that they're ready to go back to work, and where they found value and where they wanted to be a contributing member of society. Those services weren't there. And I'm proud to say PRC has an employment services program, the oldest in the nation, that got that in 1992 and remains that. But a proliferation of those services that were across the United States. So in many ways, once you went on to disability, you kind of sort of were expected that you would just stay on disability. And there wasn't that kind of active conversation about what do you really need? You, doctor, who went to school for 8 years and unfortunately are now positive, but now have a second lease on life. What do you need in order to transition back? And that's the conversation that I'm interested in having, which is getting the direct recipients in a room to say, we think we know what you need, but tell us what you think you need. And the other model is from a strength-based approach. And Margot again said it, this isn't hard, this isn't rocket science. All we need to do in terms of looking at success is to see how our lives function. And if those elements and features of our lives truly are a representation of success, then that's exactly what should be in place in some form or fashion for those in order for them to be a success. So my last thing, yes, housing, absolutely. But housing with true wraparound services that allow folks to have some living wage and some way in which they can exist here in San Francisco. Most of the people that we serve in our programs who are on disability couldn't afford to get off of disability. They want to, but they can't. They don't make $45 an hour, right, $65 an hour to afford the affordable housing that is being offered them. So there are, in many ways, if we don't pay attention to it, structural barriers for people to even move forward, for those who even want to move forward. And so I put it out there as challenging even all of us who are the advocates and the experts in the field.
Yeah, and I want to go to Nick with this question, and I'll ask a question, then you can say whatever you want. But what's on my mind is the prospect of looking at the COVID crisis, as we did with AIDS, as being a specific crisis dealing with the intersection with homelessness and coming up with some pathwork solutions. But maybe in this case with COVID, we can come up with like a parallel track, look at, you know, the hotel rooms, the safe sleeping sites, and the solutions to get people off the street and into some kind of point of care or access to care point. And at the same time, come up with some longer term structural proposals that can be put together, the permanent housing solutions, so that we can transition people out. I don't know what's going to happen to people when they come out of the hotels and the safe sleeping sites. Can you talk about that? What are you seeing?
Yes. So I'll start a little bit with, in thinking about kind of some of those solutions, some of the long-term solutions and some of the structural things you mentioned, right? Like, I think one thing that is a very powerful lesson that comes out of the AIDS crisis and that comes out of the work of, you know, groups like ACT UP and a lot of the AIDS activists are kind of the inclusion of a lot of people with lived experience into like the design of some of those services, or maybe the demanding that they be included in the research. They have a seat at the table at the research table, right? And one thing I would like to see us move towards in kind of getting to more effective solutions is moving towards more of a kind of like a results-based accountability and involving people who are closest to the issue, involving people with lived experience, right? Because it's my firm belief that the people who are experiencing the issue, the people who are, you know, closest to the issue are also closest to the solution. And we're not going to find the solutions until we ask them or until we involve them. And other things I wanted to touch upon too, right? I wanted to bring up this funding aspect again. And I know this is difficult to conceptualize because, you know, when there are all these numbers thrown out there, we don't have that in perspective, right? We hear like, oh, you know, whatever, 300 million is spent here in San Francisco on this. We know this federal pot is 2 billion or blah, 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 but we don't know what that means in perspective, right? So to put it in perspective, one of the big things we do at the place where I work is we, you know, work with the largest pot of federal homelessness funding. And it's about maybe 2.4 billion or something in the last funding cycle. So to put that in perspective, that's our federal government, right? And if we compare that to other things our federal government spends on, you know, we spend maybe what each aircraft carrier, if we want to buy one, is like 12 billion. So a single aircraft carrier is what, like 12 billion? The entire kind of pot for federal homelessness funding, I think last year, 2.4 billion, around there. You know, Margot can let me know if that's the right number, you know, but that's the perspective, right? And then talking about, okay, what happens with that funding and how do you spend that funding when we get it, right? So from my perspective as someone who offers technical assistance, who works with these communities and supports them in their efforts to reduce and end homelessness, one thing I wanted to touch upon that was brought up was this kind of idea of how strict these requirements are, right? And how difficult it really is to get, you know, rental assistance and work with these funding streams. So like these funding streams are some of the most complex, like full of shit funding streams that exist out there. So there was one, there was
a technical term.
It's a technical term, but not my official home base perspective or message. But to kind of give you a little anecdotal story, right? There was one community we were working with. They were a domestic violence provider, and they were thinking about applying for this grant that was like $50,000. And they ended up not applying for the grant because the reporting requirements and all the requirements they would have to comply with in order to get that grant ended up costing more than the grant itself. So it's like, they wouldn't have been able to serve all these people. They would have had to spend all this money on this software, recording this. They would have had to spend all this money, you know, keeping this separate, doing all of these things. And at the end of the day, they would have had no money. No money for actual people who are experiencing issues. And when we look at some of the federal money that's coming out right now with the CARES Act, like no requirements. Like they can literally, you know, for some of these pots of fundings, it can go to whoever. It doesn't even matter, right? And like for myself as a renter and as someone who sent a lovely letter to our landlord last month informing them that we would not be paying the rent, that's something that deeply concerns me because when we're talking about things coming up, when we're talking about like, you know, this impending renters cliff, eviction cliff, you know, there are some estimates that say homelessness is going to increase by up to 45% if we're staying our current track, which is, that's a massive number. That's hundreds and hundreds of thousands of people.
Yeah.
And there's been to date no meaningful support for renters. Nothing. Like an eviction moratorium, you know, that's great, right? So we have until December to cry in our room.
And you'll still owe when it's over with,
but
right?
at the end of that, like, okay, well, now we owe all of this back rent. How are we going to pay for it? And the answer is still like, we don't know.
Right.
And that's something that, you know, we have what, 50% of the people in California are renters roughly. So that's a lot of people.
Yeah, yeah, that's all really interesting, and I want to kind of touch back on one thing that you brought up, which is, you know, just the opportunities that COVID has opened up, and some of us old AIDS activists have been thrilled and also kind of like bittersweet about it. It's like, wow, you mean it's really possible for researchers to collaborate before they publish, for them to share their findings, and, you know, not have to go through peer review and all that kind of, you know, and it's really possible for trillions of dollars to come down and be directed out, and so on. And so it is kind of amazing when there is a political will, what is possible, you know. I'm currently not paying back my student loan for 6 months, you know, because I went to grad school when I was 50, and it's kind of nice, you know. But you know, it was considered sort of ridiculous to forgive student loans even a few months ago, or to consider that as a policy. So it's really kind of interesting. But to the political will thing, each of you kind of touched on that, and Raphael, I'm interested in it. And before we go to the questions, I in particular want to hear your thoughts on this. I know it's super frustrating. We talk, and the limits of supervisorial power are, you know, we're all learning about that, I think, more than we had previously, and the mayor's power as well. I mean, there's a limited budget to work with, and there's a lot of constraints. But you know, what is possible? What is the agency that we have to come up with solutions in the short and long term around this? In San Francisco in particular. Can I just throw you that?
It's just a little softball thing.
Yeah.
I don't even know what that means. Softball. So I mean,
aggressive thing. It's passive aggressive is what.
I do think that the sort of the thing that I hope we don't forget, I don't think we will. I mean, I think that we have learned from COVID is that the world does not have to be the way it was. That we as a country, as a world, even as a city, can dramatically change the way we have been doing things like overnight. And so that's like one set of, I think, really an important thing to kind of like take, you know, to understand. I also think it's the case that, and not to, you know, I think to echo, you know, some of what Margot and some of what Jennifer have said, the federal government really, really matters. So if you look at the COVID response, yes, we as a city turned on a dime, shut everything down, and still couldn't provide our public health providers or anybody really with the PPE that they needed to do the, you know, to keep themselves safe and to keep their patients safe and to keep the people they were engaging with safe. We still, 2 months into this, because of the federal government, are not able to test in the ways that we should be testing people. We should have begun a testing regime 2 or 3 months ago that at this point would have us expanding our workforce, and our testing and tracing wouldn't be 60%. It would in San Francisco, which is leading the way. It would be 90% in San Francisco. So on the one hand, COVID shows like we can change things and do things really differently. And it also shows that our ability as a city to do things differently is really limited when when we are inhabiting when we are here in a country that has its values and dollars so mismatched, as Nick has talked about. In terms of what we can do locally, I think it is Jennifer's job, it is to push us beyond the limits of what we think is possible. And I would look back at even Proposition C 2 years ago, which was cooked up by activists, was far greater in a dollar amount than anybody probably in City Hall thought could get passed, and yet they got the thing passed. And ultimately, we will be able to do extraordinary things with those Prop C dollars when we can finally touch them. So even then, kind of absolutely, and what has been done locally, I have no doubt that the progress that the city has made on hotels is in part the result of the persistent demands for hotels that have come from the community, that have been advanced by my colleagues on the Board of Supervisors. And the mayor and her administration are the people who actually do the work. So even if we were to say, and we have said, that there should be 14,000 hotel rooms made available, then it falls to the Human Services Agency and the Department of Public Health and a whole set of bureaucrats who have to make things happen. And seemingly, and they will continue to be pushed, I'm sure, but they haven't been able to come up with hotel rooms, not for all unhoused people in San Francisco, but not even for the vulnerable people who they themselves would acknowledge they could get paid for out of FEMA if they could figure out how to do it. We are far away from putting in hotels, even those people who we could get the reimbursement for. And I don't think that's any more. I don't think that is a municipal failure necessarily, any more than the PPE, than the lack of PPE, the lack of testing. This is a city, 2 months ago, we were not set up to solve homelessness. And so we haven't been able to do it over the last 2 months. I think the hotels that have been brought online is a success and not nearly enough, which is why I've been sort of advocating for safe sleeping sites and other things as well.
I loved your piece in the BAR today, by the way. Yes,
well,
thank you for your work on that.
Yeah, so in COVID, we have to do the best we can with the resources that we have. Post-COVID, we will continue to try to do the best we can with the resources that we have. I think in a lot of ways, San Francisco is leading the way in its response to the COVID crisis. But it's going to be really hard for us to come up with long-term solutions to this other ginormous public health crisis without a different set of responses and help from the federal government.
So, and Raphael, I really appreciate you acknowledging the role of advocates. You are also an advocate, but outside government advocates, in terms of I think, coming up with creative solutions, whether it's cash, money, or pushing for what may seem impossible in terms of setting a goal. But I think also in terms of coming up with creative solutions, and you talked about the bureaucracy. I'm a former bureaucrat, actually, and when I was in the bureaucracy, I worked with, federal civil servants who had been there for years, and I became very discouraged, actually, to be honest. It sort of felt like their job was to make sure that nothing happened, and so that's kind of like the mindset. But Jennifer, limited resources, existing structures, existing rules, what's your strategy? Ask for the moon and see what you can get.
Well, so for us, we try everything. So we do legal interventions. So we have a couple lawsuits against the city going right now. We find that's often an awesome crowbar to kind of crack open doors that are slammed shut. We of course use direct action and use that very regularly and persistently. And that's all different kinds of things, from housing takeovers to car protests to, you know, a number of different things there. And we try to really be creative with it. We try to use a lot of artwork, a lot of visual stuff to put in so that people can get those messages and come up with really great slogans and, you know, different things that are really catchy. And of course, we use social media extensively. And, you know, we also do a ton of research. So like during this COVID, we've been doing a lot of conversations with, you know, folks that are that have all this wealth of information, like Margot and a lot of the medical community, and have had a number of different reports that we put out based on that. And then we also use legislation. We also, of course, try to work relationships that we have and put on pressure that way. We have historically used ballot initiatives. So, you know, it's a number of different things. And I think, you know, we're a local organization dealing with San Francisco, and it's really a, you know, a national issue. But for us and all our work, and I just want to echo what Brett said, because it's just so important. And I think Nick mentioned it as well, but everything has to be centered on the experiences of the unhoused community, you know, like the unhoused community members themselves. And so, you know, we just did our own research where we interviewed 600 homeless folks on a variety of different things. And there was stuff that came out that surprised us that we never would have guessed, even though we're out there doing outreach every day. And you know, one of the things, I'll just give an example, even though it's like top secret, but I'll let you guys in because we haven't released it yet. But the overwhelming majority of folks, when we asked about shelter and what kind of shelter that they would like for temporary, preferred organized encampments. And even 40% of the people, and this for me is kind of really sad. I think it's just like it's like, what have we been doing? 40% of the people who were in shelter would have preferred to be in an organized encampment. So think about that, having a tent as opposed to a structure. Well, of course, people want privacy. I mean, all of this, you know, centers on dignity, and how we approach things, and making sure that in anything we do, that people that are experiencing it are the ones designing it, the ones that are making the recommendations, and the ones that continue to run it. You know, at the Coalition on Homelessness, you know, over half of our board of directors are either homeless or have experience being homeless. Over half of our staff, but everything comes from doing a lot of outreach. And so, me as the director, I act as a facilitator, and every day I'm doing something that I probably wouldn't have done if I had thought about it. If I had just come up with it on my own, I would have never gone to, you know, like with Prop C, we would have never gone to 300 million if we didn't have this collective, you know, like, why aren't you, you know, like, we have so much wealth in San Francisco and the unhoused community saying, look, like you gotta go big, or don't even bother, please. And so we listen to that, and then that's what we're moving forward on. And I think, you know, hotels, like the overwhelming majority of folks do want hotel rooms. They want, you know, there are going to be some people out there that don't, and we have to listen to that as well.
Yeah.
But I think for all the listeners and all the people on this, that this is all, and I think you have some unhoused community members listening as well, but all of us need to activate and assert our power. But when we're doing that, we do it in solidarity with the unhoused community, not on behalf of the unhoused community. We listen to what they want, and then we support and elevate their voices as best we can using our own privilege. And that I think is how we get things done.
Thank you for saying that. And I think that is definitely echoes, you know, our experience during the AIDS epidemic, and I know several of you were, part of that as well, or currently are. And patient empowerment was really something that really took hold, I think, beginning historically with the Denver Principles Conference, and where we crafted a list of principles that we all needed to abide by in structuring, what we're asking for. But it was mostly centered around participation in the decision making. And that really became the mantra, and I most closely worked around treatment and research. And, we became, participants in the design of the clinical trials, and also advocates for, structuring clinical trials, and so on and so forth. And I think that was throughout the industry. So how do we tie research, how do we tie these principles to practice, to public policy, I guess, is the question. And I do want to get to some of the questions that are in the chat, but I feel like we've kind of gotten to a lot of them, and this is one that's kind of coming up. How do we tie in what we know that the homeless community wants, and what the research shows is needed, and tie that to public policy in a really thoughtful and effective way? Question. Anyone want to take that? Nick.
I can say something. So one thing I think is you just bring people in and you pay them for their time and their expertise, right? So when I first kind of started at Homebase, one of the earlier projects I had is we were interviewing across the country, and we were trying to see what's really effective, like what makes an effective outreach team, and people were like, oh, you need this degree, you need this qualification. There was this list people were kind of throwing around, people thought. And like one of the most effective things is like you have someone with lived experience. Like that was just like the most effective thing that was like found out of it. It's like, oh, you just like bring someone in who like knows people. And it was just like such a simple thing, right? And it's a thing I think a lot of communities are moving towards now, right? You see a lot of communities who have these, usually they're called, it's like a lived experience advisory board or something like that. Like Santa Clara has one. And what they do is if there's like a new policy or there's a new kind of proposal they're trying to do, they'll run it by that group, and that group will point something out based on their lived experiences, based on their like understanding of the issue as they have experienced it. And I think, that's already in a lot of places been very effective at doing it. I think what's tricky about that is like funding, right? Because, again, we're talking about these federal funding streams, now with some of there's all these flexibilities with different funding streams that are happening now at the federal level, but it's still like really complicated, and you can't like pay someone on a lived experience advisory board with a lot of these kinds of pots of money. So we got to really get creative in how we're funding these things. So how you were talking about, Terry, right, about the creativity of AIDS activists and how they kind of found these creative solutions and protests and advocacy. I think that's one thing we really need to learn from a lot of those activists, right, is the creativity. Like for better and for worse, like one of the first things I started doing during shelter in place was I watched all these old like AIDS documentaries. It was, at first it was a little depressing, but it was also really inspiring. And I think one of the most inspiring things, right, is how people just demanded a seat at the table and the ways in which they did it, right? Like we have so much money here in San Francisco. Like the amount of money we have in the Bay Area is just ridiculous. We have it's the third highest per capita rate of billionaires like in the world. Like there's no, it's not a question of if we don't have the resources. We have the resources here. We just need to demand them.
Mm-hmm.
Like everyone, tweet at all of our local billionaires, ask them what they're doing. If you work at XYZ company, ask your company how they're contributing. Like there are so many things we as individuals can also do, right? There's hearings for when a new navigation center is going to be put up, when, a new affordable housing complex is going to be put up. Like you can go to those hearings and you can say something, it's public, right? Like I've been at so many of those planning commission meetings where they're putting up a new affordable housing structure and people are like, oh, I don't want this here. Like, I don't want this in my backyard, blah, blah, blah. And like, there was one I was at and it was like, affordable housing and it was 120% AMI, which is like 150,000 for a family of 4. So everyone was worried that, oh, we're going to have all these like poor people here. But like, it was it's like 120% AMI. It's like
Yeah, I remember in the late 90s, I was working as a reporter for the BAR, and I was covering this effort to establish a queer youth shelter in the Castro up at, and Mark Leno was the supervisor for District 8 at the time. It was scary. It was kind of scary to see, you know, what especially the homeowners and the merchants in the neighborhood, how they express themselves in those public meetings. I mean, they almost turned into riots. You know, I mean, it's so scary that we're going to have 10 homeless youths with some kind of shelter in the middle. So anyway, I digress, but I want to talk a little bit about the shelter, the safe sleeping sites. And especially in light of what Jennifer is telling us, she's given us a sneak preview to say that a lot of homeless folks are saying that that's what they want. And we've seen the experience down at actually just a few yards away from the AIDS vigil was for many years. At UN Plaza is now the Safe Sleeping Village, which is about where Camp Agnos was actually, which partly brought down Mayor Agnos. So that's the first effort. It seems to be going well. There's some plumbing in there, and there's some hand washing stations. I don't know what kind of testing is being provided or access to care or what the transition plan is going to be. But what's going on with Camp Everett?
Raphael. Yeah, and I think one good thing about COVID is that it is an opportunity. I mean, it is an opportunity to try new things, and you know, the city had been putting a ton of effort and frankly a ton of money into expanding its shelter bed capacity prior to COVID, and I think you know, in some ways good, but in some ways frustrating, because you know, I think Jennifer would say that, you know, a shelter bed is not a solution to homelessness. It is a temporary place to be, and you don't want to be diverting resources really that you could be using for permanent housing solutions, permanent supportive housing, to super expensive shelters. And so even before COVID, I had been exploring with city staff, you know, whether it might not make sense to try some kind of sanctioned site somewhere, or network of sites that theoretically could be done at a larger scale and more quickly as a place for people to be. Because as a district supervisor, I am incredibly well aware of the game of whack-a-mole that the city plays with unhoused people. I received tons, I and the district police captain and the mayor and everybody receive increasing complaints as encampments grow. You know, we demand resolution of those. Resolution usually means folks are moved, but not too necessarily anywhere, but just dispersed from where they are, which creates a ton of stress for them. Sometimes they lose their belongings, sometimes they lose their medication in that process. You know, so it's all been not terribly successful, I think. And so I was hoping that we would do something like safe sleeping sites even before COVID. COVID has created the necessity of doing them because, and I don't think necessarily my constituents understand that the conditions that they are seeing on the streets are actually the result of public health guidance. It is part of fighting COVID. Fighting COVID means not having people in congregate living situations if they can be in some other situation. And it is better for people in many cases to be in a tent on the street than to be in a shelter where they may get COVID. At least that is, you know, I think what we're hearing from the public health professionals. So this is untenable.
If they're properly spaced and, you know, services.
Well, and then you add in, ideally you add in all the other stuff about properly spaced bathrooms, hand washing facilities, meals, case management. That stuff the city has not been as good about. And so the Fulton site is, is the first safe sleeping village. I have advocated for there to be a safe sleeping site in the Castro because I think I'm hearing from my constituents that street conditions are, awful, which they are. And so, Everett is owned by the school district, which makes it complicated, but the members of the school board are totally committed to trying to be part of a solution. And my understanding is that the city and school district, basically as of yesterday and today, have finally reached resolution on their MOU for that site, and it should be opened within the next couple of weeks. So it would be either the 2nd or the 3rd, I think there's, or the 4th, because there's sort of a safe sleeping site in the Bayview already, I think. And then there may be one in the Haight. And we will see if these work. They're going to have, staffing. They're going to be run sort of like navigation centers. The commitment from HSH and HSOC is that they're going to try to work with everybody who goes in to find some kind of resolution that may work for them, whether it's, Homeward Bound, which has been relatively successful for the city, or a permanent supportive housing unit if there's one available, or a hotel room if somebody is part of a vulnerable population, or or some other resolution. And that is the hope. But I think it's an experiment worth trying. And if this is actually more cost effective than, say, navigation centers, maybe it makes more sense to do these than a massive network of nav centers, which take and are more expensive.
Thank you for the update. So a couple of weeks.
Yeah.
All right. It's I Brett, I just want to call out that PRC has now runs the former Baker Places programs also, which has a lot of transitional housing, in particular around substance abuse and HIV, and you've got the new Hummingbird project also, which is super exciting. Is that up and running now? Did that get slowed down?
It got slowed down by COVID.
Oh, shoot.
Yeah. Slowed down by COVID. But we're doing some design and a little bit of pre-construction. The supervisor has been such a stalwart supporter. It is in, I think, legally your district. It's on that side of the street. So
3 blocks from my house.
Exactly. So that's lovely. And, and I appreciate, to someone's point earlier, that the whole NIMBY thing that came up, and we did a couple community meetings, and, it was alive. And I appreciate you, for suffering really the community slings and arrows, because you just can't have it both ways. You can't say solve it, but yet don't solve it in my backyard. Mm-hmm. My grandmother would say, pick one, because you can't have both. And that's just the stark reality of it. I did want to just acknowledge, many of the people, some PRC folks who were even on the line. So shout out to them. There's a lot of questions that I know were flying around, and wanted to give folks an opportunity to reach back and check in on a couple things.
Okay, we only have a few minutes left, and I feel like we got to a lot of the questions, and maybe sideways, but we got to a lot of the questions here. Some of them are like really specific around literacy issues among homeless, around transitioning people to permanent housing. We talked about Lava May. Harry asks about Lava May, and I think they closed down. Are they back, or what's going on with Lava May? Do you know, Jennifer?
They've reduced their operations in San Francisco pretty dramatically. They are available in some other locations. There was a shower that was put at the Bayview site, and that was purchased by St. Francis Village. And once they closed down that Bayview site, then they moved the showers to Civic Center. So the folks next to Asian Art have showers there. But it is a huge issue. The shower access right now which was always bad, is really bad.
Right. Yeah, and and I think again, I said this earlier, but I really appreciate the really thoughtful comments and background around the root causes of homelessness and really trying to think forward about, what the real solutions are, which clearly I think we've arrived at a solution, which is this political, and it's about political will, and it's about funding and creating appropriate programs for long-term solutions. But what we're dealing with here is not just a homeless crisis, it's a COVID homeless emergency. And so so I wonder if we could just like go around and talk about what's the outlook for dealing with the emergency. What's the most pressing thing that we can do today to help to prevent infections among homeless people, and of course the resulting infections of people that they would come into contact with, which include everyone from frontline healthcare workers, first responders to neighbors.
I mean, I think what we really need to get here, I think the first thing is Jenny and her group has been doing incredible advocacy around is as many people as possible into hotel rooms or some other single space. Hands down, that's got to be, I mean, shelter in place works. It works well. You can't shelter in place if you don't have shelter. I think that it is complex to get there. I mean, it's been remarkably hard. It's not that people aren't working around the clock. It is actually harder than it looks. I think there's some progress being made, but it's obviously slower than anyone would have wanted. I think then there are sort of mitigation things, the next step, the next level of things. One is, mitigation things like, probably safe encampments where you can have hygiene facilities. I think testing has been we haven't talked about it a lot today. It has echoes of the HIV crisis, right? I mean, it's like, testing is, you need to do it well. You can't further stigmatize people, but we are not going to get out of this mess without dramatically increasing our testing capacity and our testing protocols. And I worry that the way testing has been set up is it's actually much easier to do it if you're actually at lower risk of COVID, right? It's easier to do it if you've got a computer and can sign up and have transportation and can get over to a testing site, et cetera, et cetera. And so we need to really redouble our efforts. I mean, I think shelters are a hotbed of infection, and the data coming out of Boston, where they've modeled testing strategies, suggests that you need to test every 2 weeks, everybody, and then appropriately isolate and quarantine people. That is, we need to be doing that regularly. We need to dramatically increase our testing of unsheltered folks. We really don't know the answer of whether it's safer to be in a decongested shelter or in a encampment or a safe encampment. We actually don't know. We suspect it's probably a little safer outside, but we don't know for sure. We need to dramatically increase our testing there. And then we just need to do other routine mitigation things. Masking seems to work a lot. So we want to be sure people have access to masks, knowing that not everyone can wear a mask, but masking, hand washing, all the usual things. But I think it is getting as many people as we can into safe indoor private spaces as humanly possible, as fast as possible, and then work on whatever mitigation strategies we can use. That's improving hygiene, that's getting masks out to people, and that is testing. Testing only works if you can treat, you know what I mean? It doesn't actually help to test if you cannot then offer something to people that is patient-centered, that's centered on people's needs, and that really matches what they're ready to do. I think if we take a punitive approach, it would be disastrous and catastrophic. And so I certainly hope we don't go down that road, but that we really do what we can to mitigate and to realize that this crisis is going to be with us for the next year and a half, hands down. I mean, we're not getting out of this anytime soon. Yeah. And so we need to come up with the short, long-term strategy, and this is, yeah, I know, but the cavalry is not coming, nor is the vaccine coming anytime soon. And so we need to do what we can to keep people alive and safe through this crisis. And this is a place where with federal funding, local government can actually act. Local government is the ones who have to bring the hotels and the other things to bear. But yeah. I think that's how we need to focus on the crisis at hand and make sure people survive the crisis and then deal with the other end when we get to it.
Yeah, thank you for emphasizing the testing. And we're actually doing a panel next month on testing, contact tracing, and quarantine, I think it's called, AIDS and COVID. specifically. Just real quickly going around, like I really appreciated that summary, and if you have something to add, what can we do today? What's most pressing?
Yeah, I just one thing to add, and someone brought it up in the Q&A actually, is the prevention piece. I mean, we got to keep people in their housing. We got to do whatever it takes, because the last thing we need is more people losing. Already people are losing their housing. We're seeing it. We have a bunch of members that have lost their housing, even though they're not supposed to be evicted. So I would add that. Yep. And I think that if nothing else, this reminds us how deeply connected we are. So I have a wish that, you know, as we're moving out of this, that we have serious investments in solving this crisis ASAP.
Great. Nick, anything to throw in there?
Yes, short term and long term.
Just a few seconds, very briefly, I'm sorry.
So short term, I think we need to support each other in ways that we haven't conventionally done it. So that means like contributing to GoFundMes, that means providing like direct cash aid to each other, supporting these organizations through donations. Right. You know, long term, I think we need to move towards a model where we are, you know, where we're putting people first and taking care of each other first, as opposed to where we guarantee profitability first.
Okay, great, thank you. Brett. I'll save you for last, Raphael.
Shout out to the nonprofit workforce. It is just about 18 to 20,000 strong. It represents our middle class. We don't do well with investing in it. We don't have pipelines of paraprofessionals and professionals and licensed professionals. We need to do all that we can to keep them here in San Francisco, things that we did for teachers and for police, around housing, subsidies and otherwise. I want to stay focused on that, because I think the behavioral health fallout from COVID hasn't even begun, and we need to be geared up and ready for that as well. And I know Margot certainly gives a thumbs up on that. And we just put a $38.5 billion request to Congress for COVID-19 response for behavioral health services. So I just want to shout out to our current workforce and the workforce that we need going forward.
Great, thank you. We'll have to do, I definitely want to do a panel on employment, and I'll follow up with you hopefully on that. But Raphael, final comments. And you know, and I just want to throw out there that sort of the unspoken issue here is this the head of the federal government that we have right now, and so I feel like everything that we're doing is crippled in a very overt way, and also in a psychological way. We're not in a good position politically on a federal level to be dealing with this crisis. So what do you see as most pressing in that?
Yes, the most important thing is to beat Donald Trump.
Thank you. I'm a nonprofit. I'm not allowed to say that.
And to the extent that we can do everything that Margot has just laid out. I mean, I do think maybe I have too much faith in doctors, but I have been you know, impressed by what the public health departments around the Bay Area have done, even in really challenging circumstances. And I still am a little worried that we are not, you know, it is clear that we can't go on in lockdown forever, and we're not where I would like us to be as we come out of lockdown. And for unhoused people and for all the other vulnerable people, for the, you know, in San Francisco, I think is the only county now that is mandated but has not quite figured out how to have all skilled nursing facility residents and workers tested on a 2-weekly basis. And that's the only population that we've really dug in on. So, you know, trying to figure out the SROs and the shelters and the safe sanction sites and the street encampments, like there is so much more to do. And also to figure out, you know, for these, you know, these between 20 and 60 new cases that we see every day, you know, who are they, where are they coming from, and and how much larger is the real problem than those cases that we're finding? We don't have the tracking and tracing where we want it to be. Mm-hmm. So
there's a lot.
There's a lot.
God bless you, Raphael. Thank you very much for your leadership and your advocacy on this work and everything that you do. And thank you, Jenny, Brett, Nick and Margot, for your contributions to the panel tonight. I really appreciate all the work that all of you do on a daily basis. And I just want to make one quick pitch for those who are either watching on Zoom or on YouTube or as a recording. Become a member of the GLBT Historical Society. Go to our website, glbthistory.org. This programming, we're getting a lot of great feedback from people about it, and we have a lot of great exhibits. Our work continues, even if it is on a virtual level. It's real and it costs money, and we're going to be facing some hard times like a lot of other arts and culture nonprofits. Housing, healthcare, all that's important, but we got to live too. Arts and culture, remember our history, make sure that our youth learn our history. It's important. So please become a member and help sustain our work. Thank you all. Dinner time, wash your hands, come again.
Thanks
Have a
so
good
much.
night, you guys.
Okay.
Hi, my name is Lito Sandoval, and I'm on the board of the GLBT Historical Society. Thank you for listening and tuning in to the Fighting Back the International AIDS Conference in San Francisco, 1990 to 2020. You're about to hear some great stories and anecdotes from various ACT UP veterans. You're going to hear about not only how we organized, but also how we had fun. One of the things that I regret not mentioning in the original broadcast was that I had called in sick to work to attend a demonstration that I had helped organize. Now, of course, I got filmed by local news getting arrested. So the next day when I went to work, I worked at a court reporting school. All the students were coming up to me about how they saw me on TV. My director at the time actually said nothing, although I knew he'd seen. So go forward a few months, and me and this director actually ran into each other at another conference, and he actually thanked me for doing what I did, and really showed appreciation of ACT UP. Again, hope you enjoy the program and enjoy all the stories you're about to hear.
Hi everyone, welcome to Fighting Back, Lessons from AIDS to COVID, an event series that's hosted by the GLBT Historical Society. My name is Terry Beswick, and I will be moderating this evening's event along with several of my esteemed fellow veterans of the 6th International Conference on AIDS, held in San Francisco in 1990. So tonight's special reunion event is being recorded and will be posted to our website. Many people may be watching the live stream on Facebook, and I welcome all of you. If you are watching with us on Zoom, we welcome your active participation in tonight's forum, and more about how to do that in just a moment. So first, let me just introduce the Historical Society in tonight's events and the panelists, and then we're gonna plunge in with sharing some war stories, okay? So founded in 1985, the Gay, Lesbian, Bisexual, Transgender Historical Society is recognized internationally as a leader in the field of LGBTQ public history. Our mission is to collect, preserve, exhibit, and make accessible to the public materials and knowledge to support and promote understanding of LGBTQ history, culture, and arts in all their diversity. So our operations are centered around two sites, the GLBT Historical Society Museum, located since 2011 in the heart of San Francisco's Castro neighborhood, and the John P. DeCecco Archives and Research Center, open to researchers in the Mid-Market neighborhood. And although our physical locations are expected to remain closed for a while due to the COVID pandemic, please do check out our website, which includes a wide array of exhibitions, recorded events, and archival resources at glbthistory.org. And while you're there, please do consider becoming a member to support all of our programs, including events like this one. And a big thank you to everyone who made a donation when they registered for tonight's event. So Fighting back, lessons from AIDS to COVID-19. As with HIV/AIDS and the LGBTQ and other communities, the COVID-19 pandemic has upended daily life, culture, and economies of the entire world's population. And as with HIV/AIDS, the death toll continues to mount while we have been faced with a federal government that has been tragically slow to respond. And as with HIV/AIDS, we not only struggle to survive COVID-19, we learn to thrive within the pandemic and imagine the world we want to create after COVID-19. So with the Fighting Back series, we hope that people will be inspired to find ways to transform their possible feelings of anxiety, despair, or anger into action, and to find models for building community and solidarity in the midst of the pandemic. So tonight's forum is it's not really a forum, it's more of a reunion event, we hope, focusing on the 1990 International AIDS Conference in San Francisco. So 30 years ago, the 6th International AIDS Conference was held in San Francisco at the height of the AIDS crisis. Activists and people with HIV from around the world confronted political and public health leaders demanding action in response to the growing pandemic. This reunion of activists and attendees of the 1990 conference will provide opportunities for remembrance of the conference and to reflect on the conference's legacy and role during the COVID era. So this event is being held during the International AIDS Conference, which is currently being held online from July 6th to July 10th. And so with that, let me just briefly introduce each of our moderators for tonight's event. And then we're gonna kind of begin with going around the room and asking everyone to sort of get us started in sharing recollections from the 6th International Conference or any kind of reflections that you have on it in the current climate. Starting with my friend Moises Augusto Rosario. He's a long-term treatment advocate and educator for people living with HIV and AIDS. He is currently Director of Treatment for the National Minority AIDS Council and MAC in Washington, D.C. In the 1990s, Mr. Augusto Rosario served as the editor of Cita Ahora, the Spanish publication of the People with AIDS Coalition of New York, and was an active member of ACT UP New York from 1988 to 1992. Mr. Augusto Rosario has lived with HIV since 1986. Welcome, Moises.
Thank you for having me.
Gerard Koskovich is a San Francisco historian and rare book dealer. A founder of the Historical Society, has been active in the movement to create LGBTQ archives and museums for nearly 4 decades and has curated numerous exhibitions. Koskovich has presented widely, including talks at the go ahead, Gerard, just pronounce it for me.
The École du Louvre.
Thank you. I went online actually to hear a pronunciation and it just doesn't stick. It's just Kyoto, and also at Kyoto University and Oxford University. His writing on LGBTQ history and culture has been published extensively in English and French. He has lived in San Francisco since 1988 and was a frequent legal observer at ACT UP San Francisco protests. Welcome, Gerard. And Carol Lee, my old friend, also known as Scarlet Harlot, is an American artist, author, filmmaker, and sex workers' rights activist. She is credited with coining the term sex worker and currently chairs the Sex Worker Film and Arts Festival and is the director of Base One, the Bay Area Sex Worker Advocacy Network. Great to see you, Carol. Brenda Lane served as member of ACT UP San Francisco and was a founding member of ACT UP Golden Gate. She helped to form World, women organized to respond to life-threatening diseases, an organization for, by, and about HIV-positive women. Excuse me. Lane also held the dual positions of Director of Information and Advocacy and Director of Project Immune Restoration at Project Inform. Most recently, she served as the Program Director for the Delaney AIDS Research Enterprise to Cure AIDS, a large government-funded international multi-center bench-to-bedside research effort. She is currently the president of the Linda Grinberg Foundation for AIDS and Immune Research, which funds cutting-edge immune and HIV/AIDS cure research. Hi, Brenda. And I hope you're going to show us a little bit of your exhibit, maybe a few images. I just love it. Lido Sandoval. Hi, Lido. Lido has served on many nonprofit boards in the Latino and LGBTQ communities. He is a former president of the San Francisco Latino Democratic Club and was a former secretary of ACT UP San Francisco. We have secretaries? I don't remember that. Okay, maybe that was after my time. Lito's essay, I Love You Alto, appears in the anthology Virgins, Gorillas, y Locas, Gay Latinos Writing on Love, published in 1999 by Kleist Press. And for me, I'm the executive director of the GLBT Historical Society. I was one of the founding members of ACT UP San Francisco. And during the international conference in 1990, I was in the process of actually merging the Community Research Alliance with Project Inform, which became the research arm of Project Inform, and initiated the position that Brenda actually later held, the director of information. Was it information and advocacy when I was doing it? I think so. It's really great to have all of my colleagues here with us tonight. So one note before we begin, we see our work as intersectional at the Historical Society, and issues of racial and trans justice and equity have become central to many of our recent forums. We're excited to be part of the growing movement calling for an end to police brutality and white supremacy. So I invite you to make that your focus as much as you like during this forum, as it is deeply related to the fights against AIDS and COVID. And finally, I just want to give a few notes on how to participate tonight during the event. So for everyone joining us on Zoom, I invite you to begin queuing up whenever you like. At the bottom of your screen, you should see a hand function or raise hand function. And if you just hover your mouse over that and click on it, then we're going to start seeing your hands come up. And after we go around the room of the 5 participants in the panel, we're going to start going to each of you in order. And I'm going to ask each of our panelists to talk for just a few minutes, 3 to 5 minutes to get us started. And then that should leave us a good hour for some dialogue and exchange of stories. You know, this is not an oral history program, so we won't be doing any hour-long dissertations, but we will be hopefully capturing some wonderful little anecdotes, stories or vignettes of occurrences that happened. And if people do want to share, do a screen share of any images or video that you would like to share with the crowd, please do that. Oh, hi, Mike, I see you there. Let's see, what else do I want to say about that? Oh, also there's the chat function here. I see people are already using that. If you just want to chat with the panelists or with the participants, you can click on that. If you want to share any websites or resources there, that's a good place to do it. Any events that are coming up that you'd like to share. And if you have any questions, or there's another way, there's a Q&A function down at the bottom there. If you have a question that you want to ask of one of the panelists or one of the other participants, that's a good place to do it. So this is a little bit of an experiment for us. We haven't done this before in a way where we have a panel and then we're going to go to the participants and allow you to get on the screen with us. But we're trying to replicate what we've done a few times before in the Casto and at the museum here, where we've had ACT UP reunion events, and it's always been a really wonderful gathering in a full house of people just sharing really, you know, wonderful, emotional and inspiring stories. To the extent that that's possible here, we're going to try to do that. And so once you join us on screen or by audio, we're going to try to keep you on, even if we mute you. And I forgive me if we do mute you. We will unmute you if you would like. But sometimes we get too much noise going on all at once. So with that, Moises, I had you first on the list. I don't remember seeing you at the conference. Were you there in 1990? You have to unmute yourself.
I was there at the
Okay.
conference. And I actually came with ACT UP New York, with the delegation of ACT UP New York. And, you know, it's funny because the first thing I thought was like, how old was I? And, you know, I was 25 years old, right? So this conference was like this big, huge thing for me. And, you know, being someone like so young, HIV positive, you know, with all these things going on, coming to the conference was very significant for me. Two things from the conference that made me think about things that we are that were significant to me, and that when I think about where we are now, they're still significant to me. The first one was when all the ACTUBs together shut down Dr. Louis Sullivan, who was the Health and Human Services Secretary, and was the only, I think was the only representative of the Reagan administration at the conference. So he was scheduled to speak in one of the plenaries. I don't remember if it was the first one or the last one. So ACTUB decided to put together a demonstration to shut him down and take over the room. And one thing that I remember very vividly is the discussions that we had in the planning of that demonstration. And it was, one of the things was that we thought that it was good to have all the people of color from ACTUB to be the ones in the front disrupting, the doctor, the Secretary of Health and Human Services. And the reason why was because we didn't want to create a perception that this was a race thing, that we were attacking this. Louis Sullivan was African American, and there was all this, and it's a serious question about, do we, us as people of color, we support this person of color who is in a leadership position, or do we follow, the values and principles of this demonstration about AIDS? And I mean, we were living with AIDS and confronting many things, and the administration was doing nothing. So it was very relevant to see that conversation about race and about the things that we had to do, and how now when we look at health justice, we also are still talking about conversations about race, conversations about, the perception of systematic racism. The second quick thing was an affinity group that was called PEACE. And we had this, I think Kiyoshi was the one that developed the concept of the shirt. And it was like persons with immune system disorder. And it was the first time, and I'm probably going to share very quickly, it was the first time that you see the teachers, PEACE and PEACE with Tony, the first time that I got as a person with HIV to go public in a display, identifying myself as a person with AIDS. And among many people, what we wanted was to make them feel uncomfortable, with having people with AIDS in the conference, which was one of our main accomplishments, was creating those breaches between the government and the activists. So those were very significant, and I still, if we look now, still we're dealing with that stigma for people living with HIV. And we have had many teachers identifying ourselves, but still, we haven't been able to tackle completely why we have to face all that stigma. So I wanted to bring those points here. So just, food for thought about, those issues that still I think are relevant in my life.
Great, thank you, Moises. And thank you for sharing that photo and the article there, and which reminded me just how cute you were, and you're still very handsome. So thank you. Gerard, I'm going to turn it over to you.
Well, thank you very much. I am indeed a veteran of the conference, but I'm going to stand back a little and put on my historian's hat, as I often do. For many of us, those early years of the crisis and some of the later ones tend to blur together, and it's hard to remember the real concrete specifics of a moment. So I looked a few of them up. I also imagine we have at least a few people taking part this evening who were not veterans of the conference, but would like to learn more about what that era was about. So standing back a little bit, the first one, of course, is, and this will remind us of today, the extreme government neglect and incompetence in responding to the HIV/AIDS crisis, and even more vividly with the Ronald Reagan and George Bush, the first administrations, the extreme politicization and the use of this health crisis to advance a culture war to promote right-wing and white supremacist politics. Very reminiscent of yesterday and today. The second one is something that Moises touched on slightly around access to the conference for people with AIDS, but even more broadly at the time, the United States government banned people with AIDS and HIV positive people from traveling to the United States. And yet the International AIDS Association refused to move the conference to a country where people with AIDS from outside the country would legally be able to attend. So those scientific experts were in their blinkered thinking, working hand in hand with the reactionary politics of the US government. For a sense of just how blinkered the thinking of the International AIDS Association was, they didn't know that the end of June was Gay Pride Week in San Francisco. They had no clue. They had no clue that that was a week in which 1 million LGBTQ people would normally be descending on the city. And it would be a mighty nice time for every militant AIDS activist on earth to pay a double whammy visit and have Pride and the AIDS conference all at once. This is how detached these scientific researchers were from the lived experience of a large part of the population touched by the disease that they were researching. And I suspect we may see some similar things today, although there is a much greater awareness in our research and medical establishments of health disparities related to race, income, and so on. A further one is that the conference was a week in which ACT UP and other militant AIDS organizations organized really fantastic militant, forceful, direct action protests with a different theme each day of the week. And the response in advance from the San Francisco Police Department was to freak out about the invasion of perverts and militants to this city. The SFPD had been increasingly attacking militants working on HIV/AIDS issues and attacking LGBTQ people. Just 6 months before the conference was the infamous Castro Sweep police riot, when the SFPD sent half the force to invade the Castro on a Friday evening and declare the entire neighborhood an unlawful assembly because of a small, peaceful AIDS protest. And one San Francisco cop, the notorious Gary Delanis, who was vice president of the Police Officers Association, the notorious guild of brutes that claims to be a police union in this town, said that he had heard rumors that AIDS activists would throw AIDS-infected blood at the police. No such rumors ever happened. And that he just wanted to say, he couldn't say as how the police would open fire and shoot, but he couldn't say as how they wouldn't either. Before the conference, the SFPD was explicitly threatening violence against protesters who were demanding a real change around HIV/AIDS. The other thing I think is important to remember is that 1990, we were 6 years away from the emergence of effective treatments for HIV/AIDS. 1981, when the first cases were stated, and by 1990 in the US, there were more than 107,000 people who had died. 31,000 of them had died just in the year 1990. It was really a moment of extreme despair and extreme suffering for our community. And our activism in response to the conference was driven by grief at these immense losses we were experiencing, rage at the inaction, the incompetence, and the malfeasance of our government and the cluelessness of the research establishment, but also hope to save lives, including our own lives, and dreams that some of us might actually survive into the future, along with the amazing queer culture we had built and that helped sustain us through this crisis. And to sum up, let me just quote a brilliant formulation by my friend Alexander Chee, the novelist and essayist, who also is an ACT UP San Francisco veteran, now lives in New York, who wrote a great piece recently for the New York Times comparing the coronavirus pandemic and the AIDS pandemic. And his conclusion was, this virus, the coronavirus, is not that virus, but this country is still that country. We're fighting many of the same fights, even if the particulars of the pandemics are different. And I think some of the tactics, some of the courage, some of the culture that we developed and that we saw on display during the AIDS conference in San Francisco can be perhaps an inspiration, or in some cases, a cautionary model for people today.
Great, Gerard. Like Moises, you're a community treasure. Thank you for getting us started. Let's see, before I go over to Carol, I just want to say again, you know, we have a few people lining up to join us on screen or by audio. After we do Carol, I think we're going to go to Lido and Brenda, and then first in line will be our friend Mike Shriver, and then Coco Johnson and Laura Thomas. I'm so excited to have such great folks. And then Timothy, is that who? Did anyone find out who Timothy is? Anyway, we'll get to him too. Yeah, so with that, Carol, what do you got for us? Talk to us.
Well, I think I'm going to share the screen first, so let's just see how that works. And it does, right? Got it?
Yep.
Okay. So I just, this is obviously from the 6-8 conference, and there was quite a bit of dynamic action and civil disobedience, and I wanted to share that this particular souvenir and talk a little bit about my initial work with ACT UP and how that applies now to some of the political work that we're doing around COVID-19. So I originally joined Citizens for Medical Justice, which was a small group of AIDS activists from primarily the gay community, and became AIDS Action Pledge, which became ACT UP several years later. And I mean, in the course of it, I was a sex worker, had been for a while. I learned how to be an activist in ACT UP. And ACT UP was certainly did not have a real intersectional kind of identity at that point. I think most of the people were white, most of the people were from a particular community, from the gay community in San Francisco, in our group. But I was very fortunate to work with Terry and many other activists who talked about the way that AIDS was impacting prisoners. And there I found the alliance and allegiance and training about how to how to advocate for marginalized populations. Still, I don't think we had any particular emphasis on race, on being one of the primary factors. One of the things as prostitutes, it was certainly very difficult for us in terms of the laws and in terms of AIDS and our health. But was that there was a state law being developed that there would be a quarantine of anyone who was tested positive in prison. And it was a punitive quarantine because, of course, they don't have the kinds of TV or anything for the prisoners. So I was very fortunate to find Terry Beswick there, thank you, and to work on developing an analysis and bringing forth voices. I remember Hank Tavera, I remember that bringing forth voices through ACT UP to talk about how this was impacting diverse communities. So now, I mean, we weren't very successful, and now, first, ACT UP, sex workers always have had a huge presence at the AIDS conferences. I have a video on one of the links. I'm going to be sharing some links with you from the 1988 Montreal conference. And we had a sex worker activist on one of the plenaries. Cheryl Overs has been very dynamic. All HIV projects all over the world have been central in at least advocating for some kind of representation for sex workers and for disrupting meetings and for providing an analysis. And I think we've made quite a difference, but certainly not enough. I think you all know that there was a law that was a precursor to the national anti-trafficking legislation, and part of it that says that any group that doesn't sign a pledge that they won't, that they're explicitly opposed to prostitution, they won't support any kind of legal prostitution, any kind of decriminalization. I mean, basically just says that they're opposed. They have to sign that in order to receive funds to help sex workers, to work with sex workers. Well, I'm sure you understand that, I mean, the sex worker movement grew exponentially to hundreds of thousands and more people around the world. And part of it was through the way our community rallied around the world to deal with HIV within our community. And I don't know, say we invented peer outreach, or maybe it was the IV drug community. Anyway, just last week, there have been court challenges to this, and last week the Supreme Court just made a judgment against us. Now, the judgments have been going our way in that they said that the pledge was unconstitutional when applied to American organizations because of the First Amendment, and Open Society was challenging that as well for foreign entities because of the relationship between the US entities. But the Supreme Court, for the first time in quite a few years, certainly since before Obama, decided in opposition to us and supported the pledge. So this is an important time and something I'm sure that sex workers want to talk about at the conference. The other thing I want to mention is that for many years, PJ Starr has worked with a number of activists to present sex worker movies, Not Your Rescue Project, and I'm going to just give you the link instead of putting it up on the screen right now, but I'll give you the link, and you actually then have the link to the movies, which describe sex workers in the context of HIV and in the context of advocacy. And the last thing I do want to talk about, so I'm much more focused on current issues, but we are working with the decrim legislation, some young sex workers, and for the first time, our movement has developed such that young sex workers of color have been developing as leaders in the Bay Area. It's been very, very exciting, and it's just taking off. Intersectional analysis has always been part of our movement, but I would say that you could easily say we weren't all that great at it, but I mean, it's been there, and I mean, there have been serious efforts. So now we have some legislation. We're working with an allied group, Rad Mission Neighbors, and some various supervisors, and working on the text and the sentiment behind new decriminalization legislation. So I wanted to basically get up to date with these things.
That's great, Carol. And I guess, I mean, we can say that we're going to be talking about the 1990 AIDS conference and bring in a bunch of activists, and they're just going to talk about what they want to talk about, and that's great. That's
what I did.
Thank you for that. Let's see. I have next on my list, Brenda. Talk to us.
I am going to share my screen and talk about a project that I was working on recently with Terry. And that is, let's see if I can figure it out. Here we go. It's an online exhibit with the GLBT Historical Society Museum, and it really focuses on AIDS treatment activism in the Bay Area. And I just want to put a little caveat. This is a growing exhibit. More is being added to it, and it will evolve a bit more over time. One of the challenges of COVID is that despite doing a lot of research at the SF Public Library, it's really hard to scan the images that we had selected from that particular source, and that was where ACT UP Golden Gate had its archive. So it will be growing. Check back often, take a look at it. You can find it at the glbthistory.org, and it really goes over the history of treatment activism specifically in the Bay Area. So it's not the ACT UP New York story, which is a phenomenal and great story too. It's really the San Francisco story, which was different in many regards. And I encourage people to take a look at it, read it through. So I just want to say that's out there, and I'm going to stop sharing the screen if I remember how, and talk for just a second about my experience with the International AIDS Conference in 1990, which was personally a transformational time for me. I had been working in Shanti Project, doing practical support for people living with HIV. I had been involved with a variety of different HIV-related activities. And I really, in speaking to what Gerard said in terms of what motivated us as a community, it was grief and rage, and the opportunity to go out in the streets for me, was cathartic to walk with so many people who cared about the same thing and express our rage and grief, and then to be able to focus it in unique ways. As I was doing research, I came across a booklet that was put together by ACT UP San Francisco, which was so phenomenal. It outlined what happened every day of the International AIDS Conference. It had dates like, here are the demonstrations, here are the times, here are where you meet, and here's the cafes you can go to afterwards, and here's your legal support, and here's some great bars to hang out on. And that was just a treasure to uncover in the GLBT archives, which I encourage people to explore and look at once they're open. I was so hoping that we would see Iran in the audience of participants today, because I just can't overstate how inspirational he was and is, and what a treasure he is to the AIDS activist movement generally. And I think that this particular conference put AIDS treatment activism on the map in the Bay Area in a way it wasn't before. There was an explosion of treatment activists pouring into, and you really saw a new movement forming on the West Coast because of this conference. It galvanized people around these issues in a way that just, it's not that they hadn't been before, but it really exploded and put the West Coast on the map. And for me personally, one of the coolest demonstrations was the Nordstrom one, and I hope that one of the audience members will talk about it, because I don't want to take up the time. I want to hear your stories. Okay.
Great, thank you, Brenda. Lito, I don't know if I had it in your bio that you're a member of the GLBT Historical Society Board of Directors, but I'll just toss that in there.
I hope you say that I look handsome now as I did back then too.
So, no, you're so cute.
Honestly, my time was ACT UP, when I think back, was actually really short, but it was intense. I got plucked by Aguilas, a queer Latino group, and helping build them out. I was 22 years old at the time of the 1990 conference. I think for me, it was a great learning experience, although a really big learning experience was the year before, on October 6, 1989. But what was really wonderful about the conference is that the way, ACT UP chapters from all over the world came together. And it was just a really, it was just really beautiful. And it was just meeting people with the same goal of wanting to see, treatment for AIDS. We wanted to see women not be excluded from trials, because they were at the time, and they still are from trials. At the time, you made a thing about, you didn't know the club had a secretary, or the organization didn't have a secretary, was recording secretary. So I wrote notes at the time of our meetings. I was involved with the local issues committee, which focused on more local governmental things and city policy. I think probably for me, and also concurrently at the same time, what I remember is, I believe it was Cleve Jones had sort of I guess for lack of a better term, a summer camp of activists. And I just don't remember the name of it. I just remember the snide name some of us called it, which was Act Nice, as opposed to ACT UP. I don't remember why or what we called it that. But also going back to the Lewis Sullivan demonstration, which I wasn't at, but we knew enough about. I'm talking about people, Black, Indigenous, people of color to the front of on the front line, which is sort of the opposite of what we're saying now when it comes to Black Lives Matters, where we're saying white people go to the front and protect the people of color. But this was just an example of how ACT UP was really masters at media manipulation and getting a message across, and understanding how the media worked, Because if we did have white activists all up in front, the news articles would be white activists shut down African-American government official. So I think that was one of the beautiful things about ACT UP, is that we were very media savvy and we controlled our message and we did it very well. And that's all I got to say about that.
Great. And for each of you, feel free to chime in some more. I'm sure there's been a lot of thoughts provoked by each other's comments. And I just want to say hi, Mike. Thank you for joining us, Mikey. It's good to see you. And I guess you've been listening in. And yeah, and I was looking at that flyer that the UCSF has on their new exhibit. Actually, we'll try to put that link in the chat. But if you'd like to share it, I don't know if you've got it pulled up. But you played a role in helping to bring the community into the conference.
Yeah, I did.
Yeah.
And actually, so for a historical context, what happened in San Francisco would not have happened in San Francisco had we not demonstrated in Montreal. At the Fifth International Conference, for people that don't know, ACT UP New York was working with some of the Canadian ACT UP groups, and Aran and myself and Michael Ryan went as sort of the San Francisco delegation to the conference in Montreal, and they stormed the stage before the opening of the conference and read what they called the Manifesto of Montreal. And some of the demands in that manifesto, we actually were able to translate into real programming and real change in the AIDS conference here in San Francisco, two of which were scholarships for people living with HIV and the community outreach sessions, which that flyer that you're talking about was the actual program from these 4 nights of free community outreach sessions that we provided to the community at the War Memorial Opera House, where we literally had the names from the conference come and talk about what they learned, what they know, to give new medical outreach, you name it, updates for everybody. And it was at that conference that Reggie Williams actually said the comment that has stuck with me forever, is that there's no such thing as a hard to reach population. We just have the wrong people trying to reach them. But in Montreal, following the taking of the stage, when the activists left the stage, they went down and occupied the opening rows that were empty. It turns out that those rows were meant for the African delegation. And this is important because when the conference organizers realized that not only was there going to be an activist presence at the AIDS conference in 1990 and that it was Gay Pride, but they had no tangible means of outreaching to the community to help understand what their concerns were. They were afraid of another disruption, plain and simple. So they created this community task force, of which they invited ACT UP to have a delegate, and that delegate was Michelle Rowland, and I was Michelle's alternate. And when ACT UP decided to boycott the conference in sort of collaboration with multinational groups that were all boycotting the conference because of the travel and immigration ban, I stayed on the task force because my agency was happy that I was there. One day, Jonathan Mann, who was the former head of the World Health Organization's Global Program on AIDS, came and met with some of the members of the task force, of the community task force, basically to yell at us to say that if we did in San Francisco what we did in Montreal, it would be our fault that the African nations were mad at the conference or upset with the issue of being disrespected. At which point I said to Dr. Mann, our demands are quite simple. We are getting no cooperation from the conference. We have some legitimate things that we would like to see the conference do. I was a little less politic than that. But the long and short of it is that Jonathan Mann said, okay, I'll help you. What do you want? And so the 2 demands that we said that we wanted were the community outreach sessions and the scholarships, both of which we got, and both of which I'm very, very proud of, because the community outreach sessions did change what I think was the way in which the conference had an obligation to talk to the local community about what was transpiring at the conference. This is all pre-social media. So the idea that you could actually have a free session that people could go to and hear Jonathan Mann or June Osborne or Pat Kristen or Peter Staley, et cetera. And the other thing I will talk about is that, to bridge on what Moises said, the visibility of people with HIV was fundamental at this conference. Not just having Peter Staley being the keynote opening speaker, but for folks that were at the conference, remember that before he died, Vita Russo helped interview about 7 or 8 people living with HIV in New York, and we had a little film of them. And Dana Van Gorder actually interviewed about 6 or 7 of us here in San Francisco, and we actually opened up that plenary with the voices of people with AIDS. So the very opening of the conference was predicated on the voices of people with AIDS. And we were very, very aware of making sure that we had racial, ethnic, gender, sexual orientation, diversity, because that was, from an ACT UP perspective, that was essential to the way in which we presented the voices of people living with HIV. I also got the living bejesus kicked out of me by the federal security police at the INS action the night before the opening of the conference, which was one of the most amazing affinity group actions that I think I was ever involved in. But the International Conference on AIDS was profoundly transformative for me also, because I actually saw how community-based organizations and the activist movement and public health could find some common ground amidst a lot of tension and a lot of justifiable distrust from the activist perspective towards the sort of the staging of the conference. But I think we did a great job of altering the way the conference was. And the manifestation now of the community outreach sessions is the global village. So we've had this profound and 30-year impact on the conference. So yeah, how's that?
That's great.
That's great, Mike. So much information there, and it really, my memory is not great, and I'm the ED of the Historical Society, so it's really kind of embarrassing. But that's why we have archives, is to collect this stuff, and that's why we do events like this. And we have the ACT UP Oral History Project, which is going to be continuing, and I think you contributed to that as well. Yeah, it's great to collect these stories, and there are synapses that are firing there. Oh yeah, I forgot about that. So that's really wonderful. Thank you. Coco, hi, thank you, welcome, thanks for joining us.
Thank you for letting me join.
Yours. Yeah, the floor is yours. Talk to us.
I was very excited to have the opportunity to reflect with people who are also at the demonstration. I flew in with a group of people from ACT UP Chicago, and we were very enthusiastic to participate in the international presentation of ACT UP demands, and to have, I think also very excited to have people see that ACT UP wasn't just a New York or just a San Francisco thing. We've talked about other ACT UPs, but it was very important for us to be present with the national ACT UP movement in various places. And I was lucky to travel with ACT UP here, also to Washington, D.C., also to Kennebunkport, as well as Chicago during my time with ACT UP. And it was, I want to thank the people who organized it to allow us to have local homes to stay in. That was a huge help. I was 27 at the time, just finishing grad school, and having a place to stay for free was a great benefit. Also, I was already involved in the Radical Ferries at that time, and I remember very clearly in the parade being able to march right on the borderline between the ACT UP contingent and the Radical Ferry contingent. So I got a 2-for-1 that way. That was very exciting. And similarly, for me, a really emotional memory is shutting down the Castro on Saturday night, on Pink Saturday. That was before the sisters did it for us. That's when we did it on our own. That's when they tried to run buses through the crowd in spite of it being obvious that that wasn't going to happen. And for me, that felt like a unification of ACT UP and Radical Ferry energy together. The Radical Ferries singing their songs, but the activists from all over the country being there to help meld the energy and take the streets on that Pink Saturday night. Of course, the everyday demonstrations, built us up for that time. And then I think another thing I want to share is I live here in San Francisco now, but this that moment in time, the International Conference on AIDS and what we did in the streets there, that inspired me to carry on with other communities throughout my life, even to being now a past board member of Comfort and Joy here in San Francisco, where I try to bring that same kind of what can we do to build community energy. I just bring that back to San Francisco even now. So thank you very much for the time, and I'd like to pass it back to the host. Thank you very much.
I'm supposed to unmute. Thank you, Coco. Thank you for joining us and for sharing all that. I think next in our queue is Laura Thomas. I don't see Laura. Where are you? Are you on audio?
I'm here.
You're there. Oh, there you are. Hi.
Wandering around cleaning my kitchen, so I
okay.
have the screen on. I want to follow up on one of the things that Lito said about Act Nice and explain what it was. But I also want to, part of what we had all spent so much time, and I was a member of ACT UP San Francisco, part of the Women's Caucus, one of the people who helped work on organizing the Women's Caucus action, helped out with the community outreach sessions that Mike was describing. And I also ended up playing a role in what we called the Act Nice March. And so we had a huge demonstration every single day of the week, and they had themes. So the night before the conference started, what Mike referred to was the INS. It's where it's the same building on Sansom Street. If you've been in any of the demonstrations targeting ICE over the last number of years, you've been there. But it was over the travel restrictions and the immigration restrictions, both, and the fact that they were both in place. Then the first night of the conference, and this is what Moises spoke about, was focused on people living with HIV and their need for access to the conference. We had one whole day that was focused on local San Francisco issues with this tagline about the San Francisco model is crumbling. We had the San Francisco model that was built on volunteerism. It was built on, communities taking care of their own. And we had gotten past the point of that, and we were in this is a disaster. We need additional help. That's part of what led up to the Ryan White Care Act, right? And then the last day of the conference was, there was a desire from a number of the community-based organizations in San Francisco to do something sort of activisty, but not really activisty, in relationship to the conference. And so they decided they wanted to do this unity march. You may have seen on some of those photos, there's a banner that says Unity March. And the idea of unity was in direct opposition to the position of the activists. It was trying to, we're all in this together, sort of, all lives matter, right? So they wanted somebody from ACT UP San Francisco to be a part of the planning group for that. Probably I should have been better at saying no to things when I was that young, but I wasn't. So I ended up being one of the ACT UP San Francisco reps to this group. And the reason that we called it Act Nice, and what Act Nice stands for, is so ACT UP, AIDS Coalition to Unleash Power. Act Nice, AIDS Coalition to not interfere with conference events. And that was our snarky internal ACT UP name for the march. And in a weird way, that march been working on that, had a really profound effect on my life in terms of what I do now and how I do it. But I certainly didn't know that at the time. But those were the sets of events. And then the final day was the Sunday of Pride. And so that was when parade went down and a group from the conference came and joined the Pride parade on that day. So that was the sort of the sweep of the week. And I'll stop there because I know there are other people with stories, but I wanted to get the Act Nice in the record for historical accuracy.
Great. Thank you so much, Laura. Wow, what a great panel we're putting together here just randomly. It's wonderful. And, we may have a chance to circle back to other people for more thoughts because there's so much more we can talk about. We only have a couple more people in the queue, and I think next is Tim Kingston, who was an independent journalist, or maybe he was writing for the Bay Times at the time of the conference, or was it called Coming Up back then? Are you with us, Tim?
That's the wrong Tim. It's Tim Lunsford.
Oh, Tim Lunsford. Okay. Sorry. Tim Kingston, if you're there, chime in as well. Tim Lunsford, are you there? Okay, then can we go over to Peggy Sue? I see Peggy Sue. Would be great to hear from Peggy. Okay, I don't see anyone. Oh, there we go. Hey, how are you, Peggy Sue? Nice to see you.
Good.
Thanks for joining us.
I just wanted to chime in really quickly. I got arrested in all 4 actions that week. I was 20 years old and super excited to get my hands dirty, so to speak. And I have just one very quick short story that Gerard already knows because we gave a talk at my office on Zoom for Gay Pride Month, trying to connect the early ACT UP movement with a whole bunch of current pandemic / Black Lives Matter stuff. And I slept with the head of the ACT UP New York merch committee for free t-shirts. She was also attractive, but I really wanted one of every shirt, and I still have them. I will be donating them from my archives. Like I said, very short story. I slept with her for t-shirts because I wanted one of everything, and I got them. That's pretty much it. That's all I got. Oh, and Mike and I went on trial in federal court for the INS action, and I got acquitted because there was video of the police beating the shit out of me, but no video of them beating Mike up. So I think he got convicted and I was acquitted.
I did.
So that's it, really. That's all I got.
If I could quickly jump in just to follow up on Peggy Sue, to bring out 2 really important things you said. One is the reminder that ACT UP and its activism were also quite rightly driven by love, desire, sex, pleasure. People wanted to be alive and to not be awash in death all the time. And so there was a lot going on at many different levels. And the trial that Peggy mentioned, the Sansom Street 8 trial, as we called it, was a very enlightening moment for some folks. For others of us, it was a reminder of what we'd seen right along. One police officer got up on the stand and brazenly lied, and then a video was shown demonstrating that the officer had brazenly lied, and all the judge did was say, well, jury, you don't need to pay any attention to the officer's testimony. That was it. Cops lying in court was so common for that judge that all she would do is say, oh, never mind what that officer said. No consequences, no nothing. Does this sound familiar about what we're seeing about routine police culture that people of color experience in this country all the time? It was a much bigger shock for middle-class white people to see that put on naked display at that moment, and helped many of us commit ourselves to changing the police power structure in this country.
A lot of protest, a lot of anger and frustration, but a lot of fun, and certainly some sex thrown in there as well. And it's important to remember that that there was, we were young and very vital in our energies, and it was important to. I mean, what we were fighting for was life. We're fighting to live and not to march into the death camps. Hey, Moises, you started us out. I'm thinking you must be thinking something.
Well, I mean, what you said about sex, it was so true, and God, I mean, that conference was transformative, not only politically but also sexually. Like and not just because yes, we were young and had a lot of energy, but also was a way to validate ourselves, and also those of us that were positive. It was just liberating ourselves and have other people that even if they were negative within ACT UP, the fact that you were positive was not an issue at all, and that kind of brotherhood or fellowship, I mean, was amazing and transformative as well. And we provided that with the message of being sex positive, and I think that with all the discrimination and all the, bad story about sex, I think that that was a political statement also, to have it out there also and show it out to the world. One thing I wanted to mention very quickly was, it may seem that, we are here a bunch of guys, right? Like we are 30 years after a conference that transformed our lives. And it made me think about the movement that is going on now with Black Lives Matters, and how, at MAC, we have like these other young AIDS activists, LGBTQ activists of color, African Americans. And during all this time of demonstration, I have seen them being transformed when they go to their first demonstration for the first time. When they realize that they have that power, they have the power to do that and to transform. And it's just amazing to see how we, when we were young, had to go through these kind of difficult moments to validate and to preserve our ability to transform, discrimination and systems that are not serving us.
Yeah. Carol, can you tell us a little bit about what was going on in that photo that you showed us from the news article? I'm going to unmute you. You're going to unmute yourself, sorry. Carol, we need you to unmute. There you go.
Okay, so sorry. There was a little problem. I didn't really find out about doing this panel until a couple of days ago, email accident. So I am not as sharp as I could be about what was happening there. I just know that, so I can't really tell you too much except the experience of being with so many activists getting arrested. And I don't know who else. So someone got arrested 4 times. They must have been arrested at this event, right? This was, how many people were at this event? Maybe a few thousand? I must say so in this article. But paddy wagons and going into the jail cells, and there was I would say the activists weren't really afraid. I think there was such a surge of energy and so much, I guess, confidence that we had succeeded, and that we'd, in some ways, in San Francisco at the AIDS conference, that we really changed the strategies of activism, that we contributed something to activism in general. So I felt that I wish somebody else would also talk about this, because I would have needed to recall every other aspect of it.
Yeah, and Brenda.
This is Timothy.
Oh, great. Thanks, Timothy. Thanks for joining us, Timothy.
Yeah, I was a member of Treatment and Data Committee in ACT UP New York. I finished law school about 2 months later. I had gone to night school, law school, and I worked at Citibank for the president. So I did not like my photograph taken. So I offered and did a lot of background stuff for ACT UP. And what I decided this time was I bought a little red wagon and I flew it out with me. And I went to the Staples store that was a block and a half away. And I gave them the document that Treatment and Data had put together, report to the AIDS conference. And I started photocopying that and bringing that wagon back to the center. And people started letting me in after 3 or 4 trips to give to Mark Harrington or Peter Staley or Scott Slutsky or other people in Treatment and Data. And we ended up giving that document to every member at the conference that year. And I spent $24,000 and was given the money back by ACT UP Treatment and Data and ACT UP New York. But I want to say that I also, too, did participate in the Gay March, and one of the fellow ACT UPers had put his cell phone, which I did not have and still don't have a cell phone, really, but he put his phone number on all the papers, and he wanted me to hand out his paper with his phone number and the hour of the day, which were hour apart appointments, and he wanted to give as many blowjobs as he could during the Gay Pride Parade. So that was the only thing I did during Gay Pride Parade in San Francisco, but I was definitely part of treatment and data when we split away from ACT UP New York and formed Treatment Action Group, and I still am a member after 31 years of ACT UP New York.
Wow, that's amazing, Tim. Yeah, thank you for all your work back then and your service ever since. And I know all the conferences that I went to, it was always such a joy to receive the reports from Treatment and Data Committee and from Treatment Action Group with demands and recommendations that really guided a lot of our work. During those years in particular. So yeah, thank you. That's amazing. I mean, to print those, did you have a wagon that you were carrying these back and forth to?
I had a red wagon.
A red wagon, okay. Well, I'd love to have that red wagon for our archives if you still have it, but.
I left it in San Francisco.
I'm just curious, I don't know if Gerard, if you're still on, but I'm thinking the International AIDS Society must have in their archives, I don't know if it would be at UCSF, but the recordings of all the sessions at the conference, which of course included the protests of Louis Sullivan and all the other amazing actions that took place during the conference. I don't know where all that lives.
Yeah, I do not know where the International AIDS Association's archives are housed, if they are. Perhaps they simply hold on to them themselves. That would be certainly something worth looking into. It would be great to see appropriate footage of all of that material. And I'll just chime in a little bit on the Louis Sullivan action. It was the closing plenary session of the conference. And there was a kind of agreement with the conference organizers that there would be no disruption of the scientific sessions, but they would call all the bets off for that closing session because a lot of them didn't like the Bush administration's neglect of people with AIDS and weren't interested in hearing this ridiculous nonsense that would come from this government official. So when the activists arrived, they got in part because my housemate at the time, Billy Strusenberg, had forged conference badges to give out to people. Oops, I'm gonna have to hold on, I've got a noise in the back.
Okay.
This is Laura, just to amplify that. There was a lot of color Xeroxing going on, and then you could just stick them onto pieces of cardboard and get in. Plus, a lot of the conference attendees also didn't necessarily want to be there for the closing session, and so handed their name tags over to activists. It was agreed that we would not disrupt any scientific presentations, but we also agreed that there was going to be no scientific information presented by Louis Sullivan, and therefore it did not qualify as a scientific presentation.
And I'll add one or two more details. One is something that very much impressed me at that event is that a number of the activists, as soon as Louis Sullivan came out on stage, stood up and invited everybody at the plenary to turn their backs on him. And perhaps half of the audience or more, in fact, were conference goers, folks in little business suits or proper little medical professional outfits. And virtually everybody in the room stood up and turned their backs on Louis Sullivan. He was unable to deliver his speech and finally had to leave because of the booing and the air sirens. And there's a great photograph of several activists holding up a huge banner that says, "No more words, we want action." And in the background, you see the large screen video of this government official's little head peeking up there in the background, thinking he was going to give his meaningless double talk speech, which he didn't. Everybody then left that session, marched directly to Market Street a couple of blocks away, and jumped into the parade. And that was the ACT UP San Francisco contingent in the parade, where there was a huge die-in at that moment, blockading the parade. It really was a very, very dramatic afternoon.
And Gerard, if I could add one more piece to that, the fact that we got so many conference attendees to stand up and join in the Louis Sullivan demonstration was a perfect bookend to the way that Peter Staley opened the conference in his plenary speech by having everybody in the audience who knew someone with HIV, worked with someone with HIV, was someone living with HIV who was not satisfied with the governmental response to please stand up, and basically sort of in his own way baptized half the conference attendees at their first activist action by standing up and expressing their displeasure at the government's handling of the epidemic. So it was really nice to start out so civilized with Peter's opening session to that raucous, amazing cacophony of all the folks in Moscone. Just, you could not hear Louis Sullivan to save your life.
That's true.
Yeah. There's so much amazing unedited footage of what was happening outside the conference in the GLBT archives. I mean, I watched video after video of some really beautiful, amazing post-conference and demonstrations during the conference video footage. I want to change direction for just a second, because I also think that one thing that was so important about this International AIDS Conference is that it put the organization Project Inform on the map in a very different way. One thing that was happening during that conference was data was coming out from the Compound Q trial, the community Compound Q trial that had taken place in '89, and there was a lot of forums to discuss this and a lot of media attention, and it got Martin Delaney in front of the press in a really unique way, and their database of constituents grew from several thousand to like 100,000 overnight, and it really changed the whole nature of that organization and how it served the community across the country. And not only, like, the importance of Compound Q, I think can't be highlighted enough in terms of what it meant to the community in San Francisco. Now, in modern times, I think of Compound Q as hydroxychloroquine. Here's this thing that was kind of toxic, that was probably overstated, but people were desperate, as they are now with COVID. And, you know, there was some basic science laboratory data that showed it was compelling, as there has been with hydroxychloroquine. But the difference, and maybe it's not so different, the similarity between these two drugs is how they galvanized a community. In current times, hydroxychloroquine is really galvanizing the extreme right in a crazy way. And to mirror that back with how Compound Q galvanized the community, particularly in San Francisco, has been quite interesting to reflect on over this time, because here was this pretty toxic drug that killed people, you know, the same way we hear hydroxychloroquine is killing people. And there was a desire, just a mad desire, to see it researched. And that research was being talked about at this conference in a couple of different ways that were important. One was, you know, the death was minimized to some degree, but it was contextualized in, this is how far as a community we're willing to go to see advancements for our greater community. And that's a real difference in hydroxychloroquine. And the other way that it was talked about community empowerment. We would take this into our own hands. We would do what it takes to get answers for our people in our communities who are suffering because the government is turning its back. And so it also helped to sort of bring people's sense of power together. We can make a difference. We can do this. We can find drugs. We can research them. Now, we couldn't do that without industry partners, without government partners, but it gave us this sense of possibility. And a very notable AIDS activist in the West Coast, Michael Wright, was sitting in a hotel room in the middle of the country working in hotel management, and he saw Martin Delaney speaking on the screen, and he saw the demonstrations in the street, and he got up and he quit his job and he flew back to San Francisco and full-time activist. Like, it transformed people's lives from across the country in places that, in people who weren't even there. That was very important. Not only those of us who were there were transformed, but all of those echoes across the country. It was a powerful time.
Yeah, I really think of the 1990 conference as really kind of reaching a pinnacle of the AIDS activist movement, especially around treatment activism, but that emerged from the PWA empowerment movement, and which Moises was really referring to earlier. And Brenda, you and I have talked about, you know, what's the parallel with COVID right now in terms of, you know, the COVID, people with COVID empowerment movement, you know, where is that? And you may have followed this more closely, but, you know, when we had talked about it a couple of months ago, it's like, well, the the lifespan of the active disease is too short for people to really like galvanize and organize. But then since then I've started to see some reports of groups forming on Facebook of people because they're seeing the long-term consequences of COVID infection, where we don't know what the endpoint is really of that, and so people are dealing with all kinds of health effects from that initial infection, even if they didn't get on a ventilator or whatever. But Moises, maybe you can talk to us a little bit about that, the importance, some more about the importance of people with HIV. And I recall at the time I actually wasn't HIV positive until about 10 years later myself. And we always try to put forward the people with HIV and AIDS to speak and to represent as much as possible, and you were part of that.
Yeah, I mean, remember that there was a movement that came out of the Denver Principles, and where this group of people living with HIV developed this document that claimed, that nothing is going to be done without us. We are living with AIDS, right? So we have to be part of the decision making, and then all the people with AIDS coalitions that started to happen around the country. I had the pleasure to be part of the also People with AIDS Coalition in New York, where we had our job was to provide support, but also look for information about treatments, stuff that will come from Project Inform, stuff that will come from other activists that were doing all the research and looking for information about what options we had. I had the Spanish version of the newsline that was called SIDA Ahora, and we used to distribute it all around the United States, but also in Latin America. And we had people meeting in Colombia. I know some activists that would tell me stories about how they were waiting for SIDA Ahora so they can get some information in Spanish about what was going on. And this is late 80s, early 90s. So navigating from that empowerment movement to ACT UP and see it, even transform to a way of more powerful, like silence equal death, knowledge equal power, all those statements that came out of that. I mean, it was amazing the way it transformed and empowered people with AIDS all over the country and all over the world, I would say.
Yeah, I think it's, the PWA coalition in New York in particular, and, we saw the same kind of thing happening around the country, especially in San Francisco, but the PWA coalition really established the Buyers Club, the PWA Health Group in New York, which established the Community Research Initiative in New York, Michael Callan and others, that really sparked an MFAR-sponsored community-based research network around the country. At the same time, we were doing the Q trials in San Francisco and around the country. And so it really was about, just people with the disease who had no degrees, no expertise except what they were able to gather from looking into their own health and of their friends and their community, that established this whole thing that really changed the nature of clinical research for not just people with AIDS, but for all diseases. And when we talk about hydrochloroquine, I mean, the project informs models of, parallel track and accelerated access through the FDA, changing the FDA regulations, really created the precedence for people with life-threatening diseases to have access before, post phase 3 clinical research. And so, yeah, it's really a wonderful story. I think it really hasn't been told enough in a way that people will really understand, because I think it's so empowering. Mike, you popped back up on my screen.
Also, Terry, there is a hand raised from an attendee.
Oh, okay. We'll go back to that. But first, Mike.
Oh, no, why don't we go to the attendee first?
Okay. I got to figure out who the attendee is.
It looks like they unraised their hand.
Oh, Lee, if you maybe Lee is bringing them up and they're just in progress of having their, so go ahead, Mike.
Well, one of the things that it was interesting hearing Brenda talk about and hearing you all now talk about the longer range impact of the conference on sort of systems. You know, one of the organizing gripes that the community legitimately had with the conference was the travel and immigration ban, which of course we had the INS action, and the sustainability of the movement to actually continue to focus on issues after the conference. The travel and immigration ban was one of the things that both ACT UP San Francisco and ACT UP Golden Gate were united in, pursuing that as a joint action that they continue to focus on for years and years and years. Because of the travel and immigration ban, the conference that was going to happen in Boston in 1992 was moved to Amsterdam. And in Amsterdam, there was a huge press junket that actually featured Tomas Fabregas from ACT UP Golden Gate, and the joint working group of ACT UP Golden Gate and ACT UP San Francisco on travel and immigration ban. And also in 1990, a very hot issue that was to the side of the conference, but became central. We went through conferences ongoing, and now plays right into the issue around supervised consumption sites, was the issue of needle exchange. We were continuing to operate the needle exchange while the conference was going on, and literally a very famous researcher in the epidemic, who will remain nameless, drove up to see us doing needle exchange in a limousine, and came to the needle exchange site in the Tenderloin, opened up the limousine doors, saw what we were doing with needle exchange, and her organization from that point forward invested a lot of money in doing a lot of the policy research on legalizing syringe exchange here in the United States. So that's the other thing that from the community arose, this presence around the conference that actually had sustainability. But remember, the travel and immigration ban, while we were protesting it in 89 and 90, wasn't fixed until the Obama administration. So the idea that we were engaged in immediacy of problem that took decades to fix is also, I think, very telling and very instructive for all the social and social justice movements that we have right now, that it's a long haul for a lot of the issues out there. It's just not an immediate quick fix, because letting PWAs into the conference for free doesn't guarantee access to quality healthcare. And we're still in that struggle now.
Yeah, and we definitely have a lot of echoes around, you know, immigration restrictions happening right now. And frankly, you know, with the conference going online, I think they may have dodged a bullet a little bit in terms of like the kind of protest work that might have happened with the conference happening in person. And appropriately so, and it feels a little frustrating that we're trapped on our computers. And so we have a new participant. I just want to go to. Oh, I'm sorry. I want to go to. Yeah, go ahead, Reister. Oh, we need to unmute you. There you go. Hi.
Hi.
Thanks for joining us. You were recruited by our panelists. It was like, jump in here, get in here.
Yeah, I had made a comment about comparing AIDS to COVID, and a lot of people in the community want to do that. And I tell people that we can't compare it. They were so very different in so many ways, but we can contrast them, and contrast them sharply. The numbers alone of the dead and the time frame that has happened in. Terry, you mentioned in the beginning about how it was killing all the right people and how the administration at the time felt that way. And it took the death of Rock Hudson to wake up America to the fact that AIDS was happening, to a quote unquote real American, a man's man. So in the beginning of this whole journey with COVID, I kind of sat back and, sort of took a back seat and watching everybody running around like chickens with their heads cut off and freaking out about having to stay home. And it triggered me 2 or 3 different times when they started talking about testing, when they were talking about quarantining. Those really hit home for me because back, I was diagnosed officially in 1987, but knowing how, when, and where I came out, I'm sure it was from the very beginning. So the things that we were doing back then, before Brian White was around. If those of us that were fortunate enough to put people in our homes, to feed people, and also starting nonprofits to give the assistance that was necessary. Even when Ryan White began, it still wasn't enough. And small nonprofits were having to shore up the Ryan White program to meet the needs of the people at the time. So what I love all these stories. I've met a couple of you, but hearing those voices and giving your actual events experience is amazing to me, and it's inspiring. And I hope a lot more people are able to look at this and hear those stories again, especially the younger generation, and because they just don't know what it was like in the very beginning and all of the struggles we went through to get where we are today.
Yeah, thank you so much for that. And you know, as I'm listening to all of you who've contributed, many of you have mentioned people that we have lost, that are not here, that we couldn't have on this panel, that didn't survive the AIDS epidemic. And for me, they feel present in this discussion, and their contributions really saved so many lives. So I'm really grateful to have everyone to represent them here on this panel and other similar events that we do like this, and Brenda's exhibition, and to keep their memories alive. And as you said, Lester, that that those stories really inspire people in the current moment, I think, in ways that can change the course of the future. So, we only have a few minutes left, and I see Lito is pregnant with a thought. And we're going to start with you, and then we're going to go around. If you have any final thoughts for us.
Yeah, I just want to bounce off what you said about learning from peers and also people who weren't here and how we carry them with us. I think one of the things with ACT UP, and I can only speak for ACT UP San Francisco in general, is that the generations of activists that were involved, we had people who were involved with, pro-choice, which is where we got a lot of our civil disobedience training and how to act, and people who worked with anti-imperialist movements. And I think where we're at now, and I don't know if others get this, but certainly of the younger generation that comes to me that are more politically motivated, is they do ask questions, and passing on what you've learned and things that you learn. I mean, just like writing the number of the National Lawyers Guild on your arm if you're going to go to a demonstration. What you should and shouldn't carry, and things like that. And also about sticking with groups and having an activist buddy. This carrying on from the Trump demonstrations to the current Black Lives Matters demonstrations, because I've had definitely a lot of friends and newer friends, some who are just like Facebook connected, when they see I've been in ACT UP, have questions. And it's not our place to be the authority per se, but at least be that person that they can bounce ideas off of and offer suggestions and let them create their movement that way. And so, I mean, I guess that's what ACT UP taught me.
Yeah, that's great. Thank you, Lito. And I love your shirt. What is that? Are those little muscle men on there, or? Oh, okay.
Mexican female wrestlers.
Oh, got it. Good, great. I knew it was something great. Carol, what are you thinking? We just have a few minutes left, so.
Yes, just compare, mentioning COVID and AIDS, and I recall during the crisis what sex workers were talking about was condom use and safer sex. And now working here among sex workers, and what is the response to COVID? There is nothing like that response. I'm just being appalled and so frightened by the differences, and it really strikes me. And I want to say that, and I'm just in shock about the situation for sex workers now.
Yeah, Carol, I'd really love to, maybe we can work with Lee. They're, I'm sure, going to be interested in organizing a sex worker forum specifically, in the coming months, because, I think it's such an important issue right now. And I agree, it's not getting any attention. So, Moisés, Brenda, Gerard, if you have a minute, just, what, maybe a little thought for the participants about the future.
Very quickly, one thing when we make the comparison with COVID that it still appalled me is that the communities most affected by this new pandemic are the same communities that were affected by HIV from the beginning. And I'm talking about people of color and African American mostly, and Latinos, and how still we're having that battle, and that we do need a new movement, like Lito said. But one thing I wanted to say was how it's amazing for me to think that participating in things like what was People with AIDS Coalition, like being part of Act of New York and be part of in the conference in San Francisco, how all that and the treatment activism that came out of it has saved my life. I'm here because of that. I'm here because people like Brenda, people like Marty Delaney, people like, Mark Harrington, they move the science and they allow the development for new treatments that are the ones that are keeping me alive and very healthy, by the way, So I just turned 55 and I'm like, wow. But what I'm saying is how these political actions have me participating in the way that I did with others saved my life. And it's still like, how that happened. I had no idea it was going to end up like this.
Yeah, I remember when I got involved in treatment or in AIDS activism in 1986 when I met Carol. I thought this was going to be maybe 6 months, 6 months deal, and of course it was 10 years before the the protease inhibitors and the combination therapies came out, and so it was really a long haul. And speaking of long hauls, our time has come to an end. And I just want to say thank you to everyone who participated and everyone who's been watching on Facebook live stream or on YouTube or recording in the future. If you're watching in the future, hello from the past. And thank you for joining us. And please go to our website and consider joining the GLBT Historical Society at glbthistory.org to support programs like this, exhibitions like Brenda's, and all of our work to preserve and share, to collect queer history. And so with that, it's been wonderful to see all of you. Thank you again for all of your work. Peggy Sue, thank you, love you. Lito, Carol, I love you the most of everyone. All right. Bye.
Hi everyone, my name is Emily Hobson. I'm a historian, and on this World AIDS Day, I hope you'll join us to watch an event that originally took place a few months ago when my hair was a lot shorter, called Fighting Back: Direct Action, Marching, and Parading. In the event, we talk about some of the history of AIDS activism in the Bay Area and the lessons it can offer us today. I especially talk about the history of AIDS direct action, including the influences of the Central American Solidarity Movement on creating the AIDS Action Pledge, and then how the AIDS Action Pledge influenced the local manifestation of ACT UP and the kinds of issues and alliances that ACT UP in the Bay Area fought with and through. They told us to plug a little bit here, so I'll let you know I'm the author of 2 books. One is a history of the gay and lesbian left in the Bay Area called Lavender and Red, and the other is an anthology of all kinds of radical movements in the US 70s, 80s, and 90s that I co-edited with my buddy Dan Berger called Remaking Radicalism. So I hope you'll join us on the interwebs and that we can get back out into the streets together real soon. Thanks.
Hi, my name is Crystal Mason, and I was a member of ACT UP San Francisco back in the day. I was invited to take part in this panel called Fighting Back: Direct Action, Marching, and Parading. And we got a chance to talk about lessons learned and how do we move forward. And it was a great conversation. And one of the main things we learned is that we have so very much work to do. So I hope you enjoy this panel. And thank you.
Join us that way by phone. And I see people are starting to join us in the Zoom room here. So thank you very much. I'm really excited about tonight's forum here on Zoom. And so with that, I'm just going to get started. I have a little bit of introductory remarks to talk about who we are and why we're here. And then I'll introduce everybody, and then we'll just kind of plunge in as people are joining us. So welcome again to Fighting Back: Lessons from AIDS for COVID-19, hosted by the GLBT Historical Society. My name is Terry Beswick, and I'm the Executive Director of the Society, and I'll be moderating tonight's discussion. This event is being recorded and will be posted to our website. Many people will be watching the live stream on Facebook, and I welcome all of you as well. If you are watching with us on Zoom, we welcome your active participation in the forum. Please post any comments in the chat. You just hover down at the bottom there and click on chat, or on the Q&A function if you have a question that you want to ask. And also for the panelists, in the chat function, if there's a resource or link that you want to share with people, or even a thought, you can click on a chat just to go to me or Lee in the background, or to the other panelists, or to everybody. Just put all attendees and panelists. And in the interest of transparency, I just try to post to everybody so they can see what's going on. So with that, I want to say that the GLBT Historical Society, or the Gay, Lesbian, Bisexual, Transgender Historical Society, was founded in 1985. We are recognized internationally as a leader in the field of LGBTQ public history. Our mission is to collect, preserve, exhibit, and make accessible to the public materials and knowledge to support and promote understanding of LGBTQ history, culture, and arts in all their diversity. And our operations are centered around 2 sites: the GLBT Historical Society Museum, located since 2011 in the heart of San Francisco's Castro neighborhood. There goes my dog, I'm sorry. And the Dr. John P. DeTecco Archives and Research Center, open to researchers in the Mid-Market District. And although our physical locations are expected to remain closed for a little while longer due to the COVID pandemic, please check out our Pride Month webpage, which includes a wide array of exhibitions, events, and archival resources at glbthistory.org. And while you're there, shameless plug, please consider becoming a member. We're running a special for Pride Month, which runs through Tuesday. So through the end of June, you can get an annual membership with some cool perks for just $35 or $20 for low income. So take pride in your history. Our history connects us, even when we're apart. Oh, okay. So no, that's out of the way. Why are we here? Fighting back, lessons from AIDS to COVID. So as with HIV and AIDS in the LGBTQ and other communities, the COVID-19 pandemic has upended the daily life, culture, and economies of the entire world's population. And as with HIV AIDS, the death toll continues to mount, while we have been faced with a federal government that has been tragically slow to respond. And as with HIV AIDS, we not only struggle to survive COVID-19, we learn to thrive within the pandemic and imagine the world we want to create after COVID-19. So with the Fighting Back series, we hope that people will be inspired to find ways to transform their possible feelings of anxiety, despair, or anger into action, and to find models for building community and solidarity in the midst of the pandemic. So tonight, our Fighting Back is dealing specifically with direct action, marching and parading, one of my favorite subjects, and I think of our panelists as well. So direct action, marching, and taking to the streets have long been tactics used by the LGBTQ community to promote equality. And these methods were critical for drawing attention to the AIDS crisis and affecting change in public policy. But the epidemiology of the COVID-19 pandemic mandates social separation, not physical gathering. This evening, we will discuss the history of direct action, marches and parades for advancing social justice, the fight against AIDS, and discuss how these strategies are being adapted and deployed during the coronavirus pandemic. And actually, we wrote this description before we started seeing a whole heck of a lot of street action happening. So just a reference on that. So our Fighting Back series. Tonight, we're going to dig into these questions in just a moment. Before we do, I want to introduce our three panelists. We may be joined by a fourth panelist as well. And if they do join us, I'll introduce them when they come in. So to begin with, welcome Anne-Christine Dadesky. Anne Christine is a writer, journalist, parent, and long-term white activist who believes all Americans should be protesting Trump, supporting Black and brown-led anti-racism protests. She has been participating in Black Lives Matter protests in New Orleans, a new second home. She recently launched the online Facebook global group, Act Up, Fight COVID-19, which has 3,700 members and works to foster informed exchanges and proactive strategies for action around the pandemic. Many members are long-time veteran ACT UP members. Before that, she founded the online Bay Area Queer Anti-Fascist Network, and in the 1990s, she co-founded the Lesbian Avengers and was an early member of ACT UP in New York. She's the author of 4 books. We had an event on Lesbian Avengers a couple years ago. We should do that again. That was fun. Emily Hobson is a longtime activist and a historian of queer radicalism and its intersections with anti-racism, anti-imperialism, and prison abolition. She is the author of the Bay Area History, Lavender and Red, Liberation and Solidarity, and the Gay and Lesbian Left. And I'm still kicking myself for not giving you an interview while you were doing that. And co-editor of the forthcoming movement anthology, Remaking Radicalism, a grassroots documentary history of the United States, 1973 to 2001. Her current research addresses the history of HIV/AIDS activism in prison and incarcerated people. She is a professor at the University of Nevada, Reno, and active in organizing for racial justice and against white nationalism. Welcome, Emily. So hopefully we'll have Alex Yuin join us, but we've got Crystal Mason. Crystal is an activist, artist, mediator, and managing director of Queer Rebels Productions, who is working hard to lift up the voices of queer, trans, people of color, and centering our dreams, hopes, and desires. Crystal, it's an honor to have you here tonight. And yes, I'm going to add my pronouns. I failed to do that. Let's see. Before we begin, I just want to make a note and say that in the last several weeks, since the murder of George Floyd in particular, but other victims of police brutality, we have incorporated the justice movement issues that are coming up, and in particular addressing anti-racism and defeating white supremacy in these forums. And I want to welcome everyone to shift to that entirely and abandon our construct of talking about lessons from AIDS for COVID. I see them as connected, and I think all the panelists that we've had in the last couple of months do see them as connected. And so there's an opportunity here for to draw those connections, I think, for people. So with that, I was hoping we could just, we have a small panel tonight, which is wonderful. I think the last few ones I've had, I had like 5 or 6 people, and it's always felt like an hour and a half has gone by too fast. But to begin with, I wanted to give each of you time, and as much time really as you would like, to talk about your work. And particularly as it relates to AIDS, COVID, LGBTQ rights, fighting COVID. And from there, we'll go into talking specifically about direct action, and you're welcome to address those as well. So who would like to get us started? Can I get a volunteer? Just talk about yourself. I mean,
I'll volunteer.
Thanks, Crystal.
Yeah, no problem. I guess I would say that, I started out in activism, smaller things before, but the biggest thing I ever did really in those days was to join ACT UP and to join in the fight against HIV and AIDS, but more so against the government's response to HIV and AIDS, truth to tell. And I also spent time working at the San Francisco AIDS Foundation as well. And then a shift came from me. I actually started a women's performance organization in San Francisco called Lunacy with Miriam Kronberg. And it's a shift that sort of like took over. I sort of like kind of went away from like direct action sort of stuff and more into, as I said in my bio, lifting up the voices of QT-POC folks. Because one of the things I did learn from ACT UP and being an activist is the importance of marginalized groups of telling their own stories and representing themselves. And so that's been pretty much my pursuit these last years, is like really creating space for Black people and other people of color to tell their stories and to be seen in the world.
Great. Thanks, and we're definitely going to circle back to some more of that, I hope. And Christine, would you like to talk a little bit about your work?
Well, first of all, I want to say thank you for the invitation. Give a shout out to everyone who's been protesting. And I do hope that at the end of our program, we'll increase, like right away for our program, maybe cut the last 10 minutes already of what we have to say and invite particularly brown and Black activists who may be listening in to share what they think about this and what agendas they would like to see pursued. I always tell people that I feel like I'm a default activist. You had to kind of pull me pushing and screaming to become an activist. I was not a person who was raised to be political. I was raised to think that the left were all losers. So my journey has been one of becoming an activist, becoming educated to be an activist. And I really began, I think, from having a father who was born in Haiti and being from a family that really was a member of the ruling elite in a country where there was this extreme dictatorship. So very early on, I was identified as being linked to that white supremacy politic. And it was something that shaped me and has, I think, always influenced my recognition that while I am given privilege, that privilege is associated with oppression. And if I basically need to take a position, a very public position early on, that that with white skin and white positioning in any society, you have to take a position. Your privilege means something, but it means you have to take action. And I think I was aware of that early on. Before ACT UP and the Lesbian Adventures in the 90s, I was a part of early peace movement work, Women's Pentagon Action, and particularly the Seneca Women's Peace Camp, where I went as a very young person coming out And I was educated by women who had been in the civil rights movement, white women who were very strong anti-racist activists, African-American women, Native women. And what I think happened for me was that the actions that we did, which were daily actions of direct action, of getting arrested, were accompanied by educational work and workshops and conversations every day that focused us on why were we there, what were the issues, what were we trying to accomplish. So for me, becoming an activist was very much informed first by a self-education that doesn't stop. And today, I think I speak for myself, and certainly I think I speak for a lot of my peers, even if we've been doing work and decolonizing work and anti-racist work for a very long time, we know how much we have to do right now to completely continue to educate ourselves and pay attention to the amount of decolonizing that has to happen in our own lives, in our own communities. And so we really need to listen and be educated. I think a lot of us are doing that because while we may think we know issues, really, I think I'll speak for a lot of people that I know, mostly I'm keeping my mouth shut, except at protests, and I'm listening and I'm paying attention to what other people need to say, creating that space, as you say. So I think that's one big lesson. And it was true in the 90s, it was true in the 80s, it's still true now, that as white activists, we have a lot to say and do, but really we need to also make space and listen.
Thank you. Thank you. And Christine and Emily, I'd like to hear a little bit about your work.
Absolutely. Thank you for inviting me. I'm really happy to be part of this discussion. And I think that, you know, my own coming into radical politics was pretty similar actually to some of what Anne Christine spoke about, except that I'm of a younger generation.
No.
I grew up in Southern California and graduated high school in 1993. So I was kind of coming to political consciousness with a kind of awareness of the AIDS direct action movement and of the Central American Solidarity movement, and with some really kind of, thanks in part to my parents, some awareness of movement history before that, but didn't really find my own way in until more kind of in my college years in the mid-90s. And in particular, actually, some of the grassroots organizing work to fight the right in California, and to fight especially kind of the right as it was mobilizing at the ballot box. So some of the first community organizing work I did was through the fights against Proposition 187 and Proposition 209 and other state ballot initiatives, you know, to attack immigrant rights, to attack affirmative action, and so forth. And then from there, I continued in community organizing work, in particular around issues of racial justice in public schools and organizing with youth in districts across the state. And then as kind of things went on, I also really, I had this like long time passion for movement history as a part of organizing, which sent me into graduate school and becoming a historian. And my relationship to AIDS history in particular is that my first book is a history of the queer left, in particular in the Bay Area, really kind of from the gay liberation era through the early 1990s. And so the last chapter and a half of the book look at AIDS direct action organizing and how it grew out of and was influenced by preceding movements, in particular Central American Solidarity, anti-nuclear work. And we can also talk about a lot of other influences at that time. So I've always just been very passionate about how it is that a movement can truly be coalitional. And, you know, from my own personal perspective, really call on white folks to invest in racial justice, and call on middle class and affluent folks to invest in anti-capitalism and other kinds of you know, solid forms of solidarity. And I'm also really
passionate in thinking about, how is it that movements can center the leadership of folks who are most affected and kind of most marginalized, within that effort at solidarity.
Okay, so where do we begin? There's so much here. I actually feel like Emily, just as, and actually everyone, just, it would be really good for us to just segue into talking about the connections between different social justice movements, and in particular around AIDS. And Emily, you wrote a lot about this, especially focusing, as you said, on the Bay Area. But I mean, prior to AIDS, of course, we had a burgeoning, I guess we called it gay rights movement then. And prior to that, of course, there was women's movement and civil rights movement more broadly. And then there were environmental justice movements, anti-nuclear that you referred to. But were those strands and threads really part of the formation? And I see you've got a photo behind you, and I'm trying to recognize people behind you actually in that AIDS Action Pledge photo. But and I see, yeah, there's a central anti-intervention in Central America, probably banner up there. So yeah, maybe you could just talk about like how did those different threads sort of feed into that movement that started at different places at the same time around the country.
Right. So, it's, to a degree, I think the movement threads that showed up in particular in ACT UP depended on the city. And the kind of particular history. But in the Bay Area, Central American solidarity, direct action had been particularly strong. This photograph behind me is a photograph by Rick Gerharter from a march through the Castro on March, I just looked it up, I don't know this off the top of my head, but March 18th of 1988. And it was one of a week really of actions, a week and a half of actions that were prompted by President Reagan basically sent US troops to the Honduras border with a kind of threat to, possibly invade Nicaragua, right? At this sort of a very tense moment, right, in US intervention in Central America and in particular in Nicaragua. And the anti-intervention movement around the US responded very quickly, and in particular in San Francisco, as I said, there were about a week and a half of sustained protests, and the mobilization of troops was pulled back and the kind of threatened invasion didn't occur. But by this point in March of '88, the AIDS Action Pledge, which preceded ACT UP San Francisco, had already formed and had become fairly active, and it played a really important role in the week and a half of protests against intervention, and really kind of brought together anti-intervention and queer and AIDS politics in that moment. And the AIDS Action Pledge had also been inspired by the Pledge of Resistance, which was a Central American solidarity organization, which basically people signed a pledge to commit civil disobedience if the US escalated military intervention. And so the AIDS Action Pledge was modeled on that very directly, like I will take civil disobedience to confront the AIDS crisis. And it was also informed by the Pledge of Resistance in terms of some individual leadership and knowledge of how to, mobilize protest and how to engage in direct action. So I threw up this picture just as one of those examples of some of the continuities that come together. And like I said, I think it varies a little bit by city, right? It's a lot about kind of what, like in New York, I think that some of the really strong connections that developed around ACT UP included reproductive rights activism. I think there was more influence out of the anti-apartheid movement on the East Coast in particular, and in DC. A bit more connection to like housing activism in Chicago. And, so different kinds of connections in different kinds of places. But I think that, in general, there are so many of us who, we might get involved in a particular issue, but we really do begin to develop a kind of understanding of all these systemic problems being interconnected, right? And that we have to confront them together. And I think that's one of those things that sends people from kind of movement to movement.
Yeah, I think I know that Crystal and Christine. Hi, Alex. How are you? Before we go on, I just want to flip to the correct page in my notes here and introduce you. It's so great to see you, and I'm glad that you're able to join us here. So for everyone, this is Alex Yuen. Alex is an advocate for justice and equality, fighting for their rights and the rights of others and speaking truth to power. Alex was the 2017 San Francisco Pride Parade Grand Marshal and is one of the founders of the San Francisco LGBTQ Center, My Name Is Coalition, and the Committee for Queer Justice. They believe community events are important and founded SF Pride's Nectar/Women's Stage, the Unleashed Dance Party for Women, the Mama's Boys, a live vocals hip hop drag king troupe, and Kingdom, philanthropic drag king house. Alex has won multiple community awards for their activism and was named a statehood by the Sisters for Perpetual, I didn't know that, by the Sisters of Perpetual Indulgence. I'd forgotten that. So yeah, welcome, Alex. You know, before we go on, you know, we've kind of gone around the room, and I'm sorry you missed it, but everybody just spoke briefly about their work as it relates to activism, and in particular focusing on AIDS, COVID, LGBTQ, anti-racism. Anything you want to talk about? Can you just talk to us a little bit beyond your bio and what your work and your focus has been on? Oh, you got to unmute yourself. I'm sorry.
Sorry about that. Can you hear me now?
Yes. Good to see you.
Good to see you too. And thank you everyone for allowing me to be a little bit delayed. We are still working. And so I had a work emergency and here I am.
Thank you.
To answer your question, Terry, there's been a lot of things that I've been able to do under the COVID shield, in a sense, right? Because we are virtual, we can help anywhere, any way that we can. And so some of the ways that I've been helping has been different campaigns in other cities and states, doing phone banks and doing text banks, et cetera. I've been working on, and I'm sure you've heard of it, Terry, but we've been working on the People's March that is going to happen this Sunday. And we are taking Pride back. We are taking it back to the streets. We're taking it back to our roots. We are going to take it back to the actual route. And we are going to start including all peoples. And in the spirit of Black Lives Matter, we are going to be working with trans and queers of color, BIPOC, and that's who's going to be our front line. We are going to be the speakers. We are going to be the entertainment. We are going to be the ones that are driving this effort. And all of our white allies are going to take a border position and help us with pretty much anything that's going on that day. It's very grassroots. We have a couple thousand people that have confirmed already. We have probably more than 10 groups that have bringing their coalition, and they're going to be joining us. But this is just a start of bringing it back to the people. We are tired of it being so corporate. We are tired of it being so police driven. We don't want any police. We don't want any corporations. Because you're finding out the truth right now about the corporations that we're using, or that the Pride agency is partnering with. You're finding out very true about their policies now during the Black Lives Matter movement. You're seeing that a lot of them now are starting to have diversity inclusion groups. Where were they, right? And so if we are taking money from corporations that don't have our voice, then that means we are just as bad as they are. And so what we're trying to do is just bring it back to the People's Pride or the People's March and protest. And we want Black and brown people to stand tall, because we've been missing from San Francisco Pride for many, 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 many years. I mean, we can't even count how many years that we have not had a presence. And it just seems like they don't care. And so we are bringing it back, and we might as well use the momentum of what we've been doing for many, many years. And then unfortunately, what has happened to Mr. Floyd, that you know, he's the black man that's going to save the world. That's how I look at it. There's a lot of changes that are happening because of him giving up his life for many. So those are some of the big things I'm working on right now. And that's this Sunday, the 28th. And we're going to gather at 10:30 at Polk and Jackson, which was the original route. And then we'll go from there and we'll end up at the Civic Center.
Yeah, that's awesome and amazing, and I think we, you know, let's get back to that. You know, we have about an hour. We're gonna again, for the people that are watching on Zoom, feel free to go ahead and I always saw a note from Randy, my friend Randy Alfredi corrected me. Yeah, I'm gonna mess up no matter what, but it's like so he pointed out that at the start of the AIDS epidemic, the terminology was lesbian and gay. And I referred to it as gay rights at that time, the gay rights movement, but it was really lesbian and gay. No bi or trans yet, but that was the situation at the beginning of the AIDS epidemic. And that's very interesting. We should put a timeline of all that actually up at the museum when we get back in there. So we've got a great mix of people here. You know, we were just sort of starting to get into the history of the origins of the AIDS activist movement, and how there were a lot of veteran activists or even younger activists that were working in other social justice movements that brought those experiences. And Emily was also saying, you know, and if I may paraphrase you, but I think that there were people that were radicalized as a result of their AIDS activism, and gained greater awareness of other social justice issues as a result of their AIDS activism. And I'm thinking in particular about the gay boys. You know, the gay and the gay white boys in particular, that like myself, who were part of ACT UP in those early days, and the AIDS Action Pledge and Citizens for Medical Justice before that, where, you know, we were, you know, there was some dabbling in electoral politics for me personally. You know, people may have dabbled in stuff in school or whatever, but we're really like got involved as a result of AIDS. But then, you know, the thing is about HIV is that, you know, it impacted all these communities just as COVID does, that were already suffering from inadequate access to services, income inequality, people of color, and in particular. So we learned about these things, and we began to get involved in those as well. The other side of that, though, maybe there's another side of that. And Christine, did you have a comment on that?
Yes, I did. I think what I wanted to do for myself, because I'm thinking, well, I'm on this panel, how can I be of use here? Mm-hmm. And I think what I wanted to talk about is, you know, what actually happened for us in those movements that we can apply now. Yeah. And so I think that one of the lessons from the 90s and the AIDS epidemic, and I think this is true for what you're saying, Terry, is that a lot of people got involved, as they always do, because it's personal to them. People are self-invested. That's why they're willing to take an extra risk, because they feel directly threatened in a deeper way. I think a lot of white activists right now look in the mirror and see themselves, they see the racism, they see their silence, they see their inaction, and say, I can't tolerate this. I have to be in the streets. I need to figure out my role in this particular movement that is Black and brown led. That's because it's very personal. It's become personal for a lot of Americans. I think in a way it wasn't and always should have been, but it is now. I think the other thing for me is that, yes, as you know, as Lee's already said, is that people came from other movements. And in New York, we had incredible leadership from people that had been in the reproductive rights movement and the abortion rights movement. But it was also broadly that as a group, there was really a focus on a rights-driven agenda, on looking at it and saying, what are the rights issues? What is the commons here that every person with HIV or was impacted is entitled to? And so it was beginning with very concrete objectives, what any action, any ideas to say, what is it that we're trying to seek in doing this action? What is it that needs to happen? And often I think it was even though the conversations in the rooms could be very theoretical and there was a lot of analysis, I think that the ACT UP group, in comparison to me with a lot of earlier lesbian feminism and consciousness raising and stuff, was to say, we have to at some point move from analysis to action. With this analysis, what is the action that we need to be taking? What are the things that need to happen this week that we can't live without? What are the things that need to happen in a week? What's happening in our community? Who's not at the table? And grounding these kind of political conversations in concrete action. But I think the other piece of it, and the reason that ACT UP for me was a successful movement, is because it didn't try to tell people what to do. A lot of other groups that I've been in and watched who have not succeeded, who have not built the sustainability, they kind of chose agendas that might have emerged from the top down. And I think that where BLM now, Black Lives Matter, and other groups are succeeding is they're creating a space for people from the community to say, this is what's important to me, this is my story, this is what's happening. And as a result of what's happening here now, this is what we want to see happen. And from there, the agenda gets built. And so I think that it's critical now for us, as we're participating in coalition-led movements and things, is to say, what are the agendas that are the priority for the communities that are the most vulnerable? And we have to begin there and say, what is my position in relation to that? I just want to share that. For me, it was, for example, I came from a background of working in Haiti. My background was global. A lot of Haitians didn't come to ACT UP meetings. Why? Because some were not documented, because they couldn't afford to get arrested. And so there's a reason why ACT UP actions in, the center of Manhattan weren't necessarily going to have the same participation of Haitians that an action at the Brooklyn Navy Yard was going to be, where you had a lot of undocumented Haitians who were living with HIV.
Yeah.
So I think that, privilege, analysis, but action.
Yeah.
Grounded.
Yeah, that's a really good framing from both of you, and it's we're going to be jumping back and forth between talking about the 80s and 90s and talking about today, and so that's just that's the challenge for us right now. But Crystal, I'm wondering, I'm just wondering if you could talk to us a little bit about, how the targets were chosen and the priorities and strategies on those weekly urgent meetings in your experience with ACT UP, and how that worked within the differing priorities, or whatever you want to talk about.
Well, I mean, I think for me, I feel like I need to backtrack a little bit. Because I don't know exactly how it was in New York. I mean, though we had, some cross-pollination, of course, between New York and San Francisco. But I was also thinking a little bit, I looked at some of the questions you had asked, and I was thinking a little bit about the connections and where we are today, and part of the reason, and reasons why we are where we are today. And I think of ACT UP as a movement that has some successes. And I want to be clear about that, because I think that while ACT UP had some successes, a lot of people were left behind. I mean, HIV and AIDS is still exploding in the African American community. And one of the big things that was that we were fighting for in ACT UP was universal health care. And my feeling is that partly what happened is that once cures start to come online, and more of the white men who were a lot of part of ACT UP were getting those cures, a lot of energy went out of the movement. And then also Clinton got elected, which also took a lot of energy out of the movement. And this is why I like to say, like I said, that I feel like ACT UP had some great successes, but I don't know if I would say it was necessarily a successful movement. And I would say that about a lot of movements, truth to tell, because I feel like if we had had these successful movements, we wouldn't be where we are today. And one of the things that I feel like has happened in the past, and also happened in San Francisco to a certain extent, And one of the things that has to stop happening is literally the centering of whiteness. Because one of the things I remember, getting back to your original question, is being in those rooms and having like, not just theoretical arguments, but like some knockdown drag outs. You know, I remember having someone say to me like, you know, people in our community are dying. And I'm like, well, people in my community have been dying. And so I think like for me, one of the bigger connections I'm feeling here is that at least for the last several years, the term "we have to center the most marginalized" has been put out a lot. And I'm wondering like also what that can look like, because my feeling is like the things that sort of ACT UP and other movements have failed at is changing the material conditions of those most marginalized people. And so I think we have to look at that as well. And like I said, I think a lot of that has to do with a lot of good intentions, but our inability to stop centering whiteness. I mean, in a large extent, one of the things that ACT UP did that was really good was like kind of like not to be too concerned with respectability sort of politics, which was also a big difference in the gay and lesbian movement. When you think about the beginning with the Daughters of Bilitis and I forget the name of the guy organization, but their whole thing of wearing suits and looking professional. And like, you know, that ran a long time in gay and lesbian, like, you know, even like, you know, through like, you know, the wild 60s and stuff, there was still a lot of concern about respectability politics. And that was one of the things I found really great about being part of ACT UP, is that part was thrown out the door. But the needs of white people, I feel like still like took center stage a lot of times. And I don't mean like individual white people, but like who had money, who had the time to come to the meetings and do all the things, right? Like I said, like once treatment started to come out, you know, as I said before, I used to work at the San Francisco AIDS Foundation. And I know a lot of my homeless clients couldn't get those treatments because due to the fact they were homeless, they were non-compliant. And again, you know, most of those were Black and brown folks, even though like obviously some white guys and women also got caught up under that. But again, like I said, I feel like the thread I see like kind of running through is the absolute failure of centering the most marginalized.
Yeah, and I thank you for that, Crystal. And I recall those knockdown dragouts and also the theoretical discussions that were happening. Although I think in San Francisco, I feel like we've done a lot of discussion in hindsight, an analysis in hindsight of those dynamics. I actually just wrote a piece for the Bay Area Reporter that's coming out tomorrow that is specifically calling out the fact that we, as a gay white centered organization, as individuals, that, you know, once we got what we wanted, we moved on. We moved on, and to be fair, some of us died and some of us burned out, and you know, and then came up again to do other things later. But you know, but the urgency went out, and I think you're right. The Clinton administration also, because they were at least listening, you know, and speaking about the issues, and you know, and right now we've got Trump, you know, and so in some ways, you know, that's really kind of like helping to galvanize this movement that we're experiencing right now, don't you think?
I think it's definitely that. And I also think, to make another point, a lot of the people who came into the activist movement and who identified a need, one of the things that ACT UP did was that there was no way to wait for a federal government when a federal government was criminalizing gay and Black and other bodies. And I think that to some extent is true now. People recognize the federal government is not going to step in. So I think what happened with ACT UP is that there's a huge amount of direct services and services that got created within all communities at that level. And essentially those became the institutions of the HIV movement. And tons of people moved from maybe an initial position of activism into direct service, into policy, into creation, so that you have a lot of spin-off groups that got created. I mean, Treatment Action Group was a group that was essentially very white-led gay male agenda around treatment. And it involved people from ACT UP who went and moved into that realm and were advocating, but they were advocating to some extent for agendas that served very much the political and personal positions they were speaking from. And it was maybe different from what was happening in San Francisco or in LA.
You know, in San Francisco, we had this split, and Crystal and I have talked about this on a number of occasions, but we had a split of ACT UP San Francisco where we separated off to ACT UP Golden Gate that focused on treatment issues, which was,
my point is there were a lot of victories and a lot of things got created.
Yeah, a lot of work was spun off. Organizations were formed. People developed careers and changed careers and all that. So yeah, I understand what you're saying. Alex, what are you thinking?
I want to respond though before I say anything to one of our audience members, Lito Sandoval, mentioned that some organizations split off into two organizations. And that's
that's what I was just referring to. Lito was part of that, and I think Lito and Crystal were on the ACT UP San Francisco side of that split. I was more on the ACT UP Golden Gate side, if there were sides, and there were, I guess, there was a lot of overlap as well. But Crystal, what were you going to say? Let me go back to Crystal. I think because
Alice was speaking. I'm done.
Okay, go ahead.
Well, I was just gonna sort of segue with what Crystal was saying, because depending on who was leading the meetings and depending on who was in the room, some of us didn't exist. And depending on your age too, you didn't get a voice. And depending on who was leading the meeting or who had all the power of, you know, being able to have off and have time to get minutes together or get the agenda together or get some sort of structure together. Most of the time, my friends and I sort of took what they were doing and moved to the side and, you know, came up with some other ideas that we can participate and feel as though we're participating. But, you know, I was a young pup and didn't get recognized skin color, didn't get recognized gender, didn't get recognized, you know, just having a young voice, you know, we were ignored. And then, you know, how do you want to participate when one or two people think that they have the floor all the time? You know, you don't hear all the voices. And then it gets to be frustrating. You say, I'm out, peace out, and you start doing your own thing. And so we started doing some splinter groups where we knew that we can have some benefits or some value to adding, to helping. We weren't called anything. We just did our jobs. We just did work. We showed up when we were supposed to show up. We did things when we were supposed to do things. We were just there.
I would just say that, like, I want to be clear, because like I said, I definitely know that ACT UP has some successes. You know, that's for sure. And I know that we in ACT UP San Francisco, in any case, I know we also, you know, try to do work with like marginalized people, like people with AIDS in jails and prisons, for instance, and sex workers and people like that. But I think, like, when I go back to it, like I said, it just seems to me that, again, like, I'm just wondering, like, what would it have looked like if we had actually censored the most marginalized? Where would we be even with COVID today, right? What would have happened if ACT UP had kept pushing for universal health care? You know, or like, and I think, like, what happened with Clinton, I feel like, is like, yeah, he did talk and he listened, but, you know, he still left the Haitians on that ship right after he said that if he got elected, he would, like,
do something about that. And I feel like, and I'm going to say we here, because I felt it too, of the fatigue, right? Of the years of Reagan, the years of Bush. And it was like hard to like then get people again excited, right? Because Clinton was on our side. And I think this is something that we have to be careful about at this very moment, of like letting like organized politics like kill this movement and kill the momentum, and to have people settle for what looks like justice rather than demanding real justice. And I think that's more what I'm talking about. And again, that's not the fault of individuals necessarily. This is the state we live in. This is the world we live in, right? We're sort of like, yeah, from like the city council to the White House, we center white thought, white fears, and and by extension, like who has like resources and who doesn't, and things of this sort. And I feel like for myself, I'm just saying that this is for me an important lesson to learn from this moment. But also, I would have to say that I feel like this is also a moment where white people need to know that they're not doing whatever you're doing to move this moment forward. You're not doing it for Black people. You're doing it for yourself. Because as I've been known to say, white supremacy is going to get us all killed. And I feel like that's like what people are starting to wake up to, some now. Mm-hmm. And I feel like even though people in ACT UP had been from all these movements and stuff, and there was like some understanding of that, mm-hmm. I don't think it was ever really clear, even in ACT UP, right. Is that, we all got to make it, or we're not gonna make it. Or that the fact that when a Black trans like ex-prisoner can actually like live and thrive, then we'll all live and thrive. And I feel like, we didn't follow through maybe with that idea. And I'm not, and ACT UP is not the only organization, I mean, a lot of the women's movement didn't follow up on that, right? I mean, and a lot of the movements always had like problems with racism and stuff because we live in America, I mean, again, not about individual people, but about the systems we live in.
Yeah, I just want to, go ahead, Anne, Christine.
I was going to say, Crystal, I think one thing that I observe is that there's often expectations for groups without really an appreciation of who is in the room, who has come into the room, and what is their agenda? What are they there to do? Mm-hmm. And I'll speak for the Lesbian Avengers as an example. The Lesbian Avengers was fairly a fair amount of some experienced older white and some Latina and a few African American lesbians mm-hmm. who had been in the AIDS movement and other movements and were seeing a need for greater lesbian visibility and exclusion of lesbian issues. Yeah. But the women who got attracted to it were largely younger, white, college-educated women. Mm-hmm. And when the work came to try to figure out what were those women willing to do, what they wanted to do was, what was important to them was to celebrate their sexuality publicly, to talk about a shifting sexuality for them, much more than maybe taking actions by doing solidarity work with Bronx Lesbians United in the Bronx, or with Latino women who were maybe wanting to talk about, hate talk on the radio. So I think it's critical to know who's in the room, and then to look at institutionally and say, what outreach are you doing so that that room shifts? And I think right now that's so important in all these cities, to look and say, who's speaking for the movement, who's not at the table. And so if we, so that we have realistic expectations of what people are going to do. I had no expectation that most of the people in ACT UP were ever going to be fighting for universal health care. The women and other people in the rooms in New York fought tooth and nail for that. It was ugly, very ugly. To try to get people to go to a protest of Haitian refugees was not easy. This was fighting.
Mm-hmm. Mm-hmm. Yeah, that's breaking it down.
Yeah, it wasn't their fight. They weren't gonna go.
Yeah. I'm Emily. I'm wanting to bring you back in here,
Mm-hmm.
and I'm trying to think of some really brainy question that I can throw at you to put it in a historical context for us and tie a bow on it, but that's not going to happen. So I'm going to just like ask about,
Mm-hmm.
I'm thinking, you know, we're talking a lot about AIDS and ACT UP, but I'm also just thinking about, you know, I mean, ACT UP functioned as a component of the larger society and culture, obviously, and we've all alluded to that. And in particular, Crystal. And I think that in particular, it functioned as a part of or overlapping with the LGBTQ rights movement, you know, and I'm just thinking about, you know, just just this month, we had the Supreme Court ruling, you know, outline, you know, firing LGBT or at least gay and transgender people from their jobs for who they are, for their sexuality or identity, and you know, so, and I'm wondering about like how that sort of, those kind of advances for LGBT rights, is that going to take the steam out of LGBT involvement in the fight for racial justice that we're experiencing right now, and in particular the leadership of the, or you know, or how do you see this evolving? Because, you know, it's about, I mean, the LGBTQ community writ large is as diverse as the rest of the population, and it is not a functioning body. You know, it is a lot of different component parts, but I'm just thinking about the leadership and the fight for queer rights as we start to win those battles. Are we going to move on and forget about the queer people of color, the queer trans people of color, and those social justice movements? So, you know, I'm just trying to.
Yeah, I mean, I think in terms of like large national organizations, they've already moved on. They did that years ago. You know, you don't see large national organizations out there even making particularly strong statements around around the kind of current uprising, or supporting Black Lives Matter, or supporting or standing with the movement for Black Lives, you know, week of action. Like, you see actually those organizations, BLM and Movement for Black Lives, having, you know, really bringing trans and queer issues into the broader framework of Black Lives Matter. And I think it's also worth pointing out, right, that the three women who really created the hashtag Black Lives Matter and then the organization, of the three of them, two are queer identified, right? So this is already a heavily queer and trans led movement. Not exclusively, certainly, but heavily so. And I think that, you know, you're right, we don't have one LGBTQ community at this point. We have many. And I think, you know, of folks who are in the streets, and that there's a good awareness and a good integration in many ways of LGBTQ politics, and a fair amount of visibility. I think it could always be better, and brought in more strongly and kind of more explicitly named. And I think that the reclaiming of pride is a really important kind of avenue into that, through kind of some of the more like officially recognized events and organizations. But you know, really since the sort of moment that Crystal mentioned of the kind of founding of the Daughters of Bilitis, or of Mattachine, kind of the homophile era, since that moment, since really kind of the beginning, there's been a split between the kind of most visible national kind of rights focused, relatively more respectable organizations, more legal organizations, and the like lived experience day to day, and the kind of fighting back against police in particular, or fighting back against other kinds of state violence. And I think that, I mean, a connection that I was also thinking about as other folks were talking was that this, you know, it is really important for people's self-interest to be what brings them into the room, right? And so that means for white people too. And one of the patterns that I've definitely noticed in kind of queer history is that, you know, when there are attacks kind of from the right, white queer people sort of recognize a common enemy and join in to coalitions. but there's two risks to that. One, there's like a victory made, and so then people back away because they're no longer as concerned or as invested. And then the other risk is that sometimes those white folks start to try to forget that they're white. Like they kind of come into the room and you know, I mean, I recognize this as a like draw, as a pull, as a desire, you know, for folks who are like, oh yeah, the right, you know, these white supremacists see me as a race traitor, so maybe I am, like maybe I can kind of give that up for a second. And
so they forget their privilege,
basically. They forget their privilege, they forget the sort of and you know, this even gets absorbed into more kind of other settings where, like in my own university, when people talk about diversity, they want to talk about anything. Like, so for many of us, when we you know, use diversity and inclusion, we're actually talking about racial and ethnic diversity and recognition and power and injustice. And we use other words to talk about like queer issues on campus or women faculty, but the administration wants to say diversity and inclusion to cover all manner of sins, right? And by doing so, they can look at a group, you know, and say, well, look, we have all these white gay people in leadership at the university, which is true in my university. Therefore, we have diversity in leadership, right? And some of those same folks are actually, you know, obstacles to other kinds of change. So I think that's another dynamic I would name, right? Is the ways that that solidarity, you know, it may begin in this kind of really radical way, but it can be co-opted and usurped.
Right. So, you know, and we have like a half an hour left, and I just want to like interject to say, for those who are watching, and a lot of people are going to just watch this on Facebook, and I'm not monitoring Facebook comments, and I apologize for that. Lee, if you want to like copy paste any comments that are coming in on Facebook and put it in here, then I'm happy to go to those. But other people will be watching the recording, and that's fine. Things are changing pretty quickly, I want to say, and I want to be sure to like get it into a little bit of prognostication about where we're going and, you know, what's happening in this moment, but also in the future. But before I do that, I just want to like circle back to something that everybody alluded to, which is kind of like the danger of incrementalism, the danger of moderation, the danger of being co-opted, the danger of neoliberalism. And, you know, Alex, I think of you as, you know, when I think radical, if I look up radical in the dictionary, it's probably going to be a picture of you there somewhere. But also you come to the table and you talk with people and you know, and you get wins, right? So, you know, so what's the, you know, right now we have a movement that's growing. There are some specific demands that are being defined. And, you know, people are, national organizations and queer organizations are signing on to letters saying, yeah, you know, against, you know, they're saying the right things. And we're in a presidential campaign. We're hearing campaigns are going to be saying the right things. There's an entropy, I think, that sets in, you know, that will maybe slow down that momentum based on our history. How do we keep it going? How do we keep our you know? And I think I'm just maybe making some assumptions about the things that we all agree on here, that we would like to see. You know, what that looks like specifically. You know, we probably don't have time to get into, but if we're talking about, you know, fighting white supremacy, establishing greater racial equity, you know, ending police brutality, and then we can get into talking about AIDS and COVID too, and just healthcare for all, and so on. But, you know, how do we keep that momentum going? Can you speak to that? I mean, you're taking to the streets on Sunday. That's what you're trying to do.
Yeah, I mean, one of the things that I'm going to just go back a little bit, Terry, before I answer your question. One of the things that I'm seeing is that because people were able, and it's a little bit of what everyone was saying, people were able to see things straight on that affected their humanity. And that's where we got most to get out in the street and fight during a pandemic, because what we saw was the tipping point. And we, as POC, BIPOC, have been living this nightmare, you know, if you want to go back to our ancestors, 401 years, right? And we've also seen start, stop, a little bit of policy here, a little bit of policy there, and not really the policy of change that we really need, that Crystal was talking about earlier, that Anne Christine talked on. What I'm seeing now, and this is just, you know, like I wish I could transport myself to some other cities just to see really what's happening, but because we're in such a bubble that we're almost preaching to the choir here. But what I'm seeing here is more white people are standing up and using their voices and using their privilege to make a change. That's what I'm seeing right now. I'm seeing white people do their homework and tell other white people, if they didn't do their homework, go and stop asking the BIPOC those questions. Go and do your own research. Go and find this on your own so you are more knowledgeable about our next steps. So what I'm seeing is that there's more of a collaboration of where these policy changes need to happen and where they need to go. And I'm hopeful. Like I'm not going to get too crazy about it, because these turns happen, people get bored, you know, it's not about them anymore. And there's, you know, the question of what do I do next and how do I keep active? But I think the fact that our youth is involved, I think the fact that they took down the president last Saturday, this is what gives me the hope, is that our youth is involved. And I've been speaking at different rallies, and I went to a rally on Friday that I spoke to, which where the average age was probably under 25. There were some babies in the audience that were speaking truth to power. And I asked this one young person how old they were from the mic, and they told me they were 14, right? Another person yelled out 17. You know, some people said, I can't vote yet, but I'm here and I'm going to help make the changes. So this is where, you know, I get the hope, because there's a lot of those there's a lot of them, and they're definitely making the change, and they're looking up to their elders. They're not like shitting on what we've done for the past, you know, years. They're not shitting on us. They're listening, you know, and they're taking the best of what we can give them and expanding it. And that's just so beautiful to me. And that's where I see the hope. I don't want to get discouraged. I will be out there as much as I can, you know, and I hope that others feel the same way. And the only way that we're going to keep this going is that we start making some policy changes that make sense. I mean, we've forced some different changes in policing, but, you know, it should be coming from the federal level. It shouldn't always have to come from the communities. It should be coming from we should have a president that says, that is a great fucking idea. Yes, bring me all the information that I need to make these decisions, to see how we can change this world, because we are looked at as the hotbed. And so when we don't change, some other countries don't change. They look at us. You know, look at the world right now. Look at it. It took one, you know, it took this movement here in the United States for the world to start taking care of their own, you know, people of color and less marginalized. So I have hope. I think the next steps are going to be the most tough, because people are going to get exhausted. Same people are out there. We need a tag team. We need the front line to be able to rest so the next line can step up. And so we just got to figure out ways of how we can do that. And that's what we're trying now. We're just trying to keep people mobilized and keep them energized. So that's my chore. That's our chore right now. I see that Anne Christine wants to jump in here.
Yeah, I mean,
go ahead, Crystal.
I
was actually going to take this question from an audience person and pass it off to Crystal first, and then I'll come back to you, Anne Christine. So I have someone, an anonymous person, saying and this is in line with what we're talking about, but having the Clinton and Obama era gay complacency in mind, how do we make sure that the wealthy gay contingent fights with us after this cycle of activism fades during the next liberal presidency, assuming that Biden will be Crystal, can you address that?
Yeah.
Is that the one?
Yeah. I don't have any like, like extra like insight, but one of the things I would say though is that one is that we have to organize like among ourselves, and I feel like, and then we need to give our money to the organizations that's doing the work we want them to be doing, rather than these national organizations who don't seem to be like concerned with what we're concerned with. I mean, there's one thing, because money, right? Money is like real. Money is king with a lot of these groups trying to organize and whatnot. So, that's one thing. But I feel like also, like you said earlier, it's not like there's one community, right? But unfortunately, the press, mainstream press, usually when they're going to look at, they're talking to like white voices, right? But I think it's like at the end of the day, I think we have to demand a better agenda from these organizations as well, if they're going to get our money and our support. And I think individual white people, I'll say it again, it's been said a million times, but they need to listen to the most marginalized. And so when setting agendas, even when looking at political candidates, who like the major organizations back, right? And also, I think at the end, as I said, I feel like, for one, this fight is all of ours. We all have to be in this fight to dismantle white supremacy, or none of us, literally, we're not going to make it. None of us. And this is not, for me, like hyperbole. This is the real deal. And so one of the things we have to do is to keep fighting, right? And to keep fighting with our organizations, with our fave politicians, with our, fave stars and all of that, and have to hold people to account. Because symbolism is easy. And this is what we get a lot of time, it's symbolism. Because I don't care about the Human Rights Campaign talking about Black Lives Matter. I don't care about that if you're not like doing the work to include like Black trans women and other Black people and getting into this fight and putting like your resources and stuff behind it. Otherwise, that's just talk. And, and it's just like with any organization, and I don't care if you're like a yogi or a politician, good words without good works, it ain't shit, right? So I think this is also, we have to figure out like what we need from our organizations and then push them to be what we need, right? And not settle, and not settle because we can get married, right? Because then we have to ask ourselves, I can get married, but what good is that if I can get like beat down in the street, right? What good is that what good even is like the law that just passed about the civil rights if I can't even get a job, right? So I think we have to like think on a larger level, and we can't see a victory for some of our community as a victory for all of our community.
Right.
Yes.
And Christine, I'm going to pass it over to you.
Well, it's basically picking back. Crystal, I couldn't agree more. And Alex, you were talking about, I think some of the lessons that I see is that we're already seeing this, and people who are in some of the protests in different cities are making this point. There's not a single universal strategy here. Every community is going to have different priorities and a different set of ways in which it needs to organize. I think, though, that sharing the lessons of what is working is critical. And I think that is happening very successfully. I think the internet in that way is our friend. There's a lot of sharing models and lessons and voices. And I think that that's in every community, sharing that. And in our own communities, I don't look to the white national institutions to do anything for me, nor did any of our movements ever look to those institutions. They were not serving our agenda. We have to build from our communities. But I think, again, it's to look in our communities and say, who is at the table? And, people always ask me this question forever as an activist, like, well, how do you know where to start when people are not active? How do you know what to do? And my thinking is, if you're looking at a problem and you're trying to help someone, that person you're trying to help, if it's not yourself, they know their problem and they can tell you what they need, and you work from there. And so I think that whether, what's going to work in New Orleans or be a priority for New Orleans, we've got the information here. We just have to actually go and ask the communities that are most impacted and work. And to me, that's like, we have our strength, we have our resources, we have our allies, we have our tools. We got to do the work. And I think that's it. If we work from that place, we get stronger communities, but we have to share all the lessons in our communities. And I think that's where we get more of a sense of the national agenda. And I think that's working very well. I think that's why Black Lives Matter protests have worked so successfully, is that locally leaders have taken a lot of, they've set their agendas, they've talked to their own communities, they brought out the voices, and then they have shared that message elsewhere. And that's why we see people decolonizing across Europe now more, and across the rest of the world, and that's coming back here. So to me, I'm optimistic, but I'm definitely not looking to large national organizations who are not speaking for, they're not representing, they should be, but they're not representing the most affected. Let's have our most affected community speak. We'll have our agenda, and we'll figure out how to get going from there. That's, to me, the way forward.
Okay, great. I think we're hearing a lot of really good stuff, and as will often be the case, we're running out of time. And I just want to get to a couple of comments, but we're going to probably spend the last 6 or 7 minutes going around for people to just offer any final thoughts about this. And as is often the case, we've shifted from the construct of this event as it initially conceived a couple of months ago to something completely different, and that's fabulous. And I'm so grateful for that, because I think we're learning a lot that pertains to the issues of AIDS and COVID in particular right now. But when you make your final remarks, also, if people want to shout out to any organizations or causes that need donations, and you can add those to the chat also for people to see. I'm going to welcome you to do that. So I have a question for Emily. What can we learn from coalition building of the past for coalition building of the present and future? What worked and what did not work?
Yeah, so I just put into the chat a link to an article that I co-wrote with Laura McTighe a month and a half ago, I think, that has a lot, it's a piece on Truth Out, that has a lot of links to some current organizations, and it's kind of a shifted approach to coalition that I want to highlight. First, though, I want to kind of preface it with a bit of a response to the question about kind of some of the larger national organizations or wealthy donors, right? I mean, the resounding call that I have heard in the past few weeks from protests is defund the police and invest in communities and invest in human needs, right? So, that is a left call, that is a radical call, right? And it is drawing in large numbers of people, I think in part because of the context of the pandemic, in which people see how intense our needs are, and also the context of climate crisis, right? So I think that if there are some of those national organizations that haven't before understood or cared about defunding the police, or if there are wealthy donors who are suddenly realizing yeah, we're all affected by climate crisis, so maybe I need to get on board with this kind of broader radical vision, welcome, right? That's great. But I don't think that we get places by running to those. Historically, movements haven't really kind of pushed for radical change by running to the more moderate, kinds of demands, right? Sometimes they've been able to leverage support from wealthy folks who have those politics, right? But that's a little different than kind of suiting demands to those who already have power. And the kind of other kind of coalition I want to highlight is also not entirely just about direct action. So even though I know that the panel is sort of trying to think specifically about direct action, there are also many other kinds of organizing that folks have always done. And the article I linked is partly about my new research, which is about the history of HIV prison activism, by incarcerated people and in solidarity with incarcerated people. And, you know, in context of prisons, like direct action is not the safest tactic, right? Like what we saw in the AIDS movement in prisons in the 80s and 90s was a lot of efforts at peer education, a lot of working with like advocacy groups to try to get compassionate release, to, you know, try to build coalitions to highlight conditions on the inside. And we're still seeing that now with conditions around incarcerated people and COVID. So some of the organizations I would highlight are in that article, and they include Release Aging People in Prison. And I would just highlight that, you know, some of the impacts of the pandemic are so interwoven with our other kinds of crises around incarceration, immigrant detention, right? As well as kind of all of us on the outside, right? Who are also kind of experiencing crisis. So, and from there, I think we kind of also get a lot of great lessons about creative forms of protest that don't have to demand mobilizing in large numbers that might put us at risk, right? So we've seen a lot of car marches and like social media storms, you know, and other kinds of efforts, and also working, you know, figuring out how it is that people who are incarcerated are tracking what's going on for them in terms of COVID. So there are a lot of other kinds of coalition, I think, that are also about like different kinds of social locations, and not just about like we all do one thing, we all have a march, but we're different, right? So that's kind of what I would many different things I'm trying to bring into one last comment, but those are some of the things I would highlight.
Yeah, you know, movements, and I think what we have right now is commonly understood to be a movement, and it's recent. It's building on other movements, obviously, but movements are messy, right? And you know, there are no leaders necessarily, or at least nobody, you know, that's centrally calling the shots there. You know, oftentimes, and I think there's often a misconception about ACT UP also, to think that we were entirely about, you know, committing civil disobedience and getting arrested and doing direct action. But really that was about getting a door open so that we could discuss our demands with somebody in control or in authority, or at least propping open the door for somebody else to get in there. And I think, so I'm hopeful that that's kind of what we're seeing more of now. Do you think about that really consciously, Alex, when you go, you and Juanita are organizing this People's March on Sunday? You know, it's about, you know, it's also about, you know, getting media attention. It's about, you know, building a movement. But in terms of getting the demands achieved, is it a transactional thing for you?
Oh, yeah, that's a heavy question. You know, let me just, I'd love to answer it so straight up, Terry, but I think there's a couple things here. You know, when we get together and protest like this, people get together because then they realize they're not alone. They have a very similar agenda, and now we can all come together. And, you know, as we start the protest, as, you know, everyone was sort of saying, agendas start to change, debates start to happen, the highlights of things start to change, and we start to get some sort of policy or program that there might be one or two things that we all say, okay, no matter where we are in this world, we agree on that. And those are the messages that have to stay consistent. Now there's some fringe that we know we have to happen and bring in, but they may not be what the focus is in order for us to make that change. And so what happens is we start providing this voice, right? We start providing this essential voice. And when you have the voice of the different groups, BIPOC or other minority groups, depending on what kind of protest it is, then you start to get better at that foundation of a change, right? So with those three things, you start getting some wins. Now you start getting people to wake up and say, aha, I can jump in on that because I know something about that. And this is where I'm seeing is happening, is when people start to realize something that they can contribute, that's when you start seeing them there. And when they realize there's something that they can do with their time that's just not showing up and going, well, this was a waste of my time, so therefore I'm staying home next time it's a freaking pandemic and I'm not hearing anything that relates to me, then they stay home. But as long as we start keeping that constructive foundation going, that where people can buy in to these 3 or 4 changes. I mean, it was very similar to what other panelists were saying, in that we have to have something that we can all, move together. It's almost like a brain. It's almost like we're in each other's brains in different countries. When you start seeing things that were popping up in Australia around the Maori and around the Aboriginal, it was so close to what was happening, if not spot on, to what was happening to us for many, many, many years as well. So it's not an isolated thing. And then, once we start to have those wins, then, we can start having that similar thing. And that's where our generations are kicking in. That's when our young people say, aha, there's something that I can hold on and I can run with it, and bye-bye, because don't stop me. And I keep going back to the brilliant move that our young people did from around the world that gave that butthead 1 million, thought of 1 million people coming to his rally. I thought that was brilliant. I even bought a ticket, right? I thought it was brilliant because he did a freaking drive-by. He drove his plane over the area that was the what is it called, the offshoot or whatever. He drove over it thinking that he would have a moment of glory of all these people below him waving and screaming. There was 7 freaking people. I loved it, and I watched it live when he came over. And I loved it. I was laughing my ass off. And that's the kind of things that we need to do, is we need to let these politicians know that it's just not your voice that we're going to keep listening to. It's not it. We got to listen to the people, and we got to put the right people and the right voices in the room, no matter what it is, whether it's a corporation, whether it's a movement, whatever that is, we got to be in the room. We have to stop people talking for us. That's it. It's like, I'm tired. Right. I'm tired of it. I can't.
I mean, representation matters, and I think that was really a lot of the basis of the AIDS activist movement, was building on the PWA empowerment movement, to recognize that it's about putting people who have HIV and AIDS at the table to talk about their needs, and so I think that was very much driving the beginning of that movement. And it definitely pertains. Representation is important. I have a question for you from the audience. Where do I get a Make Racism Wrong Again hat?
Right on. Well, what color? It depends. We're only doing black. I did this red one because I want to take my fucking color back. I love red, and I do not want those people to have that color anymore. So I'm taking it back. But we have black and white ones that are for sale. So if you go, can I give my website?
Yeah, go.
Oh, okay. If you go out to activistgearshop.com, you'll find them there. And if for some reason we're sold out because people have been asking a lot, there's a new shipment that's coming in. If you see 0, don't pay attention to it. What I'll do is go out after this and I'll change it. So give me a half an hour after this and I'll change the numbers. But we have a new shipment coming in this weekend.
Great. Thank you, Alex. Love you. And I'm so grateful to say hi to Ellen for me.
I certainly will.
Let's just go around and get some final thoughts. And I'm really talking about a minute. Maybe Crystal, could you, and Christine, Emily, whichever of you would like to tell me what's burning in your mind? What's burning?
I feel like one of the things that's given me a lot of hope is the knowledge that high school kids organize some of the biggest marches around. And I went to the march that the high school folks at Mission High organized. And also just to hear their political analysis at this age was striking and literally brought me to tears. And made me feel quite hopeful for this moment. And I feel I think we all have something to add to that conversation, but I really would also advise people to listen to the young people organizing these marches and stuff. Because I feel also these young people are feeling the urgency of this moment. in ways that maybe some of us are not quite. And so I would say, like, listen to these people, because they, you know, these young folks really, they're smart, and they know what, and I feel like they know what's at stake here in ways that a lot of people in our age groups don't quite understand, even at this point, like what is at stake here. And so that's the thing that's giving me hope.
And
one other short thing is, also I want to like ask people to please like keep supporting the demonstrators. Don't get caught up in this violence, you know, versus non-violent BS. You know, don't get caught up in that mess. And listen, that one of the main demands is to defund the police. So I think it's also incumbent on everyone listening,
that's right,
and everyone who might want to get involved for this to get on this fucking bus.
That's right.
Yeah.
Because this is a major demand, like everywhere, and we need people to get on that bus.
Yes. Yeah. And do you have any suggestions on where people can give or contribute or volunteer or anything, just off the top?
I have like so many in my head. Is there any way I could like send you a list as later?
Yeah, absolutely. We can post it. You know.
And I have a list too that I can send to Lee, and we can maybe combine all of them. And put
Yeah,
them
maybe we can post a list that when we post the event to our website or Facebook tomorrow.
Yeah.
Emily and Christine, I'm sorry, and we're out of time. But I just want to like give you an opportunity. If there's somewhere that people can donate to, if you have anything to suggest, like one place.
Here in New York,
Christine.
I would say that there's the New Orleans has the Immigrant Rights Coalition. There's a huge problem of detention of people, many families who are being deported by ICE. COVID is a huge issue. I think that we really need to focus the LGBT movement, particularly in right now, around the issues in ICE and detention as well as incarceration. I just want to make one point. Disasters like this run along pre-existing currents of social and economic inequity. We know that. If we do an analysis of inequity that's happening, we know how to find solutions to these problems. I think, you know, I take a rights-based agenda and I focus on inequity. And that to me gives me lots of guidance about where to take actions.
Great, thank you. And Emily?
I will definitely offer some links in that list that you post. But I did mention Release Aging People in Prison, RAP. Is doing some really wonderful work to try to pressure, especially in New York State, but also is linked to a number of other organizations. I would also say the Movement for Black Lives, the National Network, and Critical Resistance, who's done a tremendous amount of work to really help give people some of the analytical tools around defunding and abolition. And I would also really echo Anne Christine's points about really, I think one of the things I really hope can happen is that is a more strong link to issues of immigrant detention and pushing back against ICE in this moment to like, as thinking about it as a form of police violence.
That's right. And can I just say one last thing, Terry?
Yes.
Sunday, we're gathering at the corner of Polk and Jackson. We are taking back the old route. Be there at 10:30, we're gathering, and then we will start at 11 o'clock. Bring color, bring who you are, you know, bring your contingents, but bring fun, because we're just going to take back the streets, and they're going to know we're there.
Great,
okay?
and bring your masks.
Yes, please. There's a government, a state ordinance. You have to have a mask on, and that's how the police will fuck with us if you do not have your mask on.
Right. Yeah. And I just want to say thank you to all of you for your time and for your work and your continued advocacy, and the hope that you've shared with all of us here tonight, I think is really inspiring. And I think, you know, we can learn from the past and apply those lessons to the present and the future. And I echo what Anne Christine said about, you know, be smart and analytical and think about, you know, how we can build these bridges of equity, and in particular within the LGBTQ community. I think because we come together around our gender and sexuality differences, but we have all these other all these other communities that we represent. So I think we have a unique opportunity to to do this work. And Alex, see you Sunday. The rest of you, I hope to see you around. Thank you so much.
Thank
And
you.
have a good night, everyone. Thanks everyone for joining
Thank
us.
you all.
Thank you.
Bye.
Bye. Wash your hands.
Yeah.
Hi, my name is Eric Servini. I'm a historian of LGBTQ plus politics and culture, and also the author of The Deviance War, The Homosexual versus the United States of America. This past May, I had the honor of joining the GLBT Historical Society and a group of activists, sex educators, and veterans of the fight against the AIDS crisis to talk about the lessons that we can learn from the AIDS crisis and how we can apply them to our current pandemic that is gripping the world as we fight COVID-19. It was a remarkable discussion, and we especially tried to talk about how we can protect the most marginalized members of our community. How do we protect sex workers, Black, Indigenous, and people of color who are disproportionately affected by this virus? And how can we learn from the successes and failures of our movement during the AIDS crisis to make sure that we're fighting back as powerfully and equitably as we possibly can? So thank you so much for watching, and I hope you enjoyed the program.
Awesome. All right, we've got enough people in the room. I think we can formally welcome everybody to this week's program of the Fighting Back Lessons from AIDS for COVID-19 series that we are doing. Tonight we're going to be talking about the topic is on pandemic sex. How do you navigate sex in a pandemic, and all of the questions around that. I'm Lee. I use they, them pronouns, and I'm the museum operations manager with the society. And what we're going to do is I'm just going to do a little bit of Zoom housekeeping if you've never done one of these webinars before, and give you an idea of what the evening will look like. And then I will pass it along to our executive director, Terry Beswick, who will be moderating the conversation. So if you're attending this webinar, you have a couple of different options on the bottom of your screen that will allow you to interact in different ways. So everyone has access to the chat. If you click the chat bar, the chat button, you should be able to see a panel come up on the right side that says Zoom webinar chat. Please, throughout the whole conversation, if you want to talk with other attendees or start a conversation as you're reflecting on what the panelists are saying, feel free to utilize that chat. Just make sure that if you want to send a message that everyone will see, you need to make sure to select all panelists and attendees. If you'd like to send a private message to any one of us as panelists, you can also see a list of it in the chat bar. And we're going to have about an hour and 15-minute conversation, and then we'll switch over to a Q&A segment. We have the ability to take questions throughout the entire evening. So you have the option, there's a little like two chat bubbles, that's the Q&A. If you have questions that you'd like the panelists to address, please send those in via the text function, and we'll be able to have a queue of them, and we'll select the questions to be answered. Please feel free to send them in as you get them. If you've got a question that you're not sure you can remember until the end, feel free to throw it in, and I'll just be watching it from behind the scenes. And then also, if there's something that you really during the Q&A want to interject verbally and aren't able to express via the chat panel, you can press the raise hand button, and I'll be able to see who is kind of flagging me. And with that, I'm going to turn it over to Terry Beswick and welcome all of our panelists. Terry, you're muted.
One of these days I'll catch on. Lee, thank you very much for your work behind the scenes, and I think we've got this streaming on YouTube as well, so people can also be checking in to that there, and it's going to be archived on our website. So I'm really excited about tonight's panel, and I'm really grateful for everyone that is joining us here on the panel. You guys are all going to bring something different and unique and fantastic, I'm sure, to the conversation. And we're really going to be able to skim the surface of a very complex subject, of course. Just by way of background, the Fighting Back series, which we used to do in our physical museum on a monthly basis, really started around the 2017 upon the inauguration of the current president. And we really wanted to provide a way for us to bring people together to talk about contemporary social justice issues in particular, and put them in a historical context. And so we have a lot of archived panels. I think several of you, I know, Race, I think you were on one. But we have a lot of them archived on our website. So I encourage everyone to check those out. So this is now turned into the last couple of months into a weekly series and online, of course, and we're looking at, in particular, a special focus on COVID-19 and looking at it through the lens of HIV and AIDS. What lessons have we picked up from HIV and AIDS that we can apply to the response to COVID-19, in particular in the LGBTQ communities? And so there's a lot there. We try to bring together an intergenerational panel, a diverse panel on a weekly basis that either brings expertise or current experience to look at things from a different perspective. And so, we try to keep this fun and light, and I encourage people to just sort of converse with each other or ask each other questions. And if anybody that's watching, you have a question, just pop it up at any time. And, if we don't get to it immediately or in the course of our conversation, we'll definitely get back to it later. So let's see, with that, yeah, what about sex? That's tonight. And so, I'm hoping that we're going to be able to address a few general questions. And in particular, I'm interested in looking at what does it mean to be single right now in terms of this lockdown, shut-in, whatever we want to call it. Or what does it mean to be in an open relationship, a kinky, polyamorous relationship? In the queer community in particular, what does it mean to be a sex worker or a client of sex workers right now? And in particular, and I just want to say that the idea for this particular forum came as a result of engagement on Facebook and social media. When we were starting to see, and Brendan, I saw your smile, yeah, there was one conversation in particular. Brendan was stirring up something about people shaming people for hooking up, particularly in the early days. And I think people's attitudes have kind of changed over the course of the last couple of months. In some ways, they've settled in, and in some ways, they've settled back, I guess. So I think looking at it in this moment in time, we just want to be aware of people's growing knowledge of what the risks are around COVID specifically, and what behaviors are appropriate from your perspective or other people's perspective, and how do we modify those behaviors or encourage behaviors that are safe. I just want to encourage everybody to look at this from a harm reduction perspective. I'm looking at everything from a harm reduction perspective right now. Today I went to the farmer's market. And, it's kind of like, it's a little bit sterile. Nobody's smiling at each other, because we're wearing masks. But, I had to get out, I had to get some food, and I had to come back. And so that's taking a certain amount of risk. So everything we do has some risk attached to it. But in particular, I'm hoping we get into talking about hookup culture, apps in particular, what's going on with apps, what's going on with sex parties. where are they happening virtually and in real life? And so there's a lot there. So I just want to briefly introduce our panel, starting with Race. Race Bannon is a good friend of mine, neighbor here in the Castro. He's been an organizer, writer, educator, speaker, and activist in the LGBTQ, leather kink, polyamory, and HIV/STI prevention realms since 1973. He's authored 2 books, been published extensively, spoken to hundreds of audiences, created the world's largest kink-friendly psychotherapist and medical referral service, and was a leader of the DSM project, led to a beneficial change in the way psychotherapy views BDSM. He also currently writes for the Bay Area Reporter and has a wonderful column there, and also a website that lists events in the leather community here in San Francisco and elsewhere. Eric Cervini, I got to know Eric a little bit online. He doesn't know me, but I've been a fan of now I'm blanking on the name, the podcast. He's going to tell us about it. And Quarantini, that's it. Really fascinating, a lot of book discussion and fun talk. So he's an award-winning historian of LGBTQ culture and politics. He graduated summa cum laude from Harvard College and received his PhD. Do we call you Dr. Eric Cervini? It's okay.
Whatever. Eric's fine.
Just when we get to know you really well, right?
Right.
Okay. And so he has a PhD from history from the University of Cambridge. Niece went there, where he was a Gates Scholar. His debut book about Frank Kameny and the American homophile movement, The Deviants' War, The Homosexual versus the United States of America, will be published by Borar, Strauss, and Guru in June 2020, and I'm really looking forward to reading that. So, and Luis, thank you so much, Luis Gutierrez Mock, PMPHMA, is a queer Chicano white trans man from the Bay Area who has worked in the fields of trans health and HIV prevention for 20 years. He currently directs the Triunfo, I should always look up pronunciations beforehand. Triumph, correct me if I'm wrong, project at the University of California, San Francisco Center for Excellence in Transgender Health, a trans prep demonstration project. Thank you for being here. Celestina Pearl, AKA the Van Lady, is an artist and longtime sex worker with many years of experience in the many facets of the sex industry. She currently is the outreach manager for St. James Infirmary here in San Francisco and drives a van around San Francisco, hence the Van Lady, serving the health and occupational needs of folks working and living on the streets, trains medical students to perform sensitive, competent pelvic exams, and is raising a brilliant child. Brendan Schuchart is a writer, actor, political organizer, and advocate for people living with HIV. His writing on the issues of HIV-related health and stigma have been called humanizing and heartbreaking, and beautiful, honest, and important. These days, Brendan devotes most of his time and energy to the never-boring world of San Francisco politics, where he works to advance progressive causes and candidates and sits on the boards of both the sex-positive Dems. I didn't know about sex-positive Dems. That's new to me. Maybe you can tell us about it. And Alice B. Toklas LGBT Democratic Club. Brendan's a good friend. Thank you all for being here tonight. So let's plunge in. With all that preface out of the way, I see some chats coming in. I'm going to take a look at those as we go. And I want to open it up and kind of let's back up and start at the beginning and talk about HIV and AIDS. Some of you, like me, can remember before we had the term HIV, that we had GRID, and before that, it was just, we didn't know what it was. And there was a growing period of understanding of what the risk factors were around transmission. But if each of you can kind of talk a little bit about, your work in relationship to HIV and AIDS, or just how you think about sexuality with respect to HIV and AIDS now, and how the trajectory of our understanding has changed over time, or just talk about whatever you want to talk about. Maybe I can just go around the room, and I'll start with you, Race, if that's okay.
Sure. I'm probably the oldest person on the panel by far, so I go back to...
Not too far.
Yeah, I knew the very first case of HIV in Los Angeles and got very engaged very early in HIV activism and was a volunteer with the very first Safer Sex organization on the West Coast that I'm aware of anyway. I think there are comparisons to HIV and COVID-19, and some absolutely apply and some do not. And I think the thing that does not apply is that we are quickly learning a lot about this because it affects everybody. So therefore, all the resources are pointing at it, unlike when it was primarily gay men getting HIV. The resources certainly weren't there. And so the knowledge rolled out much more slowly. So the reactions were much more slow. The Safer Sex was very rigid and stayed fairly rigid for quite a long time because we didn't have a lot of knowledge. With something like COVID, every day we're learning something new because all research is pointed at it. Therefore, I think the way we deal with sex and COVID is going to evolve much more quickly than it did with HIV. I'll start there.
That's a great intro. Where shall we go next? Celestina, you're right below race on my screen.
So yeah, I mean, I remember as a child when, you know, when we first started hearing about HIV and AIDS. Actually, I think at that time, people weren't even using the term HIV. It was just AIDS. And unfortunately, people out on the street who are, you know, not in the world of medicine and academia still think of it that way, and it still carries a lot of stigma. You know, of course, like the big difference is the stigma. I mean, there's not the kind of stigma and bias against an entire, you know, large group of people. It's, you know, anybody, it's, you know, it's airborne. Anyone could get it. I guess what you're asking around is around like history, and my daughter's papa, who's a trans man and grew up as a child in the Castro from the late 60s onwards. And so they, you know, I got to hear a lot about San Francisco's history from them. And, you know, it's heartbreaking to hear about it, you know, from their perspective as a child. All of their, you know, basically all of their mom was and is, you know, a hippie mama fag hag. And so all of their friends were all gay men as part of their, not all, but a lot of gay men that were, you know, part of their family. And they lost all of them. So, you know, it's really, you know, I feel that, you know, I feel that through him. And, you know, just as I have navigated my way through San Francisco for the last 20 years, and I have gotten involved with HIV and STI testing. I'm hearing that there's maybe some audio problems. Are you all able to hear me okay? It's okay for now. Okay. Maybe I'll try to speak a little more slowly, maybe, so I can be heard. Yeah, so I mean, for the past almost 20 years, I've been involved in HIV and STI testing, primarily with St. James Infirmary. I started out doing triage and then also doing venue testing. So we would go like to Arrows, to Nob Hill. Those are the two main places I can think of where there was like, you know, a lot of gay men. You know, I appreciate being welcomed into that community. And, you know, as a queer woman, you know, I feel like an ally in that world. And I feel like, I feel like I can contribute, as a nurse and as an ally and as, somebody who's sex positive. And a lot of times we would see, we'd see folks who are visiting from out of town, and the idea of even being able to, talk about sex and, testing and, that it's, in San Francisco, I think we kind of take the, the sex positive atmosphere that we live in for granted, but so many other places, most other places perhaps, there's a lot more sex negativity and fear around gay sex, around sexuality, around HIV and STIs. So yeah, and that, with COVID, it's definitely totally different. I think it's very different in that way, but I do appreciate, being able to have that conversation around, the compare and contrast. Thank you.
Great, thanks, Celestina. A lot to get back to there, and I'm sure we will. Luis, can we hear from you?
Yeah, so I've been working and volunteering within HIV prevention, primarily within HIV prevention amongst transgender populations since 2000. So for 20 years now, which seems amazing to me. And, I grew up in the Bay Area. My parents are both nurses. My dad was an emergency room nurse. And I recall, very frank conversations around the dinner table about GRID and about, being nervous around providing care for a disease that nobody understood, and recall, the advancements that were made as testing became more readily available and as it became more clear that HIV was, transmitted through, through blood, through seminal fluid, through, through the various means in which it is transmitted, but that wasn't known at the time. And I see, we have a lot of parallels now that we're just like, we don't know about fomite transmission. We don't know if surfaces, the extent to which a surface could be able to transmit coronavirus. We just don't know that. We know that the virus can live on a surface, but we don't know for how long it would remain contagious, at a level that would remain contagious for people to be able to transmit it to themselves. The largest parallel that I can see between HIV and coronavirus is really the ways in which disease highlights inequities that are pre-existing within society. And so while, sort of theoretically everyone is at risk because this is an airborne disease, we're seeing that the populations that have the highest inequities are bearing the brunt of this disease. And, I frankly think that that's a large driver behind why our country is really focusing on the economic impact, because the reaction would be very different if the population that was placed at highest risk were older, white, cis straight Americans. Our response would be very different. Or if it was just even, just white folks in general. We are seeing that folks of color in San Francisco, particularly, Latinx populations, I think are like 84, 85% of hospitalizations. And so, we have huge inequities based on various demographics. And another similarity that I see is that SOGI data is not being captured for people who are testing positive. So sexual orientation and gender identity data are not being accurately captured. And in many parts of the country are just not being captured at all. In San Francisco, if somebody is presenting like at SF General or in one of the SF funded clinics, that data would be theoretically captured in some way, in addition to racial and ethnic data, which is also not being captured across the United States. But there's this way in which, again, the community, like for HIV, the community that is placed at greatest risk for HIV in this country, by far, trans women of color, Black trans women. That data is being silenced right now in the very same ways that within HIV, that data was silenced at first. It was, trans women were collapsed within MSM. There was no disaggregation of data. That did not end up happening within the CDC until I think the CDC agreed to do that in 2009. And then it took them several years to be able to update their forms. But we're seeing that. So this inequity is just being replicated again and again. And I think that, to me, that's the greatest parallel.
Awesome, Luis, a lot to dig into there as well. I'm going to go to Brendan. And Brendan, it's Brendan's fault that we're doing this forum, so maybe he can tell us about that.
So I guess before we get into why we're doing this forum, I'll talk about my experience with HIV, which was very different than I feel that everybody who came before me. I grew up in San Diego, and I'm 39 years old as of a couple of weeks ago. And growing up in the 90s in San Diego, we didn't talk about HIV. It was invisible. I knew it existed because I had been a little kid in the 80s, and I remember seeing the Ryan White movie. But coming out into San Diego in the gay community, it just wasn't discussed. And if it was discussed, it was discussed in hushed tones. And when I did find myself HIV positive at the age of 24 in 2005, I thought my life was over. Luckily, an ex-girlfriend of mine talked me into moving to San Francisco, where I, found amazing care, but still was very unpolitical until 2008 when the economy collapsed and Governor Schwarzenegger proposed eliminating the AIDS Drugs Assistance Program, which I realized would mean the death of many people that I cared about. And I ultimately got involved with an organization that is now sadly defunct called Project Inform, which was the oldest HIV advocacy organization in the country, and spent 8.5 years on the board of that organization, and it's very sad that they're gone. I have spent most of my engagement with HIV as an advocate, as a journalist, and I tend to think about the culture around HIV and around that, and that thinking has spread to my thinking around the coronavirus, right? And so the reason I suppose that we are doing this this panel is because in the very early days of this crisis, I saw a lot of my peers, a lot of my friends, a lot of very history-minded HIV advocates and activists doing a lot of generalized finger wagging about gays on Grindr, gays hooking up, and I finally had to say something, which was, we abandoned this kind of general shaming as ineffective around HIV, and why would we recreate it now? And Terry and I got in a bit of a back and forth, but he very generously said, let's have a panel, let's talk it out, and here we are. And so thank you, Terry, for the invitation. This is very exciting.
Thank you, Brandon. Eric, can you pick us up from there?
Sure. No, I think all of those are such great points, and I'm a historian of the 60s and primarily, and so I think one thing that really strikes me about the AIDS crisis and the similarities is how people were celebrating an end or at least a newfound element of gay liberation that and freedom when it came to their behavior and sexuality that crisis really threatened. And I think now you're seeing something a little bit similar, not just in terms of the incompetence of the government, but also right now, I know I certainly think anyone living as a queer person has felt the fear of that goes along with having sex and being queer. That I think if you can afford it, PrEP is something that was helping combat that fear. And I think just as we're starting to make that more accessible, even though Gilead has its own issues, I think now at least having the conversation about how do we separate, this idea of being sex positive with a disease, right? How can we still celebrate intimacy and make sure that we are not shaming anyone for being human, while also protecting not just ourselves, but our elders and the survivors within our community who now more than ever need to be able to tell their stories. So I think I'm so glad that we're doing this conversation just so we can have a conversation to talk about that.
Yeah, great. Thank you, everyone, for getting us started with this. And it's hard to know where to begin. I've had my brain is rattling with all these different kind of questions that I want to approach this from. But I kind of want to back up first of all from the apps issue and the public shaming issue. Let's come back to that and talk about what kind of messaging is appropriate and how people can sort of encourage behaviors to the extent that we know what is an appropriate behavior. And I just want to talk about issues of intimacy, issues of connection, and I think and I heard each of you talk about that in a certain sense. I mean, the entire world, pretty much at this point, or a lot of the COVID impacted nations are dealing with various levels of lockdown and isolation, and so we're feeling a lot of disconnection right now. And if you're a sexually active person, maybe that's magnified in some ways, especially if you're not, quarantined or isolating or sheltering in place with a sexual partner. So what, how are you seeing that? We're, what is this in San Francisco? I think we're I don't know what day we're on, 46 or 47 day of shelter in place. What are you seeing in yourself, in the community, in terms of the impacts around that? If you want to relate that to HIV or AIDS, that's great. But I think, can you address that? Race, what are you thinking?
What I'm seeing is what I saw happen sort of quietly as HIV unfolded was people making these personal decisions about risk assessment, harm reduction, what risk they were willing to take. A lot of things that were being done privately as sort of individual pacts with themselves or with others was done silently because it was considered a bad thing to take any risk whatsoever. But human beings being human beings and needing touch and intimacy and needing sex, at least many do, they made these harm reduction personal models that worked for them. They fluid bonded with somebody. They only had sex with certain people. They might have had protected sex. They might have not. It all depended upon the kind of deals they made with themselves and with others. And I'm seeing the same thing unfold here. I have already myself been contacted by someone saying, "Oh, are you interested in being part of my sex bubble?" So they are already reaching out and saying, "Would you be part of that intimate group that knows each other really well and would sort of agree that for now you're only having sex with each other?" And they're talking about a bubble of a few guys. And I know someone who has already gone through the process of recovery. Actually, he was entirely asymptomatic. His roommate was sick. And he is now playing with somebody else who has antibodies, and they've just decided this is going to work for us. So they've made that decision based on the science they know today. And That is something I am seeing rapidly happen because people are seeing this, unlike HIV, they're seeing this as having a light at the end of the tunnel. Whereas with HIV, it was entirely open-ended, and frankly, it was a death sentence. And while this is potentially a death sentence, back then, HIV was essentially a death sentence for almost everyone that got it. So they're making different assessments and different harm reduction models, and I'm seeing them unfold very, very quickly. I do think most people are not hooking up right now, or if they are, it's with somebody they know extremely well. But as was pointed out, finger wagging is a really, really bad way to get anyone to change their mind. And I think we have to accept that people are doing what works for them and not judge it, even if we decide not to do it ourselves. I think that's a really important thing. People are going to have sex. They're going to figure out how to have sex, and they're going to do it within the harm reduction model that works for them.
Brandon, are people hooking up? What's going
on? I mean, yeah, people are hooking up. You know, so I early on made an arrangement with an ex-boyfriend of mine, which was working pretty well for a while, because I am a sexual being. I need sex, and I live in a house where all of my roommates have partners, and except for me, and that was that made it just all the more excruciating. But you know, I think that race is the right point, right? Like, in the end, you know, like if you look at it globally, right? Like there's spectrums of, you know, you have like Dubai, where I have friends who are only allowed to leave the house once every 5 days with a pass from the government, you know, to the relatively lax standard of San Francisco, where we can like go for walks and like peruse the farmer's market. And then there's, you know, famously Sweden, where like life is, you know, minus like large concerts and stuff, like life is carrying on normally. There isn't a right or wrong way to do this. We all, to some degree, have to like make decisions that make sense for ourselves and those around us. You know, I myself, I haven't got the antibody test, but I'm absolutely certain that I've already had the coronavirus. I lost my sense of smell. I was very sick for only 4 days, but I happened to be on ritonavir, so I just happened to be on the drug that is supposed to make this go more quickly. But I do have roommates that I want to protect, and I want to minimize their risk. You know, I don't want to bring virus home on me, right? You know, and I do want to, one note on shame, right? There is this like kind of in the news right now, this, or in the gay news anyway, this like, what are they calling it? The meth gala, thanks Twitter. This New York party where a bunch of gays decided to have a underground circuit party, and some adult film performer live streamed it. Oh God.
As one would, I mean.
I guess that like, that even stretches my desire not to inject shame into the conversation. Like, I mean, like, I want to wag my finger. That is unacceptable behavior.
Was it the broadcasting, or was it the actual event?
You know, I mean, like, there were two sins committed, right? Like, don't do something incredibly stupid, and if you do something incredibly stupid, don't get caught. So it just like it made us all look bad, and it endangered them and like everyone in their lives. And you know, I was reading, there's a, you know, that a one-on-one interaction is relatively safe. You know, whatever that interaction is, if you're talking to your mailman or your roommate or your grocery store clerk, right? It's when you have 50 of those interactions in a hour span of time. That's why so many grocery store workers are getting sick, because the volume of interactions they have. And so like that was not good risk management at the very least. Yeah, I guess that's all I have to say about that.
That's great. Anyone else want to have a thought that you want to share on this? Luis.
So I can.
Please, Luis.
Yeah, I think that I want to start by saying I deeply believe in harm reduction for STI prevention and HIV prevention, and the ways in which, a lot of that is now, it's based on science, right? It is based on an accurate understanding of HIV risk. And we currently don't have an accurate understanding of risk for COVID-19. So for me, it's really difficult to think through communicating what harm reduction could be for COVID-19, because we don't understand the risk. We don't understand the risk of potential aerosol transmission, where the virus may be living in the air likely would be based on somebody with an incredibly high viral load. But we don't know. There's not enough known, and the science is shifting rapidly. And I think that particularly in the United States, where people just don't believe in science for some reason, there's a lot of people just think that this is a huge conspiracy, or it's a lie. There's also a lot of communities where modern medicine has just there's very valid reasons for people to distrust medicine and the medical field and science, particularly amongst communities of color. And I think that communicating harm reduction, it's difficult. I've seen what New York State, or it was New York City, the safer sex in times of COVID-19 information that they handed out. And, yes, very helpful, really great ways for people to potentially reduce risk. And this is not HIV or STIs. The risk is not between two individuals and then only their sexual partners, right? So the ways in which I've been trained to think through what harm reduction is are, for me, completely inadequate in thinking through this disease, because the harm caused is not only to me and my sexual partners. The harm caused is to me and the grocery store employee who I see during my once every 3 weeks outing to the grocery store, right? And the potential for harm caused is so much greater. And then how do we communicate that to folks? The participants who I'm working with in my research study that I'm on right now are majority undocumented trans Latinas, and a lot of them are sex workers, and some of them are still engaging in sex work. And for me, communicating with folks who are our participants, we've just been trying to say, here are some ideas about what you can do to potentially reduce your risk of transmitting or catching this virus. And also, we don't know if this is sufficient, and none of this is safe. I think that for me, it's fine to say, these are the things that I'm going to do to reduce harm, and to also, acknowledge that we don't know if any of this is safe. We don't know what of this is adequate, and our data is changing rapidly. So I think that's sort of where I'm at, and thinking through what messaging would be like to communities, and asking people, asking sex workers, can you make it hot to wear a mask? Can you do a scene with a mask on? Can you tell the folks who are hiring you that you're going to really get off on them wearing a mask? Can you not kiss on the lips? Can you not rim anybody? Can you try to, use a condom for blowjobs? Things like that are, what we've been talking about with our participants. And also just overall, we don't know what risk is. So if we don't know what the risk is, how can we adequately address harm reduction?
Yeah, I think even researchers and scientists are basically lay people with regard to this, and so everyone's kind of like trying to mitigate risk according to their best guess or judgment, and I think that I'm going to see if we can pull up that document that you mentioned, and I know the San Francisco Health Department also. Maybe you can post it for us, Luis. The San Francisco Health Department also came out with a sort of a sex guide, how to reduce risk around sex during COVID. I didn't find it as fun as the one from New York. The New York one sort of had a little bit more of a kink feel to it, which was cool, like recognizing things that people actually do. And I know during the development of the HIV prevention modalities in the 80s and 90s, there was a point in time where people recognized that the CDC approved prevention messaging was not reaching people because it didn't talk about the things that people actually do. It didn't use the word fuck, or didn't talk about sucking without a condom and all those things. And so people sort of had to find their own way around that. But I think to speak to the point of shame, I think there was a growing awareness. Race, thank you for posting that. And Luis, there was a growing awareness that by shaming people that basically, or by giving them banal messages that they couldn't relate to, that people tended to hide what they were actually doing, and then they couldn't be reached with any kind of effective messaging. So Celestina, Luis talked a little bit about sex work. Maybe we can use that as a segue to talk, how in terms of you or anyone that in your work, how are people navigating this around work?
Yeah, so I think that there's a bit of overlap in our communities that we serve. There is a fair amount of trans Latinas. We specifically go out on the street around the Polk Street area and serve the ladies while they're on duty. They're on the stroll, and we chat them up and offer them resources. And but one of the things that I was really thinking about was just all of the co-occurring risks that our communities are experiencing, homelessness and, loss of income. And for sex workers in particular, their work is illegal, their bodies are illegal, their lives are illegal. And, there's therefore they can't have protections, and therefore, they can't have the same kind of worker protections. So, they're faced with, they're faced with a complete loss of income, or taking the risk of, of getting COVID-19. And then also the issue of, because of the shelter in place, the Johns are not coming out. So not only do they have to make a decision about whether or not to risk working, but the source of that work is also being taken away because of, other people's choices, which, of course, I agree. That people should be, sheltering in place as much as possible. And also it makes it very difficult for so many people, and, that's where we need government help. And the government help is just not there for the most marginalized of our communities. It's so frustrating when I see how those that have the most get the most, and those that have the least are getting the least. And, I'm seeing that just all across the board in so many communities, and most especially the communities that I serve are homeless communities, street folks that are involved in street-based economy, dealing and sex work, and just at so much greater risk in so many different ways. So even aside from the emotional needs of intimacy, which I think there probably are a lot of people that have a lot of preconceived notions about sex workers and homeless folks, and that they are, that they're choosing to take all these risks. You see a lot of folks out there who don't have masks, and of course, some of you may have seen the footage of the stark difference between the way that the police are dealing with different communities, such as handing out masks to white folks in the park versus versus beating the shit out of Black people and not offering masks and arresting them. You're muted, Terry. I think you're trying to say something.
Did it wrong again. Eric, I'm going to come to you to try to talk about, maybe you can help us to kind of put this into some kind of a historical perspective. And I understand you're a historian of the 60s. You're also a queer historian. But just in terms of the academic way of thinking about this, how can we kind of like use the current situation or use the past to inform the present, and how will we think about this, I think, in the future, maybe the future being a week from now or a year from now. But Celestina, I also wonder if you can just follow up and just talk to us a little bit about the impact of SOSTA, FOSTA, the laws that basically shut down a lot of the online connections for sex workers. In my world, I think about Rent Boy and all that. But has had a huge impact, and a lot of sex workers were forced back out onto the street to try to make a living. But now they don't have like either one. So is that what's happening basically?
Yeah, well, I think due to a lot of different factors, you end up getting a whole lot of push and pull, and people's lives being greatly affected by the choices of people whose lives are completely unaffected by, by this legislation, and also, other political decisions. So, you've got FOSTA SESTA. Immediately after FOSTA SESTA, there, were a whole lot more people who, for whatever reason, ended up back out on the street or back out on the street, their choices being limited. And then the greater influx of sex workers out on the street then led to a lot of folks who are homeowners and wanting to rally around quality of life issues, and then putting pressure on the police to then institute the what do they call it, the prostitution abatement task force in Mission. And then so that crackdown, we definitely see that day-to-day flux of, we see higher police presence and then less sex workers, probably having to take greater risks, and who knows where they're being swept away to and being arrested. And then the shelter in place, and then the shelter in place happening, loss of income because loss of clients, and then loss of opportunity to work, and more police harassment because of enforcing shelter in place orders. So it's just so much back and forth and so much upheaval in a lot of people's lives when they're just trying to survive, and with very little support.
Yeah, and I think of like during the early years of the HIV/AIDS epidemic that there were a lot of stereotypes around sex workers, more commonly called prostitutes back then, and in terms of like spreading disease, And so there was a lot of work for AIDS activists to ally with sex workers and try to educate people about how sex workers are actually practicing and teaching safe sex. And I'm wondering if there's going to be like a relationship or a role or like a heightened awareness that comes from COVID with respect to sex work now.
Well, I definitely, I feel like, for many years, like the communities that I've been involved in have been very much that cross section of, gay men sex workers, HIV activists, and just folks trying to support a lot of cross sections of the queer community, and then and the handful of straight people that are also part of that community.
Yeah, and I think you said earlier, that this epidemic, like AIDS, or somebody said, just how it targets, or it seems to raise the visibility of those who are least advantaged among us, and so I think that there is opportunities for education around that. So Eric, and I'm kind of like thinking about, I'm not sure how old you are, but when I came of age in the age of AIDS, and came out and was coming to terms with my sexuality, it was part of the gay civil rights movement era, or post, the advent of the gay civil rights movement era, that we were hit with this. And especially young people, always thought about young people who were trying to come out and had this new thing, this new specter. It's like sex equals death, and what are the repercussions of what we're experiencing now? How is this going to affect the trajectory for the advancements of gay civil rights and just gay sex positive attitudes?
Well, I think the good news is that we can learn and look back at the AIDS crisis and see what did work, especially when it came to behavior modification. In the 1970s, the estimates say that 1% of gay men were using condoms, and then within 5 or 6 years, that went up by a factor of 70%. And I think you're going to see that now, as we recognize that we are human and people are not going to stop having sex, it is a human need. We're going to have to find ways of having sex that are still responsible. And I think having that conversation and also demanding from the government that information and those kinds of studies, recognizing that it's a given that people are still going to have these needs and need to see each other and need to have sex with one another. How can we best protect ourselves, protect others, protect our elders? And I think we do need to start preparing when it comes to equity. As soon as there is a treatment or a vaccine, I think we're going to have to start preparing now. Just as you saw in the second half of the 80s or the AIDS crisis, of ensuring that those drugs are actually accessible to all. I think the number one thing we can prepare for, whether it's the Gilead drug that's just been approved, is these will not be accessible to everyone. And I think we need to be holding not just the government, but also corporations accountable, because this is a human right, is having access to these drugs or whatever vaccine is coming. And so I think we need to start mobilizing now and brainstorming for how we're going to ensure that these are not divvied up solely to the Tom Hanks and to the celebrities of the world, just as the initial test suggests they will be. And I think also when it comes to general civil rights, I think the one thing history has taught us is that those in power will always try to find a distraction or a scapegoat for whatever failures in policymaking that are occurring. And I think we also need to prepare as LGBTQ plus community, not just for our own rights being taken away, but for other rights that may be taken away, whether it's immigrants, whether it's Asian Americans, anyone who could possibly be allocated blame for the regime's own failures. I think that's something that we need to look out for, especially in an election year. But I think it's inevitable. It's going to happen, and we need to be vigilant.
Yeah, and thank you. I didn't have myself muted this time. Okay, thank you for. Luckily, my dog didn't start barking. Thank you for highlighting, especially treatment access, which was always, whether it was treatment development or treatment access, it was always an issue with AIDS. It was very close to my heart, and I spent a lot of time working with Project Inform and other groups to try to advance those causes. And Brendan, I've really been missing having Project Inform around right now, and it's really unfortunate that they decided to close last year because, during the course of their existence, they broadened their mission to include hepatitis C, for example, and really increasingly looked at the totality of health access as being part of their mission, and not just specifically, HIV treatment. And so, do we need something like that now? I mean, do we need a group that's just like about providing information and advocacy? And I know, like Lido posted, the AIDS Foundation posted something about sex with relations to COVID, and I know people are doing certain work, but are we seeing enough? I mean, I remember during the early years of AIDS, we had, it seems like a new organization started every week. I think I started a few of them myself. So do we need that?
I also have been feeling the lack of Project Inform, right? Like that was just a wealth of just so much concentrated knowledge and passion in one place. And we are lesser as a community for not having that resource to rely on. I think the reason that we saw a proliferation of AIDS organizations, like you said, like a new one every week, was because nobody was going to do it for us, right? Like there was, the federal government certainly didn't seem to show any interest in stepping in to help us. We had to do it ourselves. Not that the federal government is showing an incredible competence in handling this crisis. I don't know. I mean, there is some good stuff coming out of the AIDS Foundation. But again, I think part of the problem, as Luis was saying, is we don't have accurate medical data on exactly how, when, and where the virus is transmitted, really how infectious it is, really what the fatality rate is. It seems to be different from city to city. What was it, like 90% of people who go on ventilators in New York die, whereas one person who has gone on a ventilator has died here in San Francisco, and we don't know why. So I don't know. Yes, you want to start an organization, Terry?
Yeah, let's talk.
You know what? We don't have to do.
I mean, my hands are full, but I like to get things started and then walk away.
Terry,
but I do want to say, let me just say, Race, and I'll come to you. Is like Brendan, what comes to mind, and somebody else raised this question in the chat. I forget who it was, but the LGBTQ community has a disproportionate rate of depression, anxiety issues, and the resultant effects of alcoholism, drug abuse, and suicide to begin with, and some of us, like trans people in particular, have even higher rates, and in different parts of the country, and then we've got the isolation. So the other side of the coin that people have been raising is around protecting our lives from possible infection. For some people, like if they were going to fully protect themselves, that may be the straw on the camel's back that pushes them into death from something else. You know, and people are experiencing loss of income and homelessness and all those things as a result of COVID. So you compound all those things, and it's really, you know, intimacy and connection become so important, I think. And race, that was a question for you.
Oh, what I was going to say that came to mind when we were having all this discussion, which was all one, that when it came to HIV, we were able to identify a virus and very quickly give people gobs of erotic alternatives, as long as it wasn't insertive. And then once we figured it out, it could be insertive if it was covered, we gave them that option, which was pretty amazing. And the kink community, for example, came in very quickly and gave people all these different variations of what you could do without insertive sex. This is a whole different animal, because talking to each other could spread that, you know, I mean, kissing, we know absolutely could. So we aren't really able to give people great options at this point. And I think we're at a point where people are okay short-term with abstinence or near abstinence. But I think we do need a project informed. We do need a group. Maybe the AIDS Foundation here locally will be that group that gives people guidelines on how to have harm reduction sex with whatever information we do have, because I think there is only so long the abstinence model or the only one person model is going to work. And so I do think we need a project informed, and we need the kind of an all hands on deck to come up with these strategies very, very quickly, because I think it's a time bound thing. And at some point, people are going to decide, I'm just going to have sex and not follow any guidelines whatsoever. So I also miss the project informs of the world.
Yeah, no, and I think some people are doing that, you know, and I think the real danger is that people are doing that on the DL, doing it secretly. I mean, I'm not saying they should broadcast it, but, you know, that they're not like talking about people that care about them, talking to people that care about them. But I have one question for you, Race. It's coming from Jacob. I'm going to direct it to you, which is, what are some of the strategies that people are using to have sex, safer sex, and engage in BDSM that reduce harm? And given how contagious novel coronavirus is, and given all the unknowns, Race, you mentioned sex bubbles, and Jacob would like to hear more about that, as well as other strategies that he can use to adopt and permit his slave to adopt.
A lot depends on, do you live with your slave or not, and are you cohabitating? So I'm assuming that that's not the case. The strategies that are being offered range from remote control devices where you can play with each other over cam and, you know, control each other's butthole or genitals or whatever you want. There are certainly all the solo strategies. There are online sex parties. They're really just big masturbation fests. And there's quite a few of them. You kind of have to get invited into them because you have to know somebody. But
can you post a link for us? I'm just, yeah. I'm asking for a friend.
We'll talk. And when it comes to in-person, unfortunately, it was referenced, you know, could sex workers wear masks? I have a sex worker friend who just did a session with a client where he and the client both wore masks. So it's already happened, so that people are already adjusting to that. But we don't have a perfect way to do anything in person if you have contact with someone else, because you're only as negative for COVID as your last test before you breathe air somewhere. I mean, there's really no perfect, with HIV, for example, you knew. So I think that the strategies are either employ sort of remote things like cam, sex toys, things like that. I know people that literally do masturbation scenes 8 feet from each other in the same room, and they're very much voyeurs and exhibitionists, and it works. When it comes to dominant, submissive kinds of things, most of that takes place between our ears anyway. 98% of dom-sub play really is a mental exercise. So employ that as much as possible, even if the physical can't happen. But I wish I had really good, solid ways that somebody could be physically intimate and have a really low chance of transmission. And I don't think that that really exists yet, because we don't know. As it was pointed out, we simply don't know enough about this virus.
Well, I know you're going to continue investigating and reporting back in your column and elsewhere. Okay, thank you. So I wonder if anybody can like address the question of, you know, as you try to form a sex bubble, let's say, you know, or if you have somebody that, whether you're paying them or they're paying you or not, how do you sort of reduce risk? And I'm not talking about like wearing a mask, but how do you pick a partner that you feel like is potentially less safe than somebody off the street that you don't know anything about? Is there anything? Brendan?
I mean, so, you know, just to touch just a little bit on what Ray said beforehand, fuck your roommates. Yeah, it's an option. You know, I have been actually having a lot of fun with cam stuff lately, but it's like the phone sex we had in the 90s, but like better. That being said, like, I think everybody is going to yearn for human touch at some point or another, or many of us, most of us, right? I do. And, you know, if like, if a condom was a barrier to intimacy, like 6 feet is significantly a bigger barrier. That being said, you know, in the early days of PrEP, I would, and still do, recommend that if you are going to have sex with someone whom you don't know, you might still want to consider using a condom, right? And maybe the safest sex we can have right now is with people that we know intimately, and not have sex with strangers for the moment, sad as that may be. I'm not thirsty anymore, I'm dehydrated. Sorry, I'm reading the comments. Yeah, I mean, that would be my first suggestion. Like, if you have to, if you, human touch is a biological need, sex is a biological need. And you know, the way in which we are protecting ourselves from this virus are detrimental. Like, I have roommates, and there's still days where I'm incredibly depressed and it's difficult for me to get out of bed.
Yeah, so, but I want to like circle back, and you know, and I hear you on the depression thing, and I think everybody's going through different cycles of that, and I just want to encourage anyone that's listening to reach out and talk about that, and you know, figure a way forward to do what you know works for you, to what has worked for you in the past around like working through depression, especially if you're predisposed to that. But I'm not speaking to you specifically about that, Brendan. I'm just talking about generally. I want to say with regard to, you know, picking a partner, a question that comes up for me is like, how do you judge their risk factor? If they haven't been tested, they don't have the antibodies, they don't know if they have the antibodies, how do you judge whether you know them or not? Like, what happens if you know them intimately, but they happen to be, you know, a frontline social worker who's interacting with people that are, you know, possibly COVID exposed on a daily basis, versus somebody that you know that isolates and only gets deliveries. You know, is that a factor for people, like looking at, you know, give them a questionnaire, like how many people have you talked to this week? Or I mean, I think about like the early days of AIDS in the mid 80s. I had a friend who was a sex worker, and he told me about this one client that he hooked up with who literally wrapped himself in cellophane. You know, just wrapped himself in cellophane. And this is somebody that was knowledgeable about HIV, but just had this phobia around it, you know. But here it's like sort of like, you know, amorphous in a little bit. Louise, do you have any thoughts on this from your work?
Just in terms of forming, so I think you were using the language of sex bubbles. There's also the language of pods that people are doing, and I think that from what I've read on them is that, you know, generally one would want to try to seek somebody who has the same level of general risk as they do, and you know, assume that everyone is positive, quarantine yourself for 14 days. And then after those 14 days are up is when I've seen people post that's when they start to open up their networks of contacts. And I think that the component in here that's necessary for this to work and not increase one's risk or increase the risk for other people who one has contact with is that you have to, you know, be very upfront with each other about what behaviors and what potential risks you've engaged in. So, you know, like, you know, if, for example, you know, there's so many different ways of introducing risk right now that we don't know and that we don't understand. And so being able to share that with partners, you know, it's for me, some comparison can be made to the early days of serosorting, right? When we did not have the clinical research data that would follow up with serosorting. And, you know, like now we know that for, you know, serosorting within an HIV prevention context, that it's actually safest to serosort to somebody who's living with HIV and virally suppressed than it would be to serosort to somebody who, you know, is HIV negative or unknown HIV status. And so I think that as much as we can, waiting until there's more data, because there will be more soon, and really trying to get a hold of the data sources that are communicating newer findings in ways that are accessible for folks and that are truthful and based on the current literature is really important. But in general, it's creating pods, 14 days of quarantine. And that's when you can start being around a couple of people, like a very small amount of people.
Yeah, I think that sounds reasonable. And I think part of my own personal frustration about evaluating risk and what is okay is that I just don't have that information. And it's so difficult to find any sort of information, whether it's a study or whether it's anecdotal, certainly from the administration, but also from the medical community. And one thing I actually found before this, I've been doing a lot of reading just especially in the early days of the AIDS crisis. And I'm sending a link. I identify as an archive queen because I just love historical documents. And one of the, I think, most amazing documents that came out of the early years of the AIDS crisis is called How to Have Sex in an Epidemic. And I think it provides, it's from 1983. It was written by two doctors. It was actually edited by Richard Dworkin, which is pretty cool. And I think it gives a really good template for what I would hope physicians who may be listening or who may be also frustrated about their own inability to get their own observations out to the wider community. So whether they identify as queer or, you know, they have a lot of queer patients, I think we need to be empowering those who are actually on the front lines to say, these are our observations, and also recognizing that people aren't gonna stop having sex. There are ways of risk reduction without actually staying abstinent. And if you look at the document, you know, it talks about, here's what we know about, even if it's just anecdotal, here's what we know about the risks of fist fucking. Here's what we know about the risks of poppers. Here's what we know, et cetera, et cetera, et cetera. And just having a compilation of all that information, even if it is purely anecdotal, but coming from those who are actually seeing it with their own eyes versus filtered through the government, I think that's one of the really optimistic takeaways of the AIDS crisis, is that you see this relationship between activists and those who are most afflicted and affected, and then those who are studying it or who are treating it without the government being involved. And I think that's a relationship that we should really be trying to emulate.
I just want to point out that Landy Cranston, I'm sorry if I mispronounced that, in the comments made a really good point, which is our decision on what risk to absorb isn't limited to our risk. Like, it often has more to do with the risk we are putting other people at, because we are probably at lower risk, many of us here on this chat, than you can accept more risk if you live alone and you don't regularly interact with someone who is elderly or immunosuppressed. If you have roommates or you are a caregiver, you by necessity can assume less risk.
Yeah, that's a good point. And I mean, information is definitely changing as we go. And remember, seems like a year ago, but it was actually just weeks ago that the CDC was saying, don't wear masks, and then it was suddenly, people were saying, well, what about common sense, and so they had to say, and I think about, during so much of the AIDS epidemic, the messaging was that oral sex is unsafe, and so people were like using a condom with oral sex, and I was like, ugh. And then it turned out, well, actually, common sense led you to suspect that it wasn't actually particularly unsafe, and so people just began doing that, and I think that we saw that happen a lot. But yeah, I think with masks in particular, they're not so much to protect us, they're to protect other people from us, as asymptomatic, or a great proportion of people who are actually infectious, and spreading it unknowingly. So yeah, so this is like it's interesting. I mean, with AIDS, it was a public health issue as much as it was about a person-to-person risk issue. And here, that seems even magnified, that there are repercussions and of consequences of our actions. And so that kind of like circles us back to the shaming question. I just want to get to one quick question, and I know my mom might be watching, and I apologize, I got in trouble with her last week. But I do want to ask, because I want to know, what do people think about glory holes? Race.
Because I don't think we can say that they're any safer than any other mechanism. I mean, it's probably safer than kissing, but that person could have just taken saliva and played with their penis, and bam, there you go. Frankly, I love them, so I would love to say I think they're safer. I don't. I think the point it made earlier, the only real good harm reduction is 14 days, you're good, and keeping yourself to those people. I know people that have buddied up, and they're living together, they're quarantined together, and they figured that's how they're going to have sex through, until they have more information. So I don't think glory holes are safe.
I guess we have to wait for the study, I don't know.
Yes.
Okay.
I mean, it's contracted respiratory. So even if somebody's saliva, if somebody had their saliva on their dick, then, I mean, if the other person sucks it, then they would get it, right? I don't know.
Right, because we're saying kiss it. Well, you make a good point. We need
but like dick and ass,
yeah,
equals less risk of COVID, right?
Yeah.
Well, I don't know about the anal sex and less risk, because there have been several studies that have found fecal matter to be a source of testing for COVID-19. So, there's I think that staying away from a butthole as much as we can is probably the safer thing. So if one would be using a glory hole, then I think that a blowjob with a condom that you could cheek would, or you just slap, whatever, it's a glory hole. It's not like, you know, you put a condom on it. But I think that glory holes to me sound much safer if somebody is going to engage in sex with somebody, particularly if, you know, it's somebody who they don't know very well. That is a harm reduction measure. Again, that is a harm reduction measure that we don't know what the level of harm is.
Yeah.
You know, so if somebody is going to engage in behavior, if they must, then that seems like a way to incorporate harm reduction with the knowledge that we don't know what this harm is.
All right. No, I see my boyfriend coming in. I see
unless
my
we're talking
boyfriend coming in here. We're gonna get in trouble. Celestina, go ahead. Go ahead.
I was just going to say, just recently a friend sent me a text message that had a lovely image of a magical unicorn in the glory hole. So it seems like that probably would reduce your risk of COVID-19.
If you want to post it in the chat, but you know, here, I mean, we're talking about two different paradigms at the same time. We're talking about clinical levels of risk around specific acts, but then separately we have to talk about who is it, you know, and what is their risk factor level, and then they have to look at it and say, what is the level of risk that the other person does, and what level of risk am I willing to accept to take home with me, or what have you, and you know, so this is tough. We only have 5 minutes left. I apologize to everyone. I think we got through a lot of the questions in one way or another, I'm hoping. And I just want to give everybody a chance to make a 1 minute final comment. And if you need a prompt, maybe, what do we do about sex? And, you know, where are we going to be 3 months from now, 6 months from now? What would you like to see us doing?
I'd like to see us keep talking like this, because information is power. And I think we're going to have to get the information sometimes ourselves via various mechanisms. And what goes into harm reduction around the sex for COVID-19 is significantly different than HIV, because it's a stew of factors. It is not one single transmission factor. So it's a tough decision to make. And I think we have to accept that each individual is going to make a different decision. But boy, I hope they do it with good information.
Yeah, we have to talk about it publicly, but then I think as with HIV, it was always about talking with your partner, you know. Maybe that really speaks against the glory hole idea. You know, it's really, you have to talk and say, you know, are you positive? Are you not? Have you taken the antibody? Yeah. Celestina?
I just would say that I would really love to see us judging less, supporting more, and providing resources, being generous with each other, and even more so than, you know, than we already are, because it's ourselves and our communities that's gonna, you know, that's gonna keep us as safe as we can, and, you know, and loving us, and, you know, helping each other out with information, resources, support.
Yeah, that's great. I think everybody's got a story, and everybody's got their own set of circumstances, and just from the outside, you can't really know what everybody is going through and what the issues are. So yeah, that's really important to remember also. Luis?
Yeah, I think that right now, just thinking through sex and COVID-19, the most important thing is to put pressure on our electeds to be able to provide increased resources for our communities, and also to be able to conduct the research that's necessary. That we need not only biomedical research, which is the only thing being funded right now, we need behavioral health research. And then I'm just going to put a plug in that if anybody currently has a job, isn't able to work from home, to please donate your income. Donate a good chunk of your income, because so many of my community members are just struggling in ways that I could never imagine things getting worse for them. And it's really happening. So I think that as we're thinking through what sex looks like in terms of COVID-19, we also need to remember that people have other basic needs that are not being met.
Great. Thank you, Luis. I'm so glad I had you on the panel tonight. Thank you very much for being here. I'm going to go to Eric. What do you got?
Well, I think, not just empowering doctors to be sharing information about how to be sex positive and how we can reduce our own risk, but also just ordinary citizens, regardless of so many people don't have the luxury of employment right now and are literally just sitting in their homes. And I think with that time, let's use that to actually mobilize, and also remember that with the internet now, the work that ACT UP did in the 80s and 90s of getting information into people's hands, which was so crucial, is easier than ever before. And just because, you are not a doctor, you are not an elected official, does not mean that you can't do the research yourself. You can find data, you can read these graphs as well as anyone else, and perhaps even better. And I think that's one of the most important lessons of the AIDS crisis, is just how effective and how brilliant just ordinary citizens can be if they share information, they share their research, and it'll blow physicians away. It'll blow elected officials away. And now that we have the internet, if you're watching and you know how to code or you know how to make a website and start compiling all the data you can find about, what is my percentage risk of transmitting COVID if I go to a sex party with 5 people or 10 people or 15? What about just one in a week? Even if it's anecdotal, it's better than nothing.
Yeah.
I think
that's a great point. You're speaking straight to my heart. And it's hard because we can't have meetings to do that, but I think there are ways to connect. We started a group actually recently on Facebook. It's called, for the Bay Area people, it's called COVID-19 Working Group SF Bay Area. Check it out there. It's just another place to sort of share information and ideas. Brendan, take us out. We're into overtime.
So I guess if I have one thought I want to leave you with, it's that we need to count on each other. Sex workers aren't eligible for government grants, and the federal government is not going to give loans to gay bars. It's just not going to trickle down that far. Like you said, if you have a job, donate to your local gay bar, donate to a sex worker relief fund. If AIDS taught us one thing, a lesson that I think that we forgot in the subsequent years, is that we are all in this together. Nobody is going to look out for us as good as we're going to look out for us. And I think that in the good years, we got used to squabbling with each other, and maybe sometimes for good reasons, and maybe the good times are a time to squabble, but I think these times are getting rougher, and they're only going to get rougher, and we need to circle the wagons.
Great, thank you, Brendan. And I'm so pleased that we had this conversation tonight. There's so much more that we could say, and I would love to have you all back again for one form or another next week. Please join us for Pandemic Art. And speaking of donations, tonight's event was free. If anybody would like to support the work of the Historical Society, we, like many nonprofits, are suffering a reduction in our income right now and are looking at difficult times ahead. So please go to glbthistory.org and consider becoming a member or making a donation of any size. Thank you, everyone, again, and wash your hands. Have a good night. That's great, Brendan. Brendan, love you. Thank you. Love you all. Have a good night.
Thank you, Terry.
Thank you, Terry.
Bye.
Thank you, panelists.
Bye, y'all.
Thank you.